Good morning. Hello, everyone, and welcome to Careers in Psychology. Thank you very much for coming along this morning. We're looking forward to a day of presenting to you information about different career pathways within psychology. I'm going to start off and introduce myself and my colleague Natalie firstly. So welcome, my name is James. I am the Careers Manager with the British Psychological Society. So my role, I've been with the BPS for just coming up to 6 months now, and I have a background in careers advice and guidance, and my role is putting together a careers schedule for members of the BPS and also non-members, so events like today. I'm really pleased to be joined by my colleague Natalie as well, and we'll just hand over to Natalie to do a short introduction.
Thanks, James. Yes, hello, my name is Natalie Billing, and I'm the Partnership and Careers Liaison Lead for the BPS. I've worked for the BPS for the past 18 months and I've transitioned over from the membership team in July to help support James in the newly developed careers team. I work with James to implement the strategy that James has put together to support all of our members' careers journeys into and through the psychology field. Part of my role is also to develop links and liaise with various external partners who have an impact and an input in psychology as a concept and possible career option. Thank you.
Thank you, Natalie. So just to give you a very brief overview of today, and then we will go straight into our published schedule. So we're going to start off shortly with a few welcomes from the President of the BPS, Dr. Catherine Carpenter, and our BPS Student Committee. We're then going to go straight into our programme. We're really pleased to be joined by some really inspiring speakers and individuals today, and I'm really excited to hear about what they've got to say and to share with you. You should have been sent a programme ahead of today, but we are going to start off with clinical psychology as our first speaker, and then we will be moving on to the Psychological Professions Network, followed by a panel session just before lunch where you can ask questions around what can I do after university. After lunch then we're welcoming forensic psychology, followed then by counselling psychology, and finishing the end of the day with Dr. Daniel Jolly speaking about his work. We then at the end have a welcoming some of our speakers back to take further questions from you. Just a little bit of an overview as to how today's session will work. As participants, you can't turn on your microphones or cameras inadvertently, so don't worry about that. If you have got any questions, there is the Q&A facility. So if you have questions for our speakers, myself and Natalie will be monitoring that in the background, and we will be putting your questions to our speakers either at the end of their sessions or at the panel at the end of the day as well. So please do ask questions in there as well. You will also notice we're really pleased today to be joined by Lane and Jenny, who are providing British Sign Language interpretation of today's session. So thank you very much, Lane and Jenny, for coming along. So without further ado, I'm going to start with our first speaker, and we're really pleased today to have a very short video message from the President of the British Psychological Society, Dr. Catherine Carpenter, who's provided us with a short welcome and an overview to today's webinar.
Hello, and a very warm welcome to this virtual Careers in Psychology event. You're here because you're thinking about a future in psychology and are looking for inspiration, or maybe you've already set your heart on it, but either's fine. Our discipline is one that allows you to set off in any number of directions and find the path that's right for you. There are really too many options in psychology for us to cover them all in one event, but we aim to showcase as many as possible. But do ask questions to help make things as relevant as possible to your own experience. We hope that today's speakers will help you on that journey, even if you don't yet know where it is that you want to get to. Some of them have taken the traditional linear route into psychology. Others have forged their own unique path. all of us have had challenges and obstacles in our routes into psychology, some more than others. And this event is about helping you to overcome yours. My own career started out with an interest in mental health. And I initially did a degree in experimental psychology, which was a bit of a shock with arts A-levels. I think I got my worst mark in perception because psychophysics wasn't my thing, and also found the degree a little bit remote from working with people and clinical psychology, which was my first and foremost interest, but it laid the foundations for an interest in the brain. I worked as an assistant in a psychiatric unit for young people with very severe mental health issues, and that again very much piqued my interest. And then, like many people, I struggled to get on doctoral clinical psychology training. I took 2 attempts to get on. And then on qualifying, I took a job in Oxford across 2 psychiatric hospitals in adult mental health, but had always found cognitive assessment of interest and of relevance. I've never quite understood the distinction between the mind and the brain. And so I ended up working in the local neurosciences centre in neuropsychology. Neuropsychology is a fabulous area of psychology because it's an art as well as a science. And because it draws on the foundational skills of clinical psychology, but has an extra database on the top in terms of neuroanatomy, neurophysiology, cognitive models, and so forth. And I got hooked. I ended up working in that neuropsychology job for many years, but in different ways. So I worked clinically with research, with teaching and training. And because in the NHS, neuropsychology is a very small specialism, I ended up getting quite a lot into clinical management. And I think clinical psychologists have a lot of transferable skills. So strangely, in order to protect our specialism, I ended up looking after neurosurgeons. And I guess one of the main obstacles I faced is that neurosurgery is still, I think, quite a male-dominated hierarchical specialty, and that was difficult. So I was appointing neurosurgeons, working out surgical rotas, worrying about beds. But like all challenges, when you roll with it and overcome it, it can be vastly rewarding. And I think that led into a wider remit, which has in turn led into my role in the BPS, because I'm interested in governance and HR and all areas of psychology and neurosciences. One of the things I wish I'd known when I started out as a student was it's okay not to know. So I think I always felt at university on the back foot. I always thought if I was more intelligent, if I worked harder, I would be better. I would get things more quickly. And I don't know if you've ever experienced this, but I've often noticed that at lectures and seminars, it's very often the most experienced, most qualified person in the room who dares to ask a naive question, who has a nerve to say, you know, I've never really understood that model. Can you run it past me? And it reminded me of when one of my kids was going to school and got all wobbly, and we said, you know, what's the problem? And he said, I can't read. And you know, it's the same thing. You don't have to know all the psychological models to go on clinical psychology doctoral training or counselling psychology training. So from speaking to our student members and people who recently finished a psychology degree, one of the things we've worked out is that a key question for all of you is, what should I do next? And it can feel a bit like a black hole, I know, that exists between graduation and finding your way into the psychological professions. And we want to help you with that. We want to help you fill in the blanks and to make that transition easier. And this event is one first step in that direction. So to help with this, for the first time at Careers in Psychology event, we've set up a question and answer panel discussion at the end, which will specifically cover your questions about, you know, what are my options after university. And this will be an opportunity for you to ask questions that are specific to you and your current circumstances and the decisions and choices that you feel you've got to make. So do stay on and take part and make use of that. We know at the BPS that we need to do more to support you with this transition. And as I said, this is just a first step, this event. And our plan is that it shouldn't just be a one-off annual event, but that we're going to be developing a suite of resources for you, led by our new careers team, James Goodwin and Natalie Billings. So I hope you have a fantastic day. We hope that it'll be the start of a long and fruitful journey into psychology and with the BPS. I think routes into psychology can seem somewhat daunting and things can seem a long way off, but I would encourage you to enjoy the journey. You'll probably be in your career for 30, 40 years. There's no rush. Enjoy each stage and each step. And I think psychology has never been more relevant to society and the challenges that society faces at the moment. And we need passionate, diverse, talented people like you to get on board with the profession. So step up to the plate, get on board and enjoy. Thanks for listening.
Thank you very much to Catherine there for that welcome. I'm now going to hand over to Eike Leng, who is the chair of the BPS Student Committee. Eike is going to give you a short welcome and then is going to introduce our speaker. Thank you.
Thank you, James. Hi, everyone. I'm Eike, and I'm the chair of the BPS Student Committee. Thank you for joining us today. We hope this event will allow you to explore your interests, to ask your burning questions, and to get a clearer idea of how to get to your dream career. As you will all know after listening to today's talks, and probably you already know, getting into your dream career requires genuine interest and deep knowledge in the field, and that soft skills such as communication skills, leadership skills, organization skills are very crucial to whether you can actually land the job that you want. Therefore, I would like to take this chance to briefly introduce the opportunities offered by the Student Committee, which can help you move a step closer to your dream job. Okay, so first of all, the Student Committee runs the Psych Talk, which is a quarterly publication for students showcasing student written material on a variety of topics, which include general interest essays to placement reviews and etc. So if you're a member with us, you have free access to that. So do read them and engage with it by publishing your own article so we can all learn from each other. If you want to have a more frequent exchange of knowledge with fellow psychology students, do join our student online community. You can also learn more about your interested field by attending our events. So these are some of the examples of the events that we run every year. And we also have a new program that we're doing now, which is called the Student Ambassador Program. The recruitment for Student Ambassador has been sent out by either your regional branch or university societies. So do have a look at that and apply if you would like to act as a bridge between the BPS and your university. And for the lead student ambassador, which represent all student ambassador within your region, recruitment will open in the upcoming few weeks. So if you have any suggestions for the student committee that would help you better equip yourself prior to your graduation, please do let us know by emailing us. If you would like to join us, please stay in touch by following our Instagram account, Twitter account, and also sign up for our newsletter. So, yep. Okay, so now let's go into our first session of the day. We're very honored to have invited Dr. Jemima Fitzgerald. Dr. Fitzgerald is a clinical psychologist. After her qualification, she worked for a hospice for the specialized palliative care psychology service before becoming the lead for the hospice bereavement service. Dr. Fitzgerald has a strong interest in teaching and has particular expertise in the area of building resilience. She's now the principal psychologist in a male prison where she leads the psychology team in the mental health service. As well as her lead role in the prison, Dr. Fitzgerald founded her own company and works freelance in a diverse range of settings, from private practice to organizational consultancy to working with homelessness, hospice, family care of people with dementia, and the NHS. I'm sure we'll all gain valuable insight into the field from her talk. If you have any questions during the talk, please submit them via the Zoom Q&A function. And I will now pass the time to Dr. Fitzgerald. Thank you.
Thank you. It's so good to be here. I'm just going to share my screen before we get started. So hopefully you can see this. Here we go. Okay, so it's so good to be here. Thank you for being involved and for listening and giving up your Saturday, because I think, you know, that shows an amazing start to the dedication you're going to need if you want to have a career in clinical psychology. My talk today, obviously, it's about my route into clinical psychology and beyond, what I've done since. But I'm hoping there's something here for everybody, whether you want or are interested potentially in becoming a clinical psychologist, or actually if you're interested in any form of using your psychology degree, any career with psychology. I think I hope there's going to be something in this for you as well. Because if you've got a passion for psychology, you're interested in people, you're interested in understanding yourself. And so I hope this will be valuable. I'm gonna, if I just move on to my next slide, what I'm going to share this morning, I'm going to talk a little bit about myself. Now, that's not because I really want to talk loads about myself, but I think it's really relevant to know a bit more about my past, because as clinical psychologists, we don't tend to talk about ourselves much, understandably, because it's not about us, it's about our clients. But actually, for us today, I think knowing some of the obstacles that I've had to face and how I've overcome them and what I've learned through that process would probably be interesting and relevant for you as well, whether you've had a similar journey to me or completely different. There will be things I hope you can take from this. So I'm going to talk about myself. I'm going to talk a little bit about how I came to study psychology in the first place and then become a clinical psychologist, how I've learned to overcome professional and personal barriers, how I've learned to become more resilient, and what it's like to study clinical psychology and my life now as a clinical psychologist. So just to start, as a child growing up I'm a lot older, I'm sure, than everybody else here, in the 70s and 80s, I came from a family where there was a lot of difficult stuff going on, to put it mildly. So I was a victim of abuse in many different forms. And as a child, you think that's normal. You know, your own childhood is all you've known. So for me, I didn't think this was something that was bad or wrong. I just know I felt very sad and unsafe. That's all I knew. And obviously, having a childhood like that affects you. And so for me, how that affected me was that I had very low self-esteem. I felt very different to everybody else. I didn't think I was different to everybody else because I was the victim of abuse. That would have been quite a grown-up, rational way of looking at it. But I felt different to everybody else because I felt that I was inferior. I felt I didn't belong. I was unlovable. You know, I internalized all of that stuff. So growing up as a teenager, I still felt all of that. One of the saving graces, there were a few saving graces, but one of the saving graces for me was I loved school. I really loved school, and I was good academically, so I threw myself into schoolwork, and that was somewhere where I felt that I was good at something, and that was really important to me. But socially, I really struggled. I struggled because I was I felt like I didn't fit in anywhere. So my resilience was very, very low at the time. And I'm telling you this because resilience has become such a passion for me. It's how you develop resilience, how you can become stronger or more able to adapt and cope in life, I guess, with the obstacles and hurdles that we all have to face at times. So school was my saving grace, but as a teenager, when the social side at Comprehensive was such a big part of it, that was really difficult. So eventually, my schooling started to suffer. People used to say that I was painfully shy. That was the sort of phrase that was used about me all the time. I had very poor social skills, to the point where once I actually won it's like another lifetime now, but I won a scholarship to a dance school when I was probably about 11. And I was offered the scholarship, but my parents were called in with me and were told, look, we want to offer her this scholarship, but we need to talk to you. She's had the interview. We need to talk to you about Jemima's learning disability. I was like, I didn't have a learning disability, but my social skills were that low. I felt so unable to speak. I now know I wasn't painfully shy. I was a traumatized child. And so under having that compassion for my younger self has been a really good learning experience for me, that there was nothing wrong with me, but it's what had happened to me. And I've taken that forward in my work with clients throughout my career, is what's happened to you. And I know as clinical psychologists, that's very much part of our training. So anyway, I went through my teenage years, didn't go to university, because although I had been very good academically, my self-esteem was so poor, I didn't feel that I could go to university. So what I did feel I could do was get married and have children and recreate a family. I wanted to break that cycle of abuse and create this wonderful, happy life. And actually, that's not the way to do it. You know, I needed to heal, I needed to learn, I needed to understand. But I tried, and unsurprisingly, through that marriage, it was an abusive marriage. I was a victim of domestic violence for 16 years, so I stayed in that marriage. But I worked throughout my career, and I had lots of different jobs. I owned a shop. I worked as, oh gosh, in so many places. I worked as a teaching assistant. I worked as a manager in retail. I did a lot of different things. I worked as a youth mentor for years. But I was also very, very unhappy. And I had my children. And eventually, in my mid-30s, I thought, I've got to get out. I had been too scared to get out of this marriage, but suddenly I knew it was life or death. So I managed to get out, and I did an access course because I had a dream to become a psychologist of some sort. I didn't really know what a clinical psychologist was, but I wanted to be a psychologist and work with people. And I wanted to understand myself more as well. So I managed to get into university, and I did my BSc at Sussex University and absolutely loved it. And also felt like, what am I doing? I'm not good enough to be here, but really loved it. And that was a wonderful thing. And then at the end of my degree, or towards the end of my degree, the final year, I applied for clinical training to become a clinical psychologist, to get onto the doctorate training. And I was fortunate enough to get in first time. And I'm going to talk to you about that. And so that was wonderful. So I'm just going to move on to my next slide and talk to you a bit about how daunting it can feel to say that you want to become a clinical psychologist, because we all know psychology is one of the most popular degrees that you can do, and clinical psychology is one of the most popular career choices from a psychology degree. So it's really, really daunting to be constantly told how competitive it is to get into clinical psychology training. I know, I've heard it myself so many times. And I know the first time I started to vocalize during my degree that I wanted to become a clinical psychologist, I remember everybody I said it to, bar a few friends, everybody else said, oh, it's so competitive, you're probably not going to get in. And that's hard to keep hearing, because especially when you're doubting yourself already. So you've got to have a bit of grit and a bit of like, no, I've got a dream. So I did have a dream, and I suppose one of the really important things is to start thinking about, well, why would you be a good psychologist? What is it about you? And it's really important as a psychologist that we're not othering. You know, all your life experiences are so precious, so important, whether they're good life experiences, whether they're difficult ones. You can bring that into your career. As a psychologist, a clinical psychologist, you're working with people. And you are working in essentially what you're trying to do is to reduce psychological distress and increase psychological well-being. That's what you're there to do. And you can work in so many different settings. You can specialize in, you can be quite niche and specialize in one particular field, or you can be a bit more broader. So for me, I knew I had a passion and an interest in resilience. How does someone go from feeling really wobbly, really vulnerable, really unable to cope, to be feeling stronger. And so that passion, I did my thesis, my doctoral thesis was, what are the processes involved in building resilience? And because of that passion and that research and that interest, I've been able to work in so many different settings because it's relevant in so many different settings. But I remember, I'll take you back a bit. I remember when I was studying my psychology degree, I was wanted to be a clinical psychologist, but I studied at Sussex University, and they didn't offer that as a course. So I knew I would have to go to a different university if I was fortunate enough to get in. But I also had 2 young children. I couldn't, well, you know, school-age children. I couldn't just move. I didn't want to just move. So I would have to go somewhere. I live in Brighton. I would have to have a university that I could commute to. So for me, Surrey was the nearest one, or Salem. So there were a couple of choices that were maybe 3 choices that were kind of commutable in a way, but it was going to be narrow my choices. So I went to this psychology fair that they were doing at Sussex University, because I thought, well, everyone's telling me I'm probably not going to get in. So what else can I do with my psychology degree? And maybe you're feeling that today. And so I went to this psychology fair, and there were lots of different tables with lots of different leaflets and courses you can do, careers you can do. And I thought, okay, I'm just going to have a look and see what else there is out there. So I went up to this one particular table, and there was some postgraduate courses at Sussex on this table, leaflets. And I started looking through the different leaflets. And the man was a lecturer that I recognised. I think he'd run a couple of lectures that I'd attended at Sussex. He wasn't someone who knew me. And he was sitting behind the desk, and he said, you know, what are you interested in? And I said, well, I'd really like to be a clinical psychologist, but I'm also just looking at what Sussex has to offer if I decide to do something postgraduate here. And he just looked at me and he said those words, well, clinical psychology is very competitive. I said, I know. And he said, and I can tell just looking at you, you're not the type. You're not the type to get in. And I said, whoa, what makes you say that? And he said, I can tell. I can just tell you're not the type. There's a type and you're not it. Now, obviously, that's an appalling thing to say to someone. Let's just make that absolutely clear. But in that moment, as an undergraduate in my mid-30s, I thought, oh my God, all I felt was shame. Now, the anger came later, but in that moment, all I felt was shame. And I just thought, hell, what can he see in me? What does he see in me that makes him think that I'm not the type? And maybe you think there is a type. Maybe there is a type. I don't know. Maybe I think what he meant, I did reflect on it. I think in that moment what he meant, and it's not true, but I think what he meant was a very middle class, obviously younger, confident maybe, I don't know, person that obviously he didn't see looking back at him. And I felt so discouraged in that moment that it took a while to pick myself back up again. And obviously I did, and obviously I've got angry, which helped a bit. But also, I now, years later, I can honestly say, if there is a type, I'm so thankful I'm not it. You know, in terms of a career and having diversity in the profession, I'm so glad that I haven't had an easy life. Maybe he could tell that. I'm so glad. And I just want to say to you that you don't have to be like me. Gosh, no, you definitely don't have to be like me. And you don't have to be like anybody else. You've just got to be you, and you need to know who you are. And that's really important. And that's not a fluffy thing to say. That's a real, develop some more self-awareness, develop more psychological insight. That will take you through into whatever career you go into, whether you have a career in psychology or not, whether it's clinical, whether it's sports, whether it's forensic, whether it's academia, whatever you do, or whether you go into advertising or marketing and use your psychology degree in that way, whatever it is. Know yourself and understand people, and you will do well. There's no question, you will do well. So I'm glad that I'm not the type. I'm glad that we can, as a profession, we can have people from different backgrounds. We need more people from more diverse backgrounds. More diversity can only be a good thing, so that clients can feel that there is someone for them, that there isn't this other type of person that they get to see that's just got it all together all the time, but that they can have a sense of feeling that we're all human beings and we're all equal, and we can talk on a level. That's just so important. We know that, I think it's like 85% of the therapeutic gains that people make in therapy are to do with things other than the intervention itself. They're to do with things like the therapeutic relationship, the trust that's built up, to do with how heard people feel, how safe people feel. So all of that stuff is so valuable. So think, why will you be a good psychologist? And it's a long process. You might get in first time if you apply. You might get in first time. I did, but I had a long process before. So I'm, in a way, I'm not that surprised I got in first time. I'm still very shocked at the time and thankful. But the most important thing, and I think the chair touched on it just before I spoke, was that you need to be process focused, not destination focused. Enjoy the journey. If you're passionate about psychology, if you're passionate about people and learning and just understanding yourself and the world better, you're going to love this. No matter where you go, you might become a clinical psychologist or you might not, but it doesn't really matter. If you have a passion, the world is an exciting place and there will be opportunities for you to use that passion. I absolutely believe that. So, I think that in terms of, who you are as a human being, I talked before about feeling shame. Know that whatever your background, however you feel on the inside, you are good enough to do whatever you put your mind to. And one of the things that I think is a strength of mine is being able to explain complicated issues in a simple way. So when I was at university, I thought, oh, that's just because I'm a bit, certainly when I was doing my training, maybe I'm just not as clever as everybody else. I don't sound as academic as everybody else. But Einstein, there's a really lovely quote from Einstein, and he said, I've written it down, if you can't explain something simply, you don't understand it well enough. So just being able to understand psychology and being able to explain it to your friends if they're interested, explain it to yourself, being able to talk on a level with people so people can relate to you, so future clients can relate to you, is such a skill that I would encourage you to develop. Okay, we'll move on. Okay, so in order to get into clinical training, you really need to gain some good experience. So as I said, for me, I'd never been an assistant psychologist. Obviously, in general, it's good to have if you can, to get an assistant psychology post for 1 to 2 years, or 2 posts, or as many posts as you want. But get some assistant training, because I think that's really, really good experience. But for me, I didn't do that. I had a lot of other work experience that was working with people. And I think it's all relevant. But what you need to do in your clinical application is show why it's relevant. So for me, I'd been a teaching assistant. I'd worked with children with special needs. Now, I wasn't in any psychological profession. I wasn't an assistant. But I did learn loads about children. I did learn loads about working with people. And I also learned what I didn't know and what I wanted to know. So I was able to talk about that on my application. I think that you need to take a holistic approach to yourself right now, wherever you are in your life. And not just be too focused on your application form, but think about yourself as a person, as a human being. What things do you think you need to develop? What are your strengths? And what are the things you need to develop to be a better version of yourself? And if you can start thinking like that, that's going to really help with your application process. So I think, actually, when I started to apply for clinical training, I filled out the blooming long form that there is, and it's really stressful. And I started thinking, oh gosh, what do I say? What have I done? Oh no, I haven't got enough to put on there. And I thought, hang on a minute, every single moment leading up to this point in my life, I think, my view has been preparation to be a clinical psychologist. I can see that now. I'm born to do this. but I've got to show it on my form. So even when I worked as a barmaid, and I've worked as a waitress, and I've worked as a chambermaid, and I've worked as a cleaner while I was doing my psychology degree to fund, my psychology degree, or not the degree, but the living expenses that came with being a single parent. And even when I was working as a research assistant, everything I've done has built up to this point. I've developed resilience, I've developed adaptability and flexibility. I can work with so many different types of people and get along well in different settings. I've learned so much, and so being able to show that in a concise way on your application form is really, really important. I think that makes you stand out. We move on. So, how to help your clinical application? Well, you know that training is a 3-year doctoral clinical course. It's funded by the NHS. There are a few self-funded places now that weren't in my day. I trained in 2010 to 13, so I've been qualified now for 8 years. Your application, and this is absolutely paramount, needs to have a narrative that makes sense. So whatever you've done, lots of experience or little experience, it needs to make sense as to what you've learned. So what is more important than what you've done is what you've learned from what you've done. So if you've done, say you've had 3 jobs, if you can show why you left that job and what you needed to learn to move on to the next job. So if you are an assistant psychologist, or you're working as a PWP, or whatever it is, and then you decided to do something different, why did you decide that? What did you think was lacking? So showing some reflection. So you've all heard the word, reflective practice, reflection. So being able to reflect on what you've done, what went well, what was difficult, what you learnt is really, really important in your application. But not just reflection, I would say being reflective and reflexive. So being reflexive is a bit different. So being reflexive is taking all that reflection and putting it to practice. So for example, you could say, well, I reflected on my work. So for me, I worked as a volunteer with the Samaritans while I was doing my degree. That was one of the things I did. So I did that. And I reflected on that. What was good about it? What was difficult? So I might reflect on that. And what I learned. The reflexive part would be, well, so having learned that, what am I going to do differently? What do I need to do next? Where am I going forward with that? So I hope that makes sense. So if you can show a bit of that, that's even better in your application. So you need to have some clinical experience. That doesn't have to be an assistant psychology post. I mean, it might do. Some universities will have different criteria, entry criteria. So have a look. So for me, I went to Surrey, and that I really liked their application process because I got invited to do a statistics exam, which, I mean, let's face it, no one enjoys this. Well, I don't think many people would enjoy a statistics exam, but for me, it was good because it broadened the net. They invited more people to that exam. I didn't get invited to interview anywhere else, but Surrey I did because they had an exam. So it was more, so whereas maybe some places would invite 100 people to interview from thousands of applications, at Surrey, they probably invited 1,000 people to sit an exam. And from that exam, the top 10% would be invited to interview, if that makes sense. So for me, it broadened the net. So, have a look at the different universities' entry criteria. Some places say you need to drive a car. Some places don't say that. So just have a look. I would just say to you, all of your life experiences, whether they've been successes, whether they've been failures or difficulties or whatever it is, it's never wasted. So develop some understanding about that, and that will help you. And if you can, talk about how that's made you able to relate to people, giving you empathy. Be careful about too much self-disclosure. Be very careful what you share. So an appropriate amount of self-disclosure. So I wouldn't have talked about abuse in my application form as a child, but I might have talked about some adverse childhood experiences, if that makes sense. So just have a think about how you're going to present this in a professional way. Absolutely vital, spelling and grammar on your application form. You would be amazed at how many application forms do not progress because of poor spelling and grammar. So if that's something you struggle with, please try and find someone who would be willing to check it for you, because it's just something that jumps off the page to people who are looking at the applications. Okay, how I learned to overcome professional and personal and professional barriers. We know that this is a huge learning curve. So when I got into clinical training, I'll talk about that a bit more in a minute, but it's a huge learning curve. But wherever you are, you know, doing your degree, I'm sure has been a huge learning curve, not just academically, but socially and lifestyle-wise, everything. There's so much that changes in your life. And that's all good. It's all good preparation. But I remember when I was training as a clinical psychologist, my first client, I thought, you're not seriously going to let me loose on a person on my own. You know, it was quite overwhelming and daunting. And I thought, oh, it's such a huge responsibility. So just that, getting used to that and feeling comfortable with it is, I mean, I think having an awareness of the responsibility is always a good thing, but that initial fear does eventually pass. But it was a big thing. There were so many highs and lows. The highs, a lot of the highs were just the interest I had in the subject, the passion I had, learning about clinical psychology and all these different models and different ways that you can work with people individually, but also systemically, working not just one-to-one. You know, the thing I love about clinical training is you're not just learning about how to work with one patient or client, but you might be learning also about how to work with a team to support that client. You might be learning about how to develop formulations, you know, ways to understand a person that you then share with a much wider system, that so lots more people are actually helping that client. There's so much to learn. So many highs, and the biggest highs for me were when I saw clients have breakthroughs, you know, and you think, I'm just starting, but I know that was good. That session went well. That client really got something from it. And those were the biggest highs. The lows, there were some big lows as well, where I just felt like, you know, traveling into university, commuting for an hour and a half, leaving my children at different people's houses, friends that could have my children to take them to school in the morning. And it was tough, you know. There was, there were a lot. I could talk for ages, and I won't. But there were a lot of lows, but the highs were way, way more. I think for me, developing confidence, you know, I've told you a little bit about my past. So I was someone who struggled with confidence. And I don't now, on the whole. I really, really don't. And one of the reasons for that is I've reframed how I see failure. So really, a lack of confidence is often about a fear of failing. You know, maybe you're frightened about applying to be a clinical psychologist because what if I don't get in? Maybe it's your second time of applying, your third time of applying. And really, failure isn't failure. Failure is an opportunity to learn. Failure is how, when I look back on my life, it's the really tough times that I've grown through. That, no question, no question. The great times, we all love the great times and enjoy them when they come because they are wonderful. Enjoy the highs. But when the tough times come, that is when I've grown, when you've had to dig really deep. And it will be the same. It will be the same for you when you look back on your life. So being able to reframe failure is really, really key to building confidence and learning to be your own best friend, be your own cheerleader, because you're going to need to do that to pick yourself back up if you put an essay in and it doesn't get the mark you wanted, or when you're doubting yourself, talking to yourself with self-compassion. And if you can you will eventually then become your own psychologist, and you're learning things that will help you to help others. So practice being a psychologist on yourself. Encourage yourself, because you're going to be really challenged through clinical training. Okay, I'm going to talk to you about imposter syndrome, because you're probably struggling with it, because I certainly have struggled with it all my life. One good thing is we know that 70% of successful people struggle with imposter syndrome. So hold that in mind. So if you do doubt yourself sometimes, it's because, you know, you are probably reflective, You don't have a huge ego. It's all good stuff. But it's really natural. This little picture sums up how I felt during training. All these people really seem to have it together, and I still have no idea what's going on. I remember on our first day on clinical training, everyone's so excited, so happy to be there. We're all in a big room. There were 34 people on my course. We're all in a circle, and we all had to go around the circle introducing ourselves and saying what our last job was, or how, you know. So for me, I'd come straight from my undergrad BSc, and everyone else was going around the room talking about their assistant psychology post, and they'd worked in this amazing setting and that amazing setting. And in that moment, I just thought, oh my goodness, they've made a mistake. Why have they got me here? And I'm sure other people felt the same, right? I know it. I'm sure they did, but I thought I was the only one at that time. And that can feel really isolating. And it's really important, if you struggle with feeling that you're an imposter, that people are going to find you out, you're not as good as everyone else, or not as good as people think you are, or who are you to be thinking you can become a clinical psychologist when it's everyone tells you how good you've got to be to get in. You need to know that that's part of being a human being, that feeling, okay? So there's no shame in it. It doesn't mean that it's true just because you think it. So all these things that you eventually will learn that we will support clients with, you need to learn it for yourself first. Start having some self-compassion. So nurture that part of you that's feeling so under threat and so scared, and just know that you can do this, that you're a human being, you are worthy of respect, you are worthy of wherever you are right now. And really what's important is to stop looking at everybody else, right? And I'm not just talking about when you're on training, I'm talking about where you are right now, today. Stop looking at everybody else and comparing yourself. You know, there was that quote, I think it was President Theodore Roosevelt said, "Comparison is the thief of joy." You know, I should have been just really happy on that first day of clinical training, really happy that I was there at last. After all that trying, I got in and I was there. But no, I was looking around the room, comparing myself to everybody else and why I wasn't good enough. It was a thief of joy. So if you can just know that you are unique, you're not going to be like me. You're not going to be like the person sitting next to you, but you're you. And what you have got to bring to whatever you end up doing with your career is going to be wonderful, because it's you. And you know, you might end up being a clinical psychologist, or you might go around the houses for 15 years and then become a clinical psychologist, or you might do something completely different that you never considered before. But life is quite exciting, actually, and if you think of it like that there's lots of opportunities that might come your way. So stop trying to be perfect. Don't be too, you know, you need to be very determined with your career. You need to have a lot of grit. You need to have a lot of dedication and resilience, but don't hold on to it too tightly. Know that this does not define you. You're not defined by your need to become a clinical psychologist. You're not defined by any of this. This is a part of who you are, but you develop yourself as a human being. Focus on that, and then the rest, I think, will follow. So that's my tip, really. It's not who you are that holds you back. It's who you think you're not. That's what I would say to you. So, and I speak as someone who's held myself back for a long, long time. And I'm not doing it now. So really, you know, just know that focus on what you can do, what you can bring, and all the things that you find hard. Be aware of them, but show yourself kindness for that awareness. And think of ways of how you can work on those things. So I'm going to move on. So we've got time for a couple of questions, maybe. So there's loads of different settings you can work in once you're qualified, but this is what I did. So after qualification, I went for a job interview, and the first job interview I went for, I got, and it was working in a hospice. Now, that was not something I'd ever considered doing. I'd always, for most of my clinical training, I'd thought I'd wanted to work with children. That had always been my passion. But actually, on every single placement I did through training, I loved it. So I was left feeling quite confused. I thought, I love my adult placement. I love my older adults placement. I love my learning disability placement. I loved working with children. Children was my specialist placement. But I liked it all. So I thought, gosh, I don't really want to limit myself to just working with children. I want to be able to work with anybody. And then this job came up in a hospice, and it was working with palliative care and bereavement, which hadn't been something I'd ever considered. But it made me, when I went for the interview or doing the research before the interview, I realised that this was a really holistic way of working with people from all sorts of backgrounds. There was no age limits. There were no mental health diagnosis limits. It wasn't just one particular pathway. It was working with people who were really struggling with the toughest things you can face in life. And I just thought, this is brilliant. I'm interested in building resilience. I want to work with people who are in pain, who are really struggling. So I worked there. After a year, became the lead for the bereavement service there. And I developed skills there in therapy, but also management. I've developed skills in teaching and leadership. I did a lot of teaching there, ran a lot of courses. And then things opened up for me. I got asked to give a TED talk on resilience, which was amazing for my career, and a real opportunity to reach a wider audience. And I got asked to speak at a lot of conferences. And after about 3 or 4 years there, I decided to start up my own company, because I was getting so many requests to work in different settings that I thought, oh, why not? So I reluctantly left the hospice, but I still was involved through my company, running a lot of supervision for them, and still ran a lot of training courses for their staff and for the wider community around the hospice. So that was good. I also then worked with a charity, a dementia carers charity, developing a resilience program for family carers of people with dementia, which I loved. And I became a director of that charity, and I absolutely loved it. And then I carried on with all my other sort of private work that I was doing, working in different settings with homelessness, really just building up a portfolio of working with so many different client groups, but always with an emphasis on taking people who are really, really struggling and to try and understand them and to try and help boost their resilience and mental well-being. And then I got offered a job about a year ago at a prison, which I'd never considered, but I think working in homelessness gave me an insight into that sort of people who are in and out of prison often. So I work in a male prison now. I'm the lead psychologist in the mental health team, which has been a completely different type of job. I wouldn't have been able to do it when I was newly qualified, I can say that, but not in the way I'm doing it now. But I absolutely love it. And not just the client work, but also the work with the wider teams, with the prison officers, helping to bring a psychologically informed way of working has been, oh, I love it. I can't tell you how much I love it. So that's been wonderful. If I move on to my final slide. So 3 days a week, I work in the prison, which I absolutely love. So this is working with, it's a prison population of about 700 people, men. It's a remand prison, so there's a really high turnover. Sometimes people are there for years, but sometimes people are there for months. Sometimes people are there for days. And everyone who gets a mental health referral, which is a lot of people, I mean, most people in prison have had a lot of trauma. So I work in a very trauma-informed way, understanding that that trauma is usually behind most of their mental health issues. If they need a psychological assessment, I would be facilitating that with the team. And I work individually with patients there, but also working, as I said, with the wider staff teams. And it's a big job. I can say, as in there's a lot to do, and I feel like I'm only just getting my teeth into it really, but I love it. And on the other 2 days a week, I facilitate supervision for other clinical psychologists, psychotherapists, social workers. I run supervision groups for doctors and nurses. And I also work with homelessness or people at risk of homelessness, and staff, a lot of work with the staff that support them because their resilience is often challenged. So that's my main job. I suppose as my take-home message, I would just say, just don't compare yourself to everybody else, and just know that this is your journey. It might, as the chair said at the start, it might be linear, or it might go on a bit of a wiggly line. but try and enjoy that process. Follow your interests, and you will always be passionate about your career. And I think if you have that flexible attitude, that's just good for your resilience in life in general. So that's what I was going to say.
Dr. Fitzgerald, thank you for sharing your inspiring story with us. As an undergraduate student myself who aspired to become a clinical psychologist, I've also heard the phrase, you want to get into clinical psychology? That's very competitive. And often the next phrase that they give me is good luck then. And I'm sure a lot of other students have similar experience as well. And instead of just saying good luck, you have provided us with a lot of practical skills into getting a step closer to our goals. And more importantly, you have shared with us the potential challenges and reminded us that failure is not failure. Failure is just an opportunity to learn. So thank you very much for that. I am sure we all feel more prepared and confident now. So there are a few more questions from our audience. So one of the question is, what are your thoughts on getting a master's to become a clinical psychologist versus becoming a psychology assistant, then trying to get into a doctoral training course?
Okay, thank you for that question. I think, so there's no set way, right? And I know that makes it harder for you, because it would be so much easier if someone said, well, this is exactly what you've got to do, and if you do this, it will all work out okay. I think I would be looking at what the gaps are. So if you've got a first-class degree in psychology, for most clinical doctorate training programs, you probably don't need a master's. That's what I would say. Having said that, if you think that you would enjoy the master's and really love it, and it would add to your CV and all of that stuff, then by all means go for it. But if you've got a first-class degree, I wouldn't do it. I would look at what the universities that you're applying for, I would look at what their criteria is. So if they're saying you need a high 2-1 or above, then that should be okay. I personally would probably go for the assistant post, but most people that I know did do a master's and then applied for clinical training. So I don't think there's a set way, but I personally think that if you're able to get a first-class degree, I don't think you need the master's. I would go for the assistant. And if you don't, if your degree is lesser, then I maybe do the master's.
Great, thank you. Another question is about, once you become a clinical psychologist, how can you progress in your career, and what other positions can you take?
So is the question, once you are a clinical psychologist?
Yes,
yeah. Lovely. Okay, well, I think it depends what your area of interest is. So for me, I didn't start out, most people start working for the NHS when they graduate, when they qualify. So you would, if as a newly qualified clinical psychologist, you would be employed probably at a band 7 level in the NHS. And then you might hope after a few years or less than that to find a job at an 8A level. That would be the next, which is where you have a little bit more management or leadership. You might be supervising people at that level. I didn't do that. I went straight into working for a charity. As I said, I now do some consultancy work for the NHS, but I didn't go and work for the NHS. Wasn't like a conscious choice. It's just the job that came up. And a few people said to me when I was training, oh, to look good in your career, you need to have done some time in the NHS first. But for me, I didn't. So I don't think that's true. I think the career market has changed a lot from maybe 20 years ago. So I think find an area that you're really interested in. So as I said before, if you know that it's, for example, it's children that you want to work with, then look for that initial band 7 post. And then once you're in that post, just, there might be some opportunities within that service, but more likely it would be somewhere else that you would go for the next step up. But for me, I never wanted to just limit myself to one particular field. I wanted to, I think because I was interested in resilience in general, that kind of enabled me to feel that I could work in lots and lots of different places. So I think the most important thing is at band 7 level, you want to be working towards being able to supervise people, build up some different skills, and then you will have the right stuff on your application form to move up the grades. So the bands, sorry. So yeah, management, teaching opportunities, like really, really work hard to develop your skill set, I guess, at band 7.
Thank you for answering these questions. I know that there are a lot of other questions expressed in the Q&A chat function. However, due to the time, we won't be able to have them all answered now. We'll try to answer them in the chat, and we can also address them during the panel discussion later today. I'll now pass the time to Edward to introduce our next speaker.
Thank you, Aiko, and thank you very much, Dr. Fitzgerald, for such a wonderful and personal story. I have the honor of introducing 3 speakers, and they're going to talk about the Psychological Profession Network and what other professions are there, because we all know that there's more to just, being a psychologist per se. So with us today, we have Jody, who is a trained clinical psychologist, and she worked in various roles, which I'm sure she will talk about. She did her dissertation in harm, and she focused on consent in clinical psychology. We also have Amy, who's a psychological well-being, and she worked as an assistant psychologist before, and she works with mild and moderate mental illness at the moment. And we also have Claire, who is the program manager of the Northwest Psychological Professional Network. And I know she's also working as a lecturer. So on top of that, she's also doing some advisory work. So I'm really glad to see such a widespread of experiences and roles. So I look forward to hear from you. Thank you for accepting our invitation.
Thank you, Edward. Can you give me the thumbs up to let me know that you can see my slides?
I can see you and your slides and hear you.
Excellent, thank you. And thanks, Gemma, for such an inspirational talk about clinical psychology. I'm here with Jody and Amy for the next half an hour or so to talk to you about the wide range of psychological professions that we have that are growing within the NHS. Gemma mentioned working within the NHS. I am the Programme Manager for the Psychological Professions Network, and we are an organisation that are growing and developing across the regions within the NHS in order to promote and enable the development of psychological approaches for across health and care. So clinical psychology is one of the professions, and probably one of the professions that people know the most about, but actually we have a wide range of professions, and part of our role is to help people understand those professions and think about the different routes by which you might get into a professional career using psychological approaches. So as part of the work of the network, we have taken some time to work with the British Psychological Society, with the NHS, with service providers and the universities to develop a career map, and supported by some information that will help you understand really the breadth of the roles that are emerging. And what we want to do today is give you a taster of those 12 roles, give you a little bit of an insight about what it's like to train and work within psychological professions, and also to signpost you to where you might find out more information in order to think about whether this might be a role for you or whether this is something that you want to train in. If you're thinking about there will be people that already are thinking about what kind of education they might want to be doing at a university, but there might also be people that are thinking about what qualifications to do as part of the end of their school years. And what I'd like to emphasize really is that there is a career ladder. So Gemma described how, as a clinical psychologist on qualification, you would be looking at what we call Agenda for Change Band 7, rising to band 8, 8A and beyond for clinical psychology. Within the NHS, that's pretty kind of midway within the career framework, within the salary scales. The growth of the psychological professions is now allowing us to bring in people in professional clinical roles through the range of roles, through the range of the pay scales. So we have people that are training on band 4 and moving into band 5 on qualification, and those roles are expanding within themselves. So let's have a look at some of the things that you might want to consider when you're thinking about, actually, would a career in the psychological professions be something you might want to consider? So I know that Gemma talks also about the sorts of things that might interest you and what might bring you into a psychological profession. And I guess I would just offer some questions to you really to have a think about. So if you're interested in what makes people think, feel and behave in different ways, or if you like to listen to other people's ideas and perspectives, do you like doing things as part of a team? Do you wonder how our psychological health can affect our physical health and well-being? And also, do you have your own life experiences that might help you understand others and make you curious about others, and want to solve problems and help people change? Well, if you answer yes to any of those questions, then a career in the psychological professions is probably something that you would find very rewarding, because these are the sorts of things that we are doing within our roles. So let's have a think about who are these roles. I've got a short animation to show you that explains very succinctly in a much clearer way than I can about what those roles do. But before I share you with the video, I'm just going to stop sharing and go back in again, because I realised what I haven't done is turned on my volume, which of course is going to be really important. So let me just share sound again. I knew that was going to happen. We've practiced it so many times and still it worked. Still we have the hitch. Okay then, so let's hear who are these 12 professions.
There are 12 different psychological professions. They all help with understanding the mind and making changes to improve well-being. But each one uses different kinds of approaches to help with different kinds of distress and difficulty for different people. Together, they help develop emotional well-being and provide support for the challenges we face throughout our lives. Clinical psychologists, counselling psychologists, forensic psychologists, and health psychologists all draw on psychological theory to tackle specific problems in health and social care. Using psychological science and talking therapies, they work directly with patients, families, and groups, as well as with staff, teams, and services. Cognitive behavioral therapists, counsellors, adult psychotherapists, child and adolescent psychotherapists, and family and systemic psychotherapists use specialist talking therapy skills, usually with specific groups of people. Psychological well-being practitioners, children's well-being practitioners, and education mental health practitioners provide brief psychological interventions for specific populations. While all psychological professions have their own unique approaches, they are all part of a single family. Applying a huge wealth of psychological knowledge and research, these professions offer evidence-based, specialist care in all kinds of contexts, supporting the work done right across health and social care services. We need to expand the psychological professions, because at the moment, not everyone can access the right help when they need it. We want people who have life experience and great people skills to become psychological professionals. And there are routes in, whether or not you already have a degree or healthcare qualification. To find out more, visit the Psychological Professions Network website.
Going to do, I think, go back into there we go. So I think by looking at that animation, we took some time to produce this animation because I think that there is there is probably less knowledge and awareness of the range of roles that we have, and that's not surprising because there's been a very large expansion of the psychological professions, particularly over the past 10 years, and increasing in growth around NHS initiatives, for instance, like the Improving Access to Psychological Therapies programme, which has been building a range of new roles, particularly the practitioner roles that were described in the animation. So what I'd like to do now is to hand over to Jodie and Amy, who are going to talk a little bit more about what it's like to train and work as a clinical psychologist, as trainee clinical psychologist, which Amy is, Jodie is currently, and Amy is going to talk about working as a psychological wellbeing practitioner and what led her to choose that career route to come into the psychological professions. So I'm now going to hand over to Amy and Jodie.
Thanks, Claire. So my name is Jodie Wells. I'm a trainee clinical psychologist at the University of Liverpool. I'm in my final year, so I've got about 8 months left. And at the moment, I'm doing a specialist placement, a leadership placement with the Psychological Professions Network.
Okay, so I'm just going to ask Jodie some questions about her career and how she got into this role as well. So Jodie, what attracted you to that role?
Yeah, I mean, it's an interesting question. I think I've had an interest in kind of mental health, distress, well-being from quite a young age, really. I have an interest in people generally, in sort of hearing people's stories, trying to make sense of things that can feel quite senseless, I guess, at times. And I feel really, it's one of those valuable roles that feels, really good to sort of support someone on a journey of trying to kind of work through distress and make changes that make their lives better. But I fell in love with psychology at A level. Everything else felt quite difficult, and that felt like it came quite naturally to me. But I didn't know what I wanted to do, if I'm honest. I'm a first generation in my family to go to university, so I didn't really have kind of the infrastructure around me to sort of support or motivate or make sense of like what a journey into psychology could look like. So I just sort of felt my way, really. Finished my undergrad in 2008, so quite a while ago, and went and got experience straight away. So worked on mental health wards and in the community. But ultimately, I wanted to progress through the system, and I sort of have worked my way up as opposed to kind of having a set journey. Clinical psychology in particular, I was, I guess, attracted to the variety in the role. Like no 2 days really look the same. There's lots of opportunity for, I guess, to use a variety of models and to kind of, use a lot of different skills in the role and to work across different services and to different groups of people. So yeah, that's sort of what attracted me to clinical psychology over other types of professions.
Oh, great. That sounds amazing. And what experience did you have before you got onto the training?
A lot, to be fair. Because I didn't really know what I wanted to do for quite a long time, apart from wanting to work in mental health, I just sort of picked up loads of different experiences. So when I think I left my undergrad at 23 and I went straight into work into a CAMHS placement. It was a secure CAMHS, that's child and adolescent mental health services. And I worked as a support worker. I then moved after about a year into high secure services. So a clinical forensic service. And I was there for about 8 years because I loved it and because I got to do lots of different things. So I was a healthcare assistant for a while. I then moved into sort of becoming a therapy assistant before moving into doing group therapy. So I would run groups, different types of groups, some for mental health distress, some offence related. And then, progressed to assistant psychologist. After that, I was seconded, so I was allowed by my place of work to move for a day a week to community perinatal. So working with women who were pregnant or had just had babies to think about bonding with children and sort of distress and how to manage during quite a tricky period. And then I left after about 8.5 years finally and moved to IAPT. So improving access to psychological therapy service, where I trained to be a high intensity therapist. After that training, gratefully, I got into the doctorate pretty soon after I completed that. So I didn't work there for very long. And that's sort of where I've been. I've been at the University of Liverpool for 2 years now, coming up to the end of training. And again, no idea what I want to do after. So.
Lovely. And what do you enjoy about your role at the moment?
There's not a whole lot I don't enjoy. I feel massively privileged to work with the people I work with and to support people through quite difficult periods of their life. That has never changed. It feels like a really important role and something that is just a privilege really, and that feeling never goes away even if you're having a bad day. Just being able to sort of sit with someone in distress and help them to make sense of that feels very special to be a part of that for a small part of someone's life. Like I said before, I like the fact that no 2 days are the same. You're doing different tasks every day pretty much, depending what your work week looks like. So assessments, therapies, supervision, there might be some group work, liaising with sort of other multi-professional members. And I really enjoy that in psychology. You have the time to think and reflect. It's a really important part of the role. And that it feels like a privilege because lots of other roles don't necessarily get the amount of time we get to really think about what we're doing and the best ways to support someone.
Oh, fab. And what would be your top tips for anybody who's thinking about the clinical psychology training?
Got lots of top tips, if I'm honest. It's a really difficult journey, I'm not going to lie. I've had an unusual journey. I'm 36, almost qualified, and I probably haven't done the normal route. So I got a low 2-1 in my undergrad because I was enjoying myself and not really thinking about what I wanted to do in the future. I don't have a master's. I do have sort of 12 years experience in the NHS, but not as an assistant psychologist, doing lots of different roles. And I wouldn't give up any of that experience because I think it's really benefited me on training. Having so much clinical experience has helped to feel a bit more confident, to not get caught up in kind of that imposter syndrome as much, I think. Mm-hmm. I think the main tip for me would be sort of learning to embrace yourself. I think it's a profession where you feel like you have to fit, and when you don't fit, or when you don't feel like you fit, it can feel really hard. I come from a working class background, from a Romani Gypsy background, and there are lots of other ways that my identity intersects and doesn't necessarily fit into what people assume as a clinical psychologist. And I hid that for a long time. And I think for me, embracing that and putting that on the form, and like the clinical application form, and bringing all of my experiences and all parts of my identity into it, because those are the things that are going to actually help you to connect with the people you're going to be working with. So that would be my top tip, to not hide and to embrace all the parts of you that make you feel like you'd be good at this job. And lastly, have something outside of psychology, because it's quite a difficult job. It can feel really consuming, so have other things to enjoy.
Lovely. Well, thank you very much for answering those questions. So I'm just going to introduce myself. So my name's Amy, and I have recently qualified as a psychological wellbeing practitioner. So I'm just kind of gathering more knowledge and building on the skills from my training that I've recently completed.
Yeah, so I'm going to repeat the questions that Amy asked me and just get a bit more of a sense of her role and the service she works in. So Amy, what attracted you to your role?
Well, same as you, I've always loved psychology, and again, it started in A-level, and it felt like the only thing that was really fitting. I kind of like just got that kind of like information and knowledge, and it kind of came naturally to us. And I kind of wanted to just like continue to build that knowledge and expand on everything that I learned in university. And I'd done a lot of research on the PWP role, and I found that that could offer us that. So because of the diversity of the role and the different client presentations that you see on a day-to-day basis, it would help me to then, of course, like learn and of course, like engage with that knowledge and put it into practice. And as well as that, I've also had my own struggles with mental health issues as well. So I've struggled a lot with like kind of like depression and postnatal depression as well in the past. So and not only did I want to build knowledge to be able to help others, I also wanted to kind of build knowledge to help myself as well. So it's kind of like being a two-way street for this career. So not only can I help other people, but also learn skills to know how to help myself in the future as well.
Amy, did you have any experiences prior to being a psychological wellbeing practitioner?
Yeah, so during my degree, I was quite fortunate because I had some mental health professionals in the family, so I knew like how competitive the route was into these types of career. So I started off with kind of like support work. So I'd done that for 3 years during my undergraduate degree. And then I thought about kind of like developing experience with a different client presentation group. So I started to do a bit of bank teaching assistant work after that. And that was really helpful again, because obviously the presentations with working with children are different to, of course, working with adults as well. And then after that, I was fortunate enough to land a voluntary assistant psychologist position. That was only 1 day a week, and it was working with like acute mental health. And I really found that interesting. I'd done a bit of group work on that role as well, and it really opened the doors to help me get my foot in the door for a paid assistant psychologist job. So prior to my role now, I did work in a neuropsychology outpatients unit. And again, that just helped me kind of like cement the fact that I wanted a career in psychology to be able to help people.
Right. Lots of different things.
Yeah.
So what do you enjoy most about your role now?
I think about like the same as like what you said. Every day is different. So what obviously you do assessments, you do treatment, you do groups, and you liaise with other services as well. So of course you're constantly building that knowledge as well. And even though you're doing like one type of intervention, so CBT at low intensity, you're also making sure your sessions are tailored to each and every client coming through the service. So even though you're using the same basis for the knowledge, you're still adapting that. So every session is different, even though you're using that same intervention. And also just to be able to build your knowledge on how different people can present. So even if somebody is experiencing depression, their experience is completely different to somebody else as well. So it gives you that like big broad knowledge of like how things present in people.
Yeah. And if you had sort of any top tips for people listening today, what would you say?
Yeah, so again, I've got loads of top tips. Like we said, it is really competitive. And I think that's one thing that we need to remember, even though it is competitive, if you're coming into this role, that if you don't get in, it's not a reflection on you yourself. It's just because of the competitiveness. So you should remember your self-worth. And of course, to let your own personality like shine through on your application and of course your interview if you do get one. Obviously, they want to see who you are outside of work as well, and not just this perfect candidate, which I think each and every one of us all strive to be at one point. And of course, again, like what you said, just making sure that you have that life outside of your career. Again, the role is like quite a high caseload role. So you need to be able to have that time to relax and have that time away from work. So yeah, so they're my top tips.
Oh, thank you. I think I'm going to invite Claire back now to share some, well, a final slide.
Yeah.
But yeah, thank you.
Thanks, Jodie and Amy. And I think that what you've done really well in that short conversation is given us an idea of the breadth of the sorts of ways in which you can work within the psychological professions. And also, I think I've seen some of the comments coming up in the chat about it's really encouraging to see people that have come through the route maybe as at different points in their life, and having people that maybe have done other things and contributed to their career in that way before they've ended up within the psychological professions, that this isn't something that there's something that you can bring your own life experience to it, and that actually is a real benefit and something that's seen as very valuable. So thank you. What I'm going to do now is I'm going to share with everybody the career map that we've developed as part of the psychological professions toolkit. Can you just give me a thumbs up that you can see that, Jodie or Amy? Excellent. So I thought the best way to explain this was actually to show you the web page. You'll get the details of this in resources. The links to it will be in the resources that will be made available after the event. But what we have here is the web page, and I'm just going to take you through it so you can see how it looks. This is actually on the website for the Psychological Professions Network that you can see at the top here. And there are a number of tabs. So if you want to know more about the psychological professions in general, network in general, and the work that we're doing, do take a look at the whole of the website. But this webpage is just the access by the tab here, the career map. And what we have is, you'll recall we looked at the 12 professions in the animation. And we have here the 3 groups of psychological professions of the 12 professions that are that come under the map. So we have psychological practitioners, we have psychological therapists, and we have psychologists. And beneath each one of these areas, we have the clouds, and each cloud represents one of the different professions. So you can see them as a whole. And then if we just click on one of the clouds, so for instance, psychological wellbeing practitioner, which is the role that Amy's described, that then takes you to a short description of the sorts of work, a bit of an overview of that role. And then you can see you've got the option to go back to the map and have a look at the other clouds just to get a quick look, or you can go in and read more information. So what you can see here now is there's much more detailed information about this role. So there's a description of the role, who can train for the role. So remember me talking about this idea that we're working hard now to create a career ladder so people can get into the psychological professions at different entry points within the NHS. It talks to you about what the training is for the role, how long that is, and also, interestingly, the types of funding that are available. So, for instance, with the psychological wellbeing practitioner, we now have an apprenticeship that is available. So some services will be taking on people on apprenticeships across England to train as psychological wellbeing practitioners. And we also have a number of paid training places that are funded through a different route, but through by the NHS, because we're really wanting to expand this part of the workforce. But essentially it's using an apprenticeship model. So you're employed by an NHS trust, or some of the organisations are third sector organisations, charitable organisations, and then you work and train at the same time. So it tells you more about that, that way of coming into the training. Tells you about the entry requirements, so what kinds of qualifications, and really importantly, what experience, which everybody has talked about so far, how important it is to spend some time building up your experience. And that might be looking at voluntary work and doing things in alongside your studies. But it might also be thinking about, well, how can you look across the breadth of your life experience and things that you've done in other parts of your life that may well also contribute to you bringing a very rich life experience to the role. Talks about salary expectations, future career options, and then something about the registration and accreditation bodies that are connected with the roles and professional organisations. And then there are some more useful links at the bottom here. So each one of these clouds, let's just go back to the map. Each one of these clouds has that kind of level of detail, and you can go and look and learn a bit more, have a little bit of a shop round and think about what's right for you and where might you want to enter the ladder, and also what might you aspire to, because we want people to develop careers within the psychological professions. Obviously, I'm here to encourage people to join careers within the NHS, but there are a number of roles that you can progress through and into through a career in the psychological professions and within NHS and health and care services. So hopefully you'll find that a really useful resource for you to go and have a look at. And if you want to know more, just want to share with you these few links. So finally, I want to thank Jodie and Amy for sharing their stories. Hopefully it's been of interest to you and also given you some ideas about things that you might want to learn more about. So do go and have a look at the career map, explore the Psychological Professions Network website, where you'll find lots of other interesting resources and papers and animations that we're building all the time. And then there are a number of links for you to go and find out more about careers. So now I'm going to hand back to Edward to see if there are any questions for us.
There are. Thank you very much for this insightful story, and to all of you, and for just drawing on both challenges, but also what makes it wonderful about the job. Well, I think one of the good questions to start with is a pretty fundamental one, and it's asking about qualifications. The question is, can a person work in any of these careers just with a BS in psychology?
Yes. So I think the beauty of us developing the career ladder with the roles, particularly starting with the practitioner psychology roles and moving through to clinical psychology and other roles at that part of the career ladder, that means that it widens the opportunities for people to come in with different types of qualifications. And that's something that we are very, very committed to, that we want to bring in, we want to enable people that have a range of life experience and a range of qualifications to come into the psychological professions. So we also want to encourage people to come in at undergraduate level. So we're now developing an apprenticeship that is at undergraduate level. So you don't need a degree, you train at undergraduate level within the psychological professions PWP role, psychological wellbeing practitioners role. So we are looking at how we can widen that kind of entry point, because that's a really important, particularly when we want to bring more people with different life experiences into the professions, and maybe people that have got really good people skills and are very able, but for a number of reasons maybe just didn't do as well in their education, in their standard education, as other people might have done in their earlier years. So yes, so us widening that is really important. I can see Amy nodding, and Amy, I don't know if you've got anything to add to that.
Sorry, no, yeah, I was just agreeing with everything that you were saying.
Yeah. So this widening access is really at the heart of us developing this career ladder.
Thank you. Another question for the people who are interested in working in the wider psychological workforce, how can they stand out when applying for such a variety of roles? We heard, specifically to clinical psychologists what you do in your application, but what would be some points for, applying for those sorts of roles?
It's a really good point. These are all new roles, relatively new roles. So we're only just beginning to learn how best to promote them. The new roles, particularly the psychological wellbeing practitioner role and the other practitioner roles, they are always advertised through NHS Jobs Online. So my first tip would be, if you want to know about the sorts of jobs that are coming up, because they are NHS funded training roles, get yourself registered with NHS Jobs Online and put in an alert for psychological wellbeing practitioner, and then you'll start to see what the job applications look like. You then would and the criteria, the entry criteria. I think that it's fair to say that people that are successful in those roles tend to have life experience. That might be as a carer or as someone that has their own experience. So I think it's been said very clearly that don't rule yourself out if you have those kind of experience. Actually, they can be used to very much demonstrate that you have experience that's relevant and you're able to empathise. But also thinking about voluntary experience and other things that you've done, maybe in assistant roles or other types of psychologically or mental health connected roles. Amy, you were the person that obviously has most recently gone through that recruitment. Mm-hmm. And are there any tips that you would add around applying for those roles?
Of course, like just making sure you're tailoring your application exactly to what the job specification is. So I find it easier doing like bullet points, so it's like clear rather than doing like block paragraphs. I find that that's worked, and I seem to get shortlisted a lot easier by doing that. And again, just letting your personality shine through. And of course, if you have got that experience, like you have your own mental health issues, then of course putting that in there, because they want people, of course, who can relate to the people coming through the service as well. So I think that's important. And also, even if you've got personal experience, such as like having a family or anything like that, I think that can be really helpful as well.
I think I have a follow-up question, and I think, Claire, you mentioned, the NHS website, for those jobs, which I think it's very important, so people know where to look for those jobs. You also mentioned, that some are within charities. How would you find those roles? What would you look for them?
Well, similarly, the charities, particularly the practitioner roles, these are the new roles that are being developed within the NHS and have funded training and employment associated with them. So the range of services that those roles are in are all what we call NHS commissioned. Okay. So particularly in mental health, there's quite a mixed economy of providers that are commissioned by the NHS to provide NHS services. Mm-hmm. So they would all advertise through NHS Jobs Online as well for these, but you might be with a third sector charitable organisation rather than an NHS Foundation Trust, for instance, but they're all working within the same programme.
Thank you. Another question, how do you overcome setbacks or challenges when you're applying for these roles?
Wow, interesting question. Jodie, have you got any tips on that? Any thoughts?
I think so. I was struck by something Jemima said earlier around being process driven, not destination driven. And I think Amy and I had a conversation about this yesterday, that it can feel really competitive. There's lots of people who want to move into this area, and it can be really, really hard to I guess hold on to something positive when it feels like you're applying. So I applied for clinical training. I got on my third application, and for the first two applications, I was offered no interviews, and it was a really difficult experience to sort of have, to feel rejected and to not even get an opportunity to sit down and explain to someone why I wanted to do the role. But for me, it was very much being process driven. I really enjoyed my job, and I really did soak up all of the experiences. Each role I've had from the very beginning, being a support worker, have been really important and have taught me so much. And I think being able to hold on to that and think about that you're collecting experience to help you get to where you want to be, not necessarily focused on where you're going, because actually life is tricky. It changes. There are different things that come up, and not putting things on hold to try and get to a space and missing out on experiences that actually are going to be really helpful. I don't know if Amy wants to add anything to that.
No, yeah, the same. Obviously, it always sounds like a bit, I think, intimidating when you hear people's experience, but obviously behind that there is a lot of rejection and, of course, imposter syndrome, which comes in with that. And it is very mentally draining if you are getting rejection after rejection, especially if you are thinking about going into roles such as assistant psychologist after like your degree, or the PWP role that's becoming more competitive. But even just something personal that you can do is having like a bit of a positivity diary and writing down your skills and things like that as well, and just kind of like remembering your self-worth in those ways, because you do end up comparing yourself and thinking, oh, well, if people are going with masters and things like that and I don't have that, then it is mentally draining. And of course you do start to kind of forget your own self-worth. So even just writing down your skills or writing something positive that you've done in your job that day, things like that can of course like improve your own like mental well-being and things like that.
Thank you so much for the tips, and thank you for answering our questions. We are now going to move on to the next session, and I'm going to ask Natalie to introduce our next speakers. Thank you, everyone.
Thanks, Edward. Thank you, everyone. That was really, really inspirational and lovely to hear from you all and your different perspectives. So thank you very much. So now we'll be moving on to our first panel of the day, where you will have the opportunity to ask questions regarding what you can do after your degree. Our panel is made up of 4 individuals. So we have Angela Chase, a trainee clinical psychologist. Welcome, Angela. We've got Aiko Leng, the chair of the BPS Student Committee. Amy Wilkinson, who you've just met, is staying on the screen. She's a psychological wellbeing practitioner. And we also have James Goodwin, who is the careers manager at the BPS. So I'd like to welcome them to the screen where we can start off the panel session. Each panelist will give you a quick introduction, and then we welcome any questions that you may have. Please use the Q&A function and we'll try and get through as many of your questions as possible. So Angela, would you like to start off by introducing yourself?
Yeah, hi everyone. My name's Angela. So I'm a first year trainee clinical psychologist. I'm studying at UCL. And yeah, I'm just here to talk a little bit about my journey and my experience so far. Just a little quick side note, I just want to introduce you guys to who I actually am. I'm really passionate about representation in psychology. I think it's really important. And my personal identity is that I grew up in England in the southeast. I had quite a middle class upbringing, but my parents came from much less privileged backgrounds themselves. I'm also mixed race. I'm the daughter of an immigrant. So my mum is Chinese, my dad is English. And I really want to draw on that because I think it's really important to think about our culture and our own personal experiences, especially in mental health. And I'm also part of the LGBT community. So I just want to say that in case any of you can relate to who I am and my experiences. A very quick overview of how I got here. I studied psychology undergraduate at Surrey. I also worked part-time throughout that with the National Autistic Society. I worked as a support worker for 4 years. And I also did a placement year, which I was really lucky to do, working in a community mental health team. When I graduated, I did loads of applications and managed to get an assistant psychologist role in a locked rehab hospital across 2 wards. And then I went on to do a master's degree at UCL in clinical mental health sciences. After that, I again did loads of applications and found an assistant role in forensics, actually, which was not my plan, but I ended up loving. So I worked in forensics for a year and then made applications for the doctorate and managed to somehow get in on my first try. And the reason I'm saying that is not to boast, but to instill hope that it is possible, especially if, like Amy was talking about earlier, you draw on your process and you really just take every step of your journey as a learning opportunity. So we'll talk more about that in the panel, but yeah, nice to meet you guys.
Thanks, Angela. Aiko, would you like to give a little introduction maybe on your background as well?
Hi, everyone. I'm Aiko. I'm currently a final year undergraduate student majoring in psychology with education at UCL as well. And I'm the chair of the BPS Student Committee. I'm particularly interested in clinical psychology, educational psychology, and the relationship between the arts and mental health. So with this passion, I'm also the founder of a student-led nonprofit association, Arts for Mental Health, and an honorary assistant psychologist in a specialized eating disorder services in the NHS. So as mentioned earlier, I'm still an undergraduate student. So similar to a lot of you, I'm still asking myself constantly, what can I do after my degree? I came to the conclusion that there are a few options, namely going into postgraduate studies, continuous training, getting a job, take a gap year, or do some innovative projects on my own. And I believe these are the options that you have come across too. So when you ask me what you can do after your degree, I do not think I'm in a very good position to get advice on that. However, I do realize a few important common keys to getting into any of the options that I just listed. So which is to get there, firstly, you need to know whether you're truly passionate about the field that you would like to pursue. And secondly, most of the time, getting into your dream course or job, it requires prior experience. So here are just like few tips for me about what you can do as an undergraduate student right now, and we can talk more about that later. So firstly, do take the time to research different options available to you after graduation as early as possible. This will help you know what the requirements are, and it will help you better tailor your CVs and experience to obtain within your undergraduate studies. And after you know what is required to get into your dream job or course, perhaps try to explore whether you're really passionate about the area, because there are always like challenges in every job role or training course, which you probably won't be aware of while you have an idealized image of that job in your imagination. So gaining firsthand experience will definitely let you gain insight into that field better and help you develop skills to overcome potential challenges from a very early stage. So you may be asking, how can I get this experience? Paid job would be great, but as mentioned earlier and by different people, that it's quite difficult because you need a lot of prior experience, and this is especially true in psychology related careers. So volunteering or initiating your project would be a great idea. Connect with people in your course, your professor, alumni, and of course the BPS to learn more about these opportunities. So for instance, we are now launching a student ambassador program. You can join the BPS Student Committee as a student ambassador to represent fellow students, to gain some leadership experience and to widen your network. There are a lot more things you can do to help maximize your chance into getting where you want to go. So be creative, be persistent, and I wish you all the best in your career journey.
Thanks, Aiko. Yeah, that's really interesting to hear, and some really good tips there. Thank you. Amy, I know we just heard from you, but I don't know if you want to add anything just as a little intro at this moment.
Yeah, not really. Obviously, as you know, I'm Amy and I'm a psychological wellbeing practitioner. I've just recently finished my training year. Before that, I had a few different experiences such as support work, teaching assistant, and assistant psychologists. I done a degree and then I went straight into a research master's in psychology after that. I know obviously a lot of people talk about getting masters, but in my own experience, I haven't actually used anything from my masters yet. So I know obviously a lot of people thinking the need to have it. I suppose it is kind of building on what Jemima said earlier about like whether it's actually relevant to you. So yeah, that's my experience to date. I have got like kind of like aspirations to potentially go on to the clinical psychology training after that, but of course the P2P role has now opened avenues such as high intensity training to become a qualified CBT therapist after that. So now I've got kind of like 2 routes in front of us, which I think is quite a nice idea to have. Obviously, but they're both competitive, so it's nice to have like a different career path which you can think of as well as a result of that role.
Absolutely. Thank you, Amy. And then James, did you want to give a little introduction as well?
Yes, certainly. Thanks, Natalie. So I'm going to keep mine shorter because what I will say is my background is not psychology. I'm not a psychologist. I am a qualified careers advisor though. So I think I said at the start, my role within the BPS is careers manager. So it's making sure that we have the resources and information there to support both our members and also those with an interest in psychology. So I studied a social sciences subject at university. I then worked within finance for 4 or 5 years after that, and then went back to university and studied a master's level qualification in careers advice and guidance. So my specialism is around providing impartial advice on getting into these areas, so hopefully can answer and answer some questions around that and career theory as well. So yeah, thank you very much.
Thanks James. Yeah, it's really good to have you on the panel today. So I suppose we'll start off quite broad then, and I'll open up this question to anyone who wants to come in. What would your advice be for someone who isn't quite sure which field that they want to go into in terms of psychology?
I'm happy to start off.
Absolutely, go ahead, Angela.
Don't rush. I think there is so much pressure in psychology that you need to know exactly what you want to do straight away because it's so competitive and everyone's running miles ahead of you. But honestly, if you do that, you're just going to be tripping yourself up. I really think it's important to take time, like Aiko was saying, like, why do you want to do this? Is this actually what makes you feel good? Is it something that interests you? Personally, even though I've described quite a linear path to where I am now, actually, I had a lot of trouble deciding whether clinical psychology was for me or not. And the only reason I feel so calm within myself of what decisions I've made is because I really made sure that this was actually what I wanted. So don't rush. I really feel like it's a valuable, try if you can, try and get experience in the different areas that you're interested in, but you don't need to commit yourself to that. And it's not a waste of time. Every single thing that you do is part of you developing and part of you learning where you need to be. I don't know if anyone else has got more to add.
Can I follow up on what Angela has just mentioned earlier? I do think that taking the time to explore a different kind of field is a very good idea. And I also think another way that you can do that is by talking to different people in different fields. So you got professors who are in different field within your course. And even though maybe they are very busy, you can talk to alumni because there are usually alumni network within your university. And a lot of them are very willing to help you to kind of know what they're doing in their field and give you more advice on what it's really like in their field. And you can actually get a sense of what's going on before you try to apply for things, because applying for things is quite stressful as well. And as a student, you already have so much coursework to do. And sometimes it can kind of make you really stressful and anxious. So yeah.
Definitely. Thanks, Aiko. Does anyone want to add anything else on top of that?
I was just going to follow on what Angela said as well. Yeah, obviously it's so broad, and of course you don't know what everything is that you can do and the different avenues you can go down. So just try and do little different jobs, try and do with different presentations, different groups and things like that as well. And obviously that might help you gain that insight. And again, just remember to enjoy the step that you're at, because I think we're all, as we come out of degrees, we put certain jobs on a pedestal, like an assistant psychologist, we need to get that job to get the doctorate. But it's important to actually think about the skills that you're learning here and then in your job that you've got at the moment, because I think where skills can become so automatic that when we actually reflect, we think we've got no skills, and we think we need to get these certain job titles to be able to gain those skills, but chances are you've already got them already. You just need to remember that, and remember to think about where you are now and how valuable that is for the future as well.
Yeah, definitely. Thank you. James, did you want to add something?
Yeah, I just wanted to add, I think that the points that everyone's made are really, really good and excellent advice. I think from my perspective, coming from a careers background, I think one of the things I want to impress is be kind to yourself as well. Give yourself the time you need. You might feel that, you know, you look around you, especially at university, and you see people getting all kinds of different jobs, and you think, I'm not getting that. And it doesn't mean that's the right way for you to do it as well. Having no clue is absolutely fine. Accept that and feel comfortable in that. And that can be quite difficult, but just feel comfortable in that. And I think, especially we're seeing at the moment, this idea of happenstance, of chance events and chance things can happen to us in our careers. So actually some of the skills that sit behind that in terms of your career, so being able to be flexible and adaptive, being able to change to when maybe things don't go to plan, developing your resilience, are all really useful skills that when you're exploring these options and when you give yourself permission to explore those, will help you succeed in those as well.
Absolutely. Yeah, really good advice there, James. And I suppose this leads quite nicely on to the next question. So we've got a lot of feedback around kind of relevant opportunities and work experience and what that looks like. So really, you know, how did you find opportunities and relevant experience, and what is relevant experience towards the roles that you're currently in?
I can start off again. My part-time job that I had through uni, I got because I needed money, like a lot of us do when we're studying. But actually, even if you need to do work and need money, you can find relevant work that will help. And I really say that loosely, because I think any role where you are working with people and you're providing some kind of support is relevant, and that will be your foot in the door. So for me, the National Autistic Society actually sent an email round in Freshers Week about wanting support workers that needed literally no experience to go into. And even if your university hasn't, you know, sent around an application and you haven't seen it, you can search for a lot of charities in your area, for example. I would suggest the word support work when you're searching for opportunities, because often you can come in with limited qualification and experience yet, and just a good can-do attitude and a lot of passion, and that can be your beginning. So yeah, that's where I started out, and that really set me on the rest of my career path.
Thank you. I think that's really, you know, it's really interesting, and some of the feedback that we've got is, how do you manage that around maybe, you know, working full time as well? You know, are these roles quite flexible in terms of the experience that you're looking for? Anyone want to come in?
Oh, I thought that was a follow-up question for Angela there, sorry. But what I was going to say, just on the question that you asked before, don't be afraid to also bug people and services and things like that, and talk to people and open up. I know for me, to be able to get my voluntary positions, I actually bugged services, and it took about a year for anybody to actually come back and say, oh, look, we're going to offer you this. I don't know whether it was because they're probably sick of us continuously asking for things, but I felt like by doing that, it really did open the doors, and being able to be confident and just think, look, the worst thing people are going to say is, no, we don't have any opportunities. But I think by continually asking people for opportunities and whether there's anything that can help you progress, it shows that you're interested and shows you're proactive as well. And I think that is something which really goes a long way. And I think that opens doors in itself as well.
Definitely. Thank you, Amy. Does anyone else want to add anything to that question?
Yeah, I completely agree with Amy. Like, don't be afraid of like rejection while you're trying to reach out for experience. Because like, for example, for my honorary assistant psychologist position, I'm having like a really difficult time to like trying to find clinical experience, just an undergraduate student. And like, because my course doesn't have like a placement or anything like that. So I have to like email different people to see if people can give me opportunity. So don't take it personal. Like when people say like, we can't give you a job now, we can't give you the position now. There are like many factors behind that, but at the same time, like, do equip yourself well. And by equipping yourself, it means like doing volunteering work, getting different experience. Even if you can't get volunteering work, try initiate your own project, because if you initiate your own project, you're doing something that you're truly passionate about, and it will be way much easier for you to like show your potential and your ability through that project, instead of like trying to fit it into another workplace or an environment that you're quite not sure about. So maybe try contact like your university and see if there are any opportunity that you can start a project on your own, anything like that. So yeah.
Yeah, perfect. Thank you, Aiko. James?
Yeah, I would again completely agree with what's been said. I think thinking about when we say experience, think about what do you mean by that as well, because experience can be really, really broad. Sometimes your experience may not even seem like it's relevant as well. But the key thing is, and I mentioned this a moment ago, was take the time to reflect on the skills that you're developing. I was at a talk a few months ago where I spoke to, or an assistant psychologist was speaking, and they talked about how they had, whilst they were at university, had worked in a pub, and were able to use really successfully their psychological knowledge at things like closing time, when they were trying to get people out of the pub, and how they applied psychology to that role. And it was just really inspiring to actually see how that person had applied the skills that they'd gained, and think about looking for it in different areas as well. So we've mentioned talking to people. I'm a big advocate for that, finding out about the role, and actually, if you're at university at the moment, looking at what your university is doing, either within the psychology department or the careers team there as well. More people to go and bug, and I would actively encourage you to go and do that within your university, because that can be a really good source of those networking and contacts. And then just finally, use a platform such as something like LinkedIn, where you can actually keep a record of those contacts, but then also develop new contacts and develop your own professional identity as well.
Absolutely. Thank you, James. I suppose a follow-up question to that then from Stephanie is, do you have any advice for people who are trying to get experience around a full-time job?
Unless James wants to go. Do you want to go, James?
I was going to say go for it, Angela. You go first.
I have done this twice in my life. So when I was doing my placement at undergrad and I was working full time, it was unpaid. So that's why I did kind of paid work on the side of that to get experience. And again, that was through the National Autistic Society as a support worker. So the way that I looked for the work was if you look for like evening clubs and evening activities that you can support with. So that could be with any population. For mine, it happened to be children and young people with autism. But they ran kind of evening clubs at like 6 o'clock in the evening. So you could kind of nip over after work. And the commitment can be small as well. So for example, I think I did like 6 to 8 hours a week on top of my full-time job, which meant it was manageable. I think the risk when you're trying to get loads of extra experience is burning yourself out. I needed to make sure it's manageable for me. So yeah, I did like 2 evenings a week, every week for like 4 years. Which meant the experience I got from that was huge, but I didn't feel absolutely exhausted. So yeah, I think looking for evening clubs, it could be like, yeah, any population. I think that's where I started out.
Has anyone got anything else they'd like to add to that question?
I was just going to say, I can kind of completely agree with what Angela said. I think it's a really good point about looking at when you're free, looking at the time you have available, and doing that, and don't push yourself too hard to get into it, because that can have negative consequences. And like I said before, just that anything can be experienced, just little tiny bits at a time. Something like a coffee chat with a psychologist, if you're interested in that area, engaging with the BPS. Our member networks run events and things like that you can go to for just an hour or so, just anything like that starts to open up some doorways and grow your contacts.
Absolutely, thank you. Is there any other anything else to add from anyone for that question? Okay, so we'll move on to another question which fits in quite nicely with this work experience chat that we've got going on. What would you say is the best way to represent yourself in a CV when you're struggling to get a role? So any tips around kind of CV, job application, that type of thing?
I'm happy to start this one off, if that's
Go
okay.
ahead.
I think in regards to kind of selling yourself properly on a CV, firstly, understand what you're applying for. So take some time to do your research. When you're looking at a job role, have a look at things like the person specification and the job description. Look at that in a bit of detail and analyze the skills that they're looking for, and make sure that they're really explicitly clear in either your CV or your application. That can also be a really useful process to kind of almost do a skills audit on yourself as well. So through that, you may identify some of the skills that are required for a role where you think, actually, I probably need to do a bit more on that. So it might direct you in a pathway to actually seek out more experience or ways in which you can develop those skills. As well. Asking for feedback, I think, is really important as well. So CV, we all get kind of so engrossed in our own documents that we end up, it's very hard to sometimes spot errors. So I think Jemima said about spelling and grammar, and this is something that I struggle with. So I always get friends, family to just have a read through my CV as well. And then a couple of top tips. I saw one come up in the chat of don't lie. That's really important. But secondly, as well, when you are applying for a job role, always keep a copy of your application and the job description. From a background in recruitment, that is something that a lot of people tend to forget to do, and can be really useful if you've got it there when you are hopefully called for interview. So yeah, that's what I would say. I don't know if anyone else has anything else. There's probably loads we could talk about.
Yeah, just following on what James has shared, I was thinking like putting the role specification and like description and what is required at the background is very good as well. So personally, for in my personal experience, what I do is I directly copy those points into a Word document so that I can type my experience and link that back to like the specific requirements needed under each point, and then you delete what I've like copied out from the original document, and it will help your CV make sense a lot more towards the role description. So yeah, I don't know if it's helpful for anybody else, but I just want to share that. Yeah.
Thanks, Aiko. Has anyone else got any other tips they'd share in terms of CV?
I think as well, just the layout. So I mentioned this point earlier, but like for me, the bullet point situation has really helped. So I've done applications where it has been paragraphs for each setting. And from people who have been interviewers on some of my panels, they've said that they don't really like that because they feel like it's too much information to read. And obviously, you know from your own experience, if there is a block paragraph, you can kind of tail off. So my top tip is definitely using bullet points for each and every job description on that application as well. Yeah, that's fine.
Thanks, Amy. Angela, did you want to add something?
Just completely agree. Same thing as Amy. Like I use bullet points for absolutely everything. You want to make the job of the person that's trying to recruit you as easy as possible. And also I do the same thing, Aiko. So every job I apply for, like James said, I save the job description and the person specification. I number it and I number my application so I can refer back to it in the future. That's really, really helpful because if a similar job comes up in future, you can refer to that as a baseline. It saves you some time. And I will literally write out all of the job description and person specification and then kind of group them together. So there's a lot of stuff that actually feels really repetitive in those documents. Group them in like little themes and then write how you fulfill each of those. That can be really helpful for when you're writing out like the letter, for example, of application. But yeah, that's it really.
Thank you. No, some really good tips there. Thanks, Angela. So I suppose a follow-up to this as well. So should you also include any health conditions or disabilities, particularly if neurodiverse?
I'm happy to answer this one.
Yeah, go ahead.
I'll have a go. So in regards to health conditions, you will be covered under the Equality Act if you disclose them. So what that says is that recruiters should make reasonable adjustments to any recruitment processes or the roles to ensure equity in terms of applying for those roles. In terms of disclosure, it is a personal a personal choice. So people's circumstances and how comfortable they feel with doing it will vary. I would encourage you to get individual advice, to speak to, if you're in a university, to maybe go and speak to a careers professional there, because they can actually talk you through that. But actually, if you do choose to disclose, as I say, it does get you certain protections. But actually, when you're disclosing as well, think about reaching out to maybe the recruiters and actually articulating to them the support that you would need through that as well. So having worked with recruiters in the past, I think when a candidate will reach out, they'll actually take the time to understand how that particular condition affects that individual and look at what could maybe help and support them in the recruitment process. So it opens up a conversation for you. And often recruiters will really value that as well. And ultimately for you, it's going to make sure that you have the best chance possible in terms of achieving that role. So yes, I would encourage disclosure of any disabilities or conditions.
Absolutely. Thanks, James. Has anyone got anything else they'd like to add in regards to that? Okay, so the next question then, that leads quite nicely on. What tips would you share around preparation for interviews for these roles?
I think the biggest one is obviously knowing exactly what it is that you're applying for. I've heard a lot of interviewers say they've had interviews with people and they haven't really understood what the role is about and what it entails. So I think that is definitely like the biggest tip in terms of how to prepare. And again, just remembering all your kind of like skills. So going back through your career, what I normally do if I'm kind of like thinking about I'm coming up to the end of a job role, I normally list all the skills that I've learned throughout that. And then I keep that safe. So when it does come to applying for a new job or I get an interview, I can refer back to that as well.
Thanks, Amy. Anyone else want to come in on that one as well?
Yeah, I think also, Angela, you want to go first? I think one very important thing is to know exactly the organization or like the place that you're applying to and know what they are doing as well. So you can kind of tailor your interview into saying like how you can contribute to them as well. So this might not be very applicable for like undergraduate students because like for a lot of time, there's not a lot of things that we can contribute regarding knowledge and stuff like that. But you can also talk about like your experience that are unique to yourselves or like your special identity or like some kind of soft skills that you have, which makes you stand out and can contribute to them. So yeah.
Thank you. Thanks, Aiko. Angela, did you want to come in?
Yeah, I was just going to say more about like the approach that you can take in the actual interview. So obviously, I think Amy and Aiko have hit the nail. Like you need to know what you're doing and what you're applying for. But when you're in the room, especially if you're going for those real kind of more clinical facing roles like assistant psychologist jobs or even for the doctorates, reflection and process is more important than the content. So in these roles, I've never heard an interviewer ever say, I want to know exactly what you did and that's it. They want to know, what have you learned or taken from that experience? What have you realized about yourself? don't be afraid to bring in your own experiences, your own emotions even. When I first came into clinical psychology, I was shocked by how open psychologists are, and mental health practitioners in general, obviously. Like they genuinely do open up as much as we would ask our clients to. And I think that there is a lot that you can show about yourself as a valuable member of the team, as a valuable clinician, as a valuable member of a mental health service, when you're able to reflect on your own anxieties, on what's made you excited, on what's made you scared. What did you do about that? There's a lot of really helpful reflective cycles that you can look at. For me personally, they scared me a little bit. I don't think you need to go, what did I do? Then what, then what, then what? But just learning how to think. So like, don't just say, I've done this, this group with someone. How did you do it? What was challenging about it? What emotions did it bring up for you? How did that make you feel? What will you learn from that to bring forwards in this role? That's the most important thing. So yeah, that's my biggest piece of advice.
Thank you. Thanks,
Can I just add on to that as well? So from what I've learned as well in the interviews that I've had is that honesty is like the best policy as well. So obviously we all go in and we think we need to be this perfect candidate who meets every single box in that criteria. But being honest again and being reflective about what you know and what you don't know and what you're going to be willing to learn in that role to be able to develop in that role. And I've had feedback from myself doing that, and they've said that's what's kind of like really shone through. And I think that can probably speak for the majority of people who are recruiting for roles as well, being honest about where you are and where you want to be and how you're going to get there.
Yeah, definitely. Thank you, Amy. Okay, so another question for you then. Were there any points during your undergraduate degree that when you were completing that you felt really unmotivated? And have you got any advice on kind of how you can overcome that?
Yeah, I can start this one off. Yeah, all the time. I think when you're in this type of career and you're in either the job or the undergraduate degree, it's very like mentally draining, and there is times through that where you think, am I even in the right career? Do I even want to do this anymore? And I think that's when it's like important to just like kind of like touch base with yourself and think about your own values and what it is that why did you actually start that degree as well? What was it that was the main driver for applying for that type of degree? So that's my main point.
Just, coming off of what Amy said, definitely agree. Not just in undergraduate, all the time. This is a very challenging role. I love it, but it can be stressful and draining. Don't kick yourself because you're feeling unmotivated. You're a human being. It's normal. Again, it's that self-honesty about how you're feeling, and that's important. For me personally, I wasn't necessarily unmotivated during my undergraduate, but I was unsure. Like I said, I wasn't really sure what I wanted to do when I left and whether I wanted to do clinical psychology. And again, just take your time, just kind of go through, do what you need to do, but then also just think about what do you want to do, and don't think, oh, I should feel more motivated. I should know what I'm doing. I should be working towards a goal. Your goal should be understanding what you need. So I think just, taking it like that.
Definitely. Yeah. Thanks, Angela. Yeah, Aiko, go ahead.
Yeah, just as an undergraduate student myself, I do feel like not motivated a lot of times as well. And especially I feel like this has become an issue during final year because there are a lot of like work to do, dissertation, work experience, and then like postgraduate uncertainty, everything is coming, and peer pressure as well, because like we're all in a very competitive environment. Like people talk about what they do and stuff like that. So how do I kind of cope with this kind of situation? As Angela said, like take some time to like let yourself kind of like relax instead of like keep pushing yourself, because Yeah, because you really need the time to kind of like calm yourself down. But at the same time, don't compare yourself with others. That's a very important thing. Don't keep on going to LinkedIn. I know LinkedIn is a very good place to connect with people. Don't keep looking at people's profile and like be like, oh, this person is doing this person doing that. You have your own goal. You're walking your own path. There's no point in comparing yourself with others, because this is only going to demotivate you if you do it to a huge extent. So go on LinkedIn, see if there are any like useful places you can try get work experience and connect with people, but don't overdo it. So yeah.
Definitely. Thanks, Aiko. Has anyone got anything else to add there?
I would just say I completely agree. I think it's a really good point that everyone's made there about this, and it relates to trying to stay resilient. If you think of an undergraduate degree, 3 or 4 years, possibly more, it's quite a long time, and to actually see yourself, you might have an end goal in mind, and it might seem quite a long way away. And we often see it with roles like clinical psychology, where there is a long training period or a long time after you graduate where you might not know what to do in that period. And maybe trying to break things down and giving yourself shorter goals as well. So rather than going, I want to be in this role, actually breaking that down, I think is really important into smaller steps you can take. Don't be afraid. I mean, as today is hopefully showing, and the comments in the chat are showing as well, that you're not actually alone in that. Everyone will go through this. I've heard it term the sophomore slump in your kind of second year sometimes. Reach out to people and talk about it. There's support available from your university, and it's perfectly fine to feel like that as well. And it goes back to my point before. I don't want to sound like I keep repeating it, but just give yourself time and be kind to yourself with that as well.
Yeah, definitely. Thank you, James. Okay, we'll move on to another question. I suppose, Aiko, this is directed at you, but open to the group as well. So how do you initiate your own project as an undergraduate, and then how can you be proactive in your approach to this?
So how to initiate your own project? First of all, you need to identify like the specific area that you want to do. And a lot of time you can do that by contacting, for example, student union, set up a society, or if you already have a society in your university, for example, psychology society or something like that, you can kind of like initiate like a program with them. For example, personally, I like arts and mental health, stuff like that as well. So I've kind of like launched an online a nonprofit association, so people can like stay mentally healthy by having conversation and doing activity together that is related to art. And then yeah, so there's a lot of things you can do. So you can contact your university, you can initiate your own project on your own, even if you don't have like any support from like institution or anything, because the regulation there might be like quite strict and stuff. It might limit your ways of exploration. So as long as you have a good plan, plan it out, and then execute it. And I would suggest that you also ask people to come join you, because this will definitely help create the project better. And more importantly, it will help you stay motivated to do that, because it's not easy initiating your own project. It's not easy finding your teammates in the first instant as well, because people would think that you're a bit crazy. You have so many things to do already. Why are you doing this to yourself? But you're passionate about it. Try and make other people passionate about it. And most importantly, find the people that you think are passionate, so they won't criticize you, but they're going to work alongside you and keep motivating you. So yeah.
Yeah, brilliant advice, Aiko. Thank you. Has anyone else got anything I'd like to add to that one question? Okay, all right. Oh,
just agree with Aiko, yeah.
Yeah, thank you. Thanks, Angela. Okay, so there's a couple of questions that are coming through in regards to kind of resilience and actually how you're coping with the pressure of knowing what to do after undergraduate degrees. A question from Georgia: would you have any advice on how best to reflect on whether you've got the personal and emotional resilience to go into something as challenging as clinical psychology?
Yeah, this was something that I was worried about. I think a lot of people really idealize clinical psychology without really understanding the toll that it can have. That's not to put people off. I do it. It is a lot, but I also love it. And there are ways to look after yourself. I would say don't walk into a year-long contracted clinical job if you have no other experience. A, it's going to be difficult to get, but B, you're not going to know what you're facing. For me, it was doing the part-time, low-key work, working with people that experienced distress, people that had vulnerabilities in society, that enabled me to understand, okay, how can I work with people? Can I handle it? Can I manage when someone is distressed in front of me? And can I be useful to that person in a very like non-committal environment, I suppose? So yeah, that part-time work, it could be as a teaching assistant in a special needs school. That's something that I did. It could be as a support worker in a mental health setting. It could be working with older adults with autism, just working with people. And there's no commitment. If you find that it's too much, then you can walk away, and then you know what not to look for in the future, and that will help you on your path.
Thanks, Angela. Yeah, really, really good points. Has anyone got anything else they'd like to add to that question?
I think again, it just comes back to making sure you do have that life outside of your career, and not thinking that everything you have to do in your spare time is reading around the subject or anything. Whatever it is, go and do it, anything that you enjoy, which makes you feel good, whether it is going out for days, whether it's exercising, whatever it is, or whether it's even just doing your own like mindfulness and things like that. Those types of things are really helpful. And even just what I sometimes do is have reflections of the day. So I've had a particular day where it's been quite like challenging. I've had a lot of people come through with a lot of like challenging needs. I tend to have that reflection with either someone else in my service who can relate, or I have like a little bit of a journal kind of thing, and just kind of like getting my own feelings out on paper is another way to kind of like de-stress. Obviously it doesn't work for everybody, but it's another avenue you can go down to help manage how you're feeling and manage any distress.
Thanks, Amy. Yeah, some really good tips there. Has anyone got anything else they'd like to add?
Amy actually just reminded me of something. That was an incredible point, Amy. Please look after yourself, and please don't judge yourself if your first week in a patient-facing role it's overwhelming. I've been doing this, like, I've been working with people for like 7 years. It's still overwhelming. There will be days where it's feels like it's too much. That doesn't mean it will be like that every day, and it doesn't mean that you're not fit for this job. So I just wanted to add that, of not try it out, and if it's not for you, give up. Know your own limits, look after yourself, but it's completely normal to need time to settle into a role and to settle into working with people. So yeah, just to add that.
Yeah, definitely. And I've even had my experience through this role where I have had challenging weeks, and I've had to just tell like my supervisor or my line manager, look, I'm struggling a bit. I can't, like, it's a bit too much to hear more challenging people this week. And they've also been fine about that, because at the end of the day, if you're going into clinical roles and you're helping people, you need to be looking after yourself and be able to help yourself. So whatever service and job you're in, your team should be able to help support you through that as well.
Absolutely, absolutely. Has anyone got anything else they'd like to add in terms of staying resilient? Okay, no problem. Yeah, James, go ahead.
Just going to reiterate, I think it's such an important point that Angela and Amy have just made. I think, just really important point. I thought it was a really good point.
Definitely. Okay, so we're coming up to lunchtime now, so I suppose that's all the questions that we can fit in, but thank you everyone for submitting your questions, and like we've said, we'll try and get back to as many as we can using the Q&A function. So thank you ever so much for your time and providing us with lots of food for thought. We will try and pick up anything that we've missed. It's now lunchtime, and we should be reconvening at 1 p.m. Ready for our next speakers and afternoon session. So thank you everybody, and we will reconvene at 1 p.m.
Good afternoon, and thank you everyone. I hope everyone has had a good lunch break. Welcome back to Careers in Psychology. So I'm going to start off by chairing the first of this afternoon's sessions, and I'm really, really pleased to welcome along today Anna De Silva and Emily Jones, who are speaking on behalf of forensic psychology. So both Anna and Emily are forensic psychologists in training, and are also both currently the in-training representatives that are part of the BPS's division of forensic psychology. So they're going to talk to you a little bit more about their career journeys to date, and also the challenges they faced in overcoming those. So without further ado, I'd like to say thank you very much to Anna and Emily for your time, and I will hand over to you, and do keep any questions coming in through the Q&A, and I'll ask these to Anna and Emily at the end of their session. Thank you, and over to you, Emily and Anna.
Thank you, James. Right, I'm going to share the screen. I just get a nod from someone that they can see the screen?
Yeah,
Yes,
I can see it.
Yes, lovely. Okay, well, hello everyone, and thank you for having us. I hope you had a lovely lunch. And Anna and I are here today to talk to you about working in forensic psychology. I must just quickly put a caveat in that my voice does not normally sound like this. I am struggling with a minor sore throat, so please bear with. We're going to talk to you about what it's like to be forensic psychologists in training. We're going to go for a bit of an overview of our daily work. We're going to think about some of the challenges, and we're going to end with telling you what we absolutely love about our jobs. So, kickstart. Anna, over to you.
So hi everyone, my name is Anna, and as it says, I'm a forensic psychologist in training, and I'm also an in-training representative for the Division of Forensic Psychology Committee. So the way that I got involved was quite funny, actually. I was trying to find a community, so to speak. So when I found out that I got onto the training, I was trying to see whether I could already make connections or network with people who were currently in the division. So I emailed them and I asked, is there a group that's available for ethnic minorities that are currently involved in forensic psychology? And I got a very short email stating no. So from then onwards, I then got involved with the SIPAG, which is a group that essentially they get people involved in different fields of psychology, and just want to see if there's a chance for people who are doing a postgraduate at the moment that want to connect with each other. There's events and things like that. So that is the way that I got involved with the division, with the BPS division, I should say, of forensic psychology. From then onwards, as we know, 2020 was one of the funniest years ever. But what had happened was that with the death of George Floyd, I could see in the social media that some of the different divisions of psychology, they were putting out statements that were sort of, you know, letting people from ethnic minorities like myself know that if they needed any extra support, or if they needed just a listening ear, that we could reach out to them for help. So I was waiting for the Division of Forensic Psychology to say something, but unfortunately, nothing was said. To which then I followed up by writing a very nice 2-page email to state my disappointment, really, and also why I thought that it was important that they, you know, also offered that sense of support for ethnic minorities like myself. And from then onwards, it has just been like a snowballing effect, actually. I met up with the chair, they apologized, and we eventually did put out a statement. But also, I got the opportunity to be listened, to be, heard, what it felt like to be somebody who's an ethnic minority, but who is in the, who is training in the field, and what it felt like. And I guess from then on, it's just been event after event and network after network, from which is how I met Emily as well. And yeah, it's been a lovely journey, and I can definitely say that it's just the beginning. Yeah, so that's a little bit about me.
I don't have much wonderful things to say about myself, Anna, as you did. I am too in training rep for the Division of Forensic Psychology. I am a trainee forensic psychologist. I currently work in the pair for HMPPS. I've been on the route for 3 years, which feels more like 3 decades, but we can maybe come to a bit of that as we go on. But yeah, I love working with Anna, is what I would like to say.
I love working with you too, Emily.
Right. So we kind of wanted to think about how to structure this presentation, really, and we thought it might be best to start off with the question of what does a forensic psychologist do? And then we kind of really didn't know the answer.
So, bear with, guys, bear with. We came to a conclusion, so bear with us.
we thought maybe it would just be helpful to tell you guys about what we do in our daily work. Anna and I have worked in different environments, so that might be there's some core tasks that a psychologist does, and if we shared where we did them in our environments, that then we're going to give a good overview. So Anna, I'm going to take a sip of water and you go first.
Yes, so I actually forgot to say that I'm doing the doctorate route, so my journey is slightly different than Emily's. So essentially, I had been working as an assistant psychologist for a year, a little bit over a year, when my supervisor suggested that I applied for the doctorate. I did not have any intentions of getting in. I was literally going in and thinking, do you know what? It will be experience for when I'm ready to apply, I'll know what it's like. But yes, it was my first time applying and I got accepted. So my first year, essentially, it's a master's degree. So the doctorate is in total 3 years, and the first year, I should say, is a master's degree. So that included me going into university 3 times a week, included writing essays and also a dissertation at the end of the year. So for the second and third year, what it looks like for me is that I'll be doing different kinds of placements. Essentially, they suggest to do 4 6-month placements in different settings, and that will also involve the core roles, which we'll go into a little bit more detail a little bit later on. And also I'll be doing a thesis, which I'm very much looking forward to, at the end of the third year. So that is what it will look like for me, my journey, what it will look like for me. But Emily's is slightly different. Do you want to go into a little bit more into it?
So my role, I am on the BPS stage 2 route, which, like Anna said, we can go over some of the competencies, because the competencies sort of form the basis of what a psychologist would do, with the aim being that you're proving your competence in those areas so that then you're ready to fly the nest and be a forensic psychologist. So much of the daily work that I do is about assessing prisoners. We call them residents, so we'll continue to call them residents. Assessing them. I do some therapy work with the residents, one-to-one work. So that's sort of like the assessment and intervention side of things with your clients, whether that's in the prison service or in like a hospital setting, or in the community. And then there's also opportunities, and I have supervisees, so I supervise some prison officers. We also do training staff. So the idea that you find an area in your establishment where, yes, there needs to be some training needs here, or we need to think about a different way of working. And it's the role of the psychologist to devise a training package for the team, and sort of tailoring it to the needs of the establishment. Research as well, like Anna said, a wonderful thesis. And I guess the idea is that even after you've done it as part of your training, there are many branches of forensic psychology. People can be academic psychologists, they could be practitioners, but the idea is that you have core research skills that you can kind of always have your research hat on, and thinking about if there's a specific research question that you have in mind. Or, for example, I've recently developed a trauma group with the residents that I work with. Now I'm thinking about how I can evaluate that. So it is the role of a psychologist, I guess, to always be thinking about the needs of the prisoners, residents, and the needs of the staff. So that's kind of how, when Anna and I sort of laughed about how we didn't know what it was, it felt like, because it just covers so many areas and any day could be different. For many reasons. So it felt quite a broad answer, really. So we hope that's given a bit of an overview. But if you have specific questions, like James said, please put them at the end, because we appreciate that. It was a brief overview. Yes. So another question that we thought was really important, and ones that we have been asked before, is how do you get work experience? Because it's definitely something that I found when I was trying to get into forensic psychology, was I had no idea how to get any experience beforehand. And I always make this joke that it was almost like I thought about committing a crime just so I could get into the prison, so I could get some experience, because no one would let me in. I don't know about you, Anna. Did you have a similar experience where you just didn't know what to do?
I had no clue. I had no clue whatsoever. And what was really frustrating in my journey was that I was trying to find people that I could then go ahead and ask questions. And again, they didn't really know exactly what to tell me. So it was just a case for me personally of trial and error. I wouldn't really call it error, because, it did work out in the end, but it was really a case of me trying to say, okay, what skills do I need, or what skills do I not yet have? And would this particular post allow me to expand on this particular skill and knowledge? And that was how I was going about trying to get different experience. Yeah.
We were saying yesterday that I think there's lots of pressure, or definitely was when I was trying to get into it, that you had to get an assistant psychologist post, or you had to get an honorary post, and that was kind of the only way in. And that I think that that's not the case. I didn't have an honorary assistant psychologist post to get into the prison service. I actually did some volunteering at a local hostel where I was at uni, and it was a hostel whereby men that had come out of the local prison, they then needed integrating back into society, and they just wanted human beings to talk to them about what society was like, and take them to the library, and just be a human being, really. And so you didn't need any qualifications or specific skills other than just kind of having a want to help people. And I think that I think it is really important to get some form of work experience of working with people in a forensic setting before you go in, because it is different, completely different. And it's important to have a bit of a background, I think, in that, but don't be confined to thinking it just has to be an assistant post. We were saying yesterday, find a research paper, and if something that you're really interested in, get in touch with that researcher, drop them an email. You never know, they might have like some research coming up that they need some help with, or like Anna did with the emails, she got fully involved. I think that's kind of, you have to be a bit brave and go for it.
Yeah, my journey, so it started a little bit different. So as I finished my undergrad, I applied for a healthcare assistant post in a psychiatric intensive care unit. So that was my first post after I graduated. So I was there for roughly 2 years, and I have to say, I was very desperate. I was so desperate to get into psychology. I was like, right, so I'll be here for a year and a half. I'll be there for 6 months. Guys, it did not work out like that at all. I can definitely say that. I was actually in that post for about 2 years, 2.5 years actually. I was desperately applying for jobs every single day, to the point that as long as it had something to do with therapy or assistant or psychologist, I would just desperately apply. And I would definitely tell you guys to please don't do that. I'm just grateful that I didn't, go mad because of how I was actually doing things. It was to the extreme. I would definitely not suggest anybody to do that. I'm just grateful that I had people that I surrounded myself with that were grounding me. They were like, do you know what? Take your time. It's okay. People that I would call after, getting another rejection, and I'll be crying on the phone. I'm like, I didn't get this post. They'll be like, it's fine. When it's your time, you will get it. And it is true. When it is your time, you will get it. And it's what I learned during the whole process was how to build your personal statement, for example. That was a skill that I did not have. I did not know how to sell myself. I got to a point where I would go to interviews and I would panic so much that I would literally forget how to speak English. That's how bad it was. I would literally forget some words because I would be so nervous. I'll be crying before the interview, and I'll be crying after the interview, and I'll be crying after getting the feedback from the interview. That's how desperate I was. But yeah, guys, please don't do that. Your mental health is a major priority. You need it to be able to get, onto the course, after the course, and even the job, because it is, forensic psychology is not easy in itself as a field. So you do need your mental health. Please take care of your well-being. So like I said, I was in that post for 2 years, and then what I did was I emailed every single psychologist in my trust, and I was like, I'm a recent graduate. If there's anybody that needs any extra support with, just looking at how a particular kind of therapy that you're currently delivering has worked out, or how it hasn't worked out. If you've got any research or any support that you may need, please let me know. And I actually got the response of 2 psychologists, two of which then led to my honorary positions that I didn't had for about a year or so. One of them was an assistant, and the other one was a research assistant honorary post that I held for about 6 months to a year. And then after that, I got another assistant psychologist role in a adult mental health facility, and I was there for roughly 2 years. And, just going by transparency, I think that was the point that I realized that my mental health mattered. The post wasn't a very nice post in the sense that it sold a dream, and I never actually got to do the things that they said that the post was actually going to do. But that was because the ward was always very short-staffed. So I had to fill in the gap of a healthcare assistant, even though I was employed and being paid as an assistant psychologist. And when I had that mini breakdown, I think I had to say to myself, do I really want to do this? And if it is something that I'm actually passionate about, I need to be passionate about myself in order to be able to then do the job afterwards. And I think from then onwards, I just tried to enjoy the little moments that I was having. For example, when a patient that I was working with got better and then got discharged, that was a win for me. When I was able to pitch to the team that we needed to have a carers group on the ward, and that was accepted, that was like a little win for me. So I was going by the little wins rather than thinking, I need to get onto the doctor, or I need to get onto whatever it is that I'm thinking of going to next. So I learned to appreciate the little moments. When I was having a good day at work, that was a good thing for me. So I think I had to recalibrate my worth, and also how I was thinking about who it is that I want to be once I become qualified. And I think that was the moment that I thought to myself, I need to take care of myself more than, just thinking I've got a goal and I have to meet it. And then afterwards, because I then decided that I wanted to go into forensic psychology, what I did was I decided to take another post, but it was from rather than being a band 4, it was a band 3. However, it was in a medium secure unit. And that was the first instance that I got involved in forensic psychology. And like Emily said, it's very different. It's very different, guys. How it works, the kind of patients or clients that we get, how we communicate with them, the kind of work that we do. Everything is so different. But again, I was able to use the skills and the knowledge that I had in my previous posts and transfer them into that particular post, to the point that I was only there for 6 months until I got my assistant psychologist post, but in a forensic setting as well. And then after that post, I got onto the doctorate. So that's how my journey has worked out for me.
I love that you said those stuffs about mental health, because I feel like psychology is so competitive, and I don't know that we ever just open about how insanely competitive it is. And I think starting off at like the work experience level, I remember going for a honorary post at a local prison, and all my friends on my masters were all going for it as well. And it was kind of like this weird situation whereby suddenly we forgot how friendly we all were, and suddenly we were all just like
competing with each other.
Yeah, it was mad. And only there was only one post. I mean, after that day was done, I was heartbroken. I didn't get it, and my friend did, and I was happy for her. But it turns into this sort of like can't think of the word that I want to use, but it, like some sort of dog competitive, awful environment, which if you're not aware of it, and if you don't kind of stay tuned to your integrity and knowing that it's going to be if someone else does well, let them do well. You're also going to do really well as well. Like, let's not perpetuate this competitiveness around. I totally get it. I know that it's people want to get work experience and they want to get on the route and they want to do all the things. It will happen. It's your time. Just look after yourself along the way, because I think it gets a bit for me, it perpetuates. We'll come to it later, but I think I went through that, like Anna said, similar experiences. And then when I got a first piece of work back that I submitted and I failed, and everyone had sort of been celebrating how well they'd done, and I'd failed, and I thought, oh my goodness, I'm literally awful. This is like the worst thing that's ever happened. I'm not good enough. All these years I've done all this stuff. And I think it was because I'd managed to get myself in such an atmosphere, and I'd bought into this competitive world while thinking about everyone else rather than thinking just about myself and what I needed to do. So I think, guys, right at the beginning, put yourself first is really what I think is the most important message. If you take anything from today.
Definitely. I think one of the things that scared me the most was that I was looking around and nobody that looked like me was in psychology. So I was literally thinking, can I actually do this? Because I don't see that many Black people in forensic psychology at all. And I remember having a conversation with one of my colleagues who had also done an undergrad in psychology. But then when I met her, she was then a trainee nurse. She said that, I just gave up because I was thinking I want to, get married, have kids, buy a house. And if I'm still training by the time that I do, how am I going to afford to be able to do that? And when I told her that I actually wanted to do forensic psychology, she said, I'd never seen a Black forensic psychologist before. And at that point, my confidence was so high that I was like, girl, I'll be your first one. But years later, I was thinking, what the heck was I thinking? Because I was literally like, is this even possible? Because I don't see it around. Like, if I want to reach out to somebody, at that time, I should say, I didn't know who to. I did not know who I could go to and ask for help, to the point that I reached out to a forensic psychologist who wasn't Black. But I said to her, do you know what? I actually am interested in considering to do forensic psychology. And she said, oh, that's great. Let's meet. And then I can give you some pointers on what to do. And I thought, oh my gosh, this is amazing. My first forensic psychologist that I'm going to meet, this is going to be great. So she was like, okay, yeah, tell me a little bit more about you. So I did tell her, this is my second AP post, assistant psychologist post, and this is the experience that I've got, and I've got an undergrad. And then she turned to me and she said, I didn't hear you say that you've got a master's. And I said, yeah, I don't have a master's. And honestly, I don't want to do it because I can't afford to do it. Like, I can't afford to at this point in time, take out a loan to pay for the master's. And she goes, okay, forget it then. I think you should think about another career that you want to try. I was absolutely heartbroken. I have to say, I went home crying. I was crying on the bus. I came home, I was like, Mom, they said that I can't do it, this, that, and the other. And honestly, like I said, if it wasn't the people that I surrounded myself with, if it wasn't for my religion, because I'm a Christian as well, if it wasn't for that, I don't know if I would have been here today talking to you guys and talking about my story, because it was hard. It was very, very hard. But I'm glad that I persisted. I'm glad that I also took the step to think of, my mental health comes first. If I actually want to achieve a goal, any goal in life, I need to be mentally well to be able to do that. So then I said to myself, I need to take care of myself to be able to do that. So that's what I did. And I'm glad that I did, because then later on, even though it didn't look the way I had planned it to look, I got to meet amazing people and to get involved in events such as today's one. And I got to meet Emily as well. I can gladly say that I've got my tribe, people that will cheer me on, people that will tell me off when I'm thinking crazy things. But we're going to be talking about it a little bit later on, but it's needed. It's definitely needed.
Shall I move? I guess we kind of have already kind of highlighted some of these points, haven't we? this really just was up for us to say how the academic route, undergrad, the masters, and then what the BPS route. It's called the BPS Stage 2 route, which is the chartership and HCP registration.
Yeah, so like I said, I only had a undergrad, but about 5 years of work experience before I applied for the doctorate route. So that's the one that I got into. Some people that were in my cohort, they had a master's already, but I was the only one that I'm aware of that didn't have a master's, but I had work experience, so that balanced it out as well. And I think I actually believe that that's what's helped me get onto the course. And like I said, if it wasn't for my supervisor kind of being like, just apply, if it wasn't for that, I wouldn't have. I literally thought, nah, not in a million years. How am I going to afford it? That was actually one of the things that I wanted to talk about. Was I was really concerned about how I was going to do it, because I didn't, apart from the stage 1 and stage 2 route, I didn't really know any other ways to get into. So it was my supervisor at the time that told me about the doctorate route, which was pretty new 2 years ago. So she did tell me about the doctorate student loan, and that is what I have used to be able to get onto the course. Because like I said to everybody, if it wasn't for that, I wouldn't have been able to have done the course, because it's expensive. It's expensive.
The BPS Stage 2 route is equally as expensive. I don't know. Do you know whether you can use that doctorate route? Yes.
Well, when I was doing my research 2 years ago, apparently you couldn't, because it has to be for a course that's for 3 years or longer. However, they might have changed things now. So it's worth you guys going onto the student loan website and looking into the doctorate student loan, because there's an undergrad, there's a master's, and then there's also a doctorate student loan. And if you've got any questions, if it's not clear, because oftentimes it's not clear what's written on there, do give them a call and just ask them, this is my situation, would I be able to use a doctorate loan for that? And for as far as I'm aware as well, if you have used a student loan for a master's, you're then not eligible to use a student loan for a doctorate. But again, this was 2 years when I was doing my research 2 years ago, so things might have changed now. So again, it's worth giving them a call and letting them know, if that's your case, that is, if you've already done a master's and used a student loan, it is worth you giving them a call and asking them if you would be eligible for the doctorate, if that's the route they want to take for the doctorate loan.
That's yeah. I think also for those who, for me, I'm on stage 2 route, and my organisation pays for it for me. There was an option for me to pick a route, and the stage 2 route with the BPS was an option that my employer would pay for. So I am lucky that has happened that way. I wasn't able to do other routes; they refused paying for that one. Not that I wouldn't have picked the BPS route, obviously.
But it's also worth saying that some, like in Emily's case, some employers, they do consider paying for your training, especially if it's the stage 2, which is 2 years. Some employers, there will be some, caveats. They might say, oh, you might have to stay with us as an employee after you finish your qualification for about 2 years or so. They might say that, but it's worth asking, or it's worth going around private, what would you call them? Private companies like the Elysium, if I'm pronouncing it right, Signet, St. Andrews as well. It's worth asking them when you're interviewing with them, or if you're already working for them, it's worth asking them, because if you don't ask, you won't know. And people don't just give you that information for free for some reason or another.
Yeah,
just ask.
I've had a couple of people get in touch and say the NHS are funding the BPS route, so that's quite cool.
Yeah,
I am just aware of time, so we should probably fly through the next. So these are the competencies that we talked about earlier, that you have to prove you are competent in to become a forensic psychologist. Now, there's a caveat here, in that I am on what is known as the old route. That doesn't mean therefore I'm old. Just caveat that. So these are the old. These are the old ones. And then this image we have here in the handbook. This is the new forensic psychology stage 2 route. The qualifications team email is on that slide. So there's lots of new exciting advancements happening with the new route. So definitely get in touch and find out about those. The core roles are the same in the titles. So like I said earlier, you have to show you can conduct a psychological assessment and intervention. You do 2 pieces of research. You communicate psychological knowledge. That's kind of like a consultancy type of core role. And then core role 4, which is training other professionals. And how the qualification is set out is you submit 2 exemplars for each of those core roles. And once you've done them both, you submit it and you're like, hey, BPS, I think I'm competent. Can you please tell me that I am? And they sign you off. The exemplars are made up of many pieces of work that you have done under that core role and practice diaries. Anna, how have we got this far into the call and we haven't mentioned the word practice diaries?
I don't know, girl. I don't know.
It's trauma in our mind.
I think so. I'll actually say that. Yeah, it's the trauma.
you have to write a practice diary every single day. And you practice diary, reflective diary, you write about what you did that day, and you reflect on it. Did you do it well? Did you not? Would you do it differently? And you have to bang some research in there too. So it kind of feels like writing a short essay type. Well, I've exaggerated there. It's probably not an essay, but maybe maybe a good few paragraphs on what you've done.
Yeah.
And then the idea is when you go to submit a core role, you go back through and you're like, oh yeah, those are some really great diary entries I did on research, and you bung that all together, and then you send that off with your big pack of your exemplars. I've been on the course for about 2 years before I'd submitted anything, and I think it was because I had no clue how to submit and what it looked like, and I still have some concerns. I don't know entirely what it is. The new handbook does have some really good guidance on it, and as we're going to talk about later, we do have a good community of forensic psychologists, trainees that is so important to get in touch with and send. I've sent loads of people my submissions to be like, this is what mine look like. And hopefully we can all get through it together, because it can be a little bit difficult.
Yep.
But yes, they're the competencies.
So, diversity and inclusion in forensic psychology. I don't think I have to say that there isn't much as of currently. We are trying to work on it. We can definitely say that the Division of Forensic Psychology is trying to seek out ways to, one, understand why that's the case. One of them, which we already know, is because of the financial access to training as a forensic psychology. Because if we didn't make it clear, basically, clinical psychology doctorate, if you want to compare the two, whilst you're training, you are an employee. Whereas the forensic psychology, unless you are, for example, in Emily's case, whereby your employers would then fund your training. So, for example, like myself, unless I find a paid post that I can then use as my placement, you're going to have to work for free, unfortunately. So, like I said, that's one of the reasons for as to why many people struggle to, even though they really would love to, they struggle to train as a forensic psychology. And then it's also the case that we are trying to get as many of I don't like to use the word minorities, but just for the sake of this presentation, we'll use that, not just ethnic, so disability, sexuality, any sort of minorities that you can think of. We are trying to get more people, or to understand how we can better support people from different kinds of minorities to get involved in forensic psychology. It's still a very kind of new thing, unfortunately, that we are doing. That's my understanding anyway, that we are doing as a division in the UK, but we are trying. One of the things that I had to, sort of push for is a group for ethnic minorities within forensic psychology. And I only say ethnic minorities because it is something that I've got experience in. So if you do think that you want to train as a forensic psychologist, I should say, and that you are on the route of doing so, and if you've got the drive the resiliency to be able to start a group of your own, please do reach out to us. Let us know how we can better cater for people of different needs, and to just spread the word. Really, we are currently doing something where we are calling it decolonizing the curriculum. So we are looking at how during the training, especially the doctorate route or masters and even undergrad, how there's a certain topics or certain let's just say stick with topics, how there's certain topics that don't really cater to different kinds of minorities. If we're thinking about ethnic minorities, for example, we talked about how there is a disproportionality of, you know, Black and other ethnic minorities within the prison or the criminal justice system. So, for example, we're trying to seek out ways such as the Lamy Review, ways of trying to work things out and trying to understand it better and how we can then go ahead and tackle it. So that is the little bit of work that we are trying to do. But like I said, if you've got any ideas, any suggestions, or any other resources that you want to bring to light to us, then do let us know. Reach out and do let us know how we can do that in a better way. But yeah.
Thank you, Anna.
You're welcome.
James, I am aware that we are running short of time. We had a couple of slides about challenges and what we loved about our job. Would you rather us do that or answer questions at this point?
Yeah, carry on. That's absolutely fine. Yeah, Anna's staying for the panel, so I've made a note of some of the questions so we can put those to. We've got about 10 minutes left.
Okay.
Okay, so we have kind of highlighted a few challenges along the way. But yeah, we wanted to spend a couple of moments thinking about the challenges that we have faced and that we would like to have someone to give us the heads up about before we went into forensic psychology. And we kind of talked about it earlier already, but when Anna and I were speaking yesterday in preparation for this call, we were thinking about the different themes, the challenges that there were. And the overarching one we found was just the mental health side of things. And that doing an academic study, qualifying is always going to have its challenges, but it's really important that we're aware of them and we really put ourselves first, because when we have a goal in mind, I think for me, speaking for myself, I get myself so set on setting deadlines and submitting pieces of work, and I absolutely lose sight of everything else. I've got a deadline at the moment, and Hannah said yesterday that maybe the reason I have my sore throat and I'm feeling unwell is perhaps just because of all the stress that's been going on. And I think it was a very valid point to make, and some reality confrontation that I probably needed, that it's important that we focus on ourselves and our personal lives as well as just race to get qualified. And I think over the time of training, I have come up with many hurdles. I think working with the client group that we do and working in the prison, for example, I'm working with a lot of damaged men. I work with men, I appreciate there could be women also. I work with damaged men and trauma everywhere, both by what these men have experienced and what these men have done. And Channel 4 makes it sound fascinating, and that everyone wants to kind of get in those prison walls. And it is really rewarding and fascinating work, but you can't ignore the fact that your brain has heard things that aren't okay to say out loud when you're bowling with your friends, because you get this sort of, I don't know about you, Anna, but I feel like I have this sort of like dark humour side of me.
Definitely.
I try and cope with it, and it makes sense when you're in the environment. And you take yourself out and you make a joke and everyone's like, no, I didn't land.
Honestly. That is so true, but you have to, I think that's actually been a piece of research within forensic psychology, how people use dark humor to be able to, just continue to pursue it. But it is so true. And that just reminds me, the first time when I went to buy my car, I looked at the trunk of the car and I said to myself, oh yeah, it's quite big, you can hide a dead body in there. And I actually said it out loud, and I was thinking, that's not okay to say. That's not okay to say, but that's just one of a silly example that I had. But it's true. Like Emily said, we have to take care of ourselves. We've heard things, we've probably, read things about. I remember there was one case before I actually gone to the doctor that I was reading, and I think it was just around like 10 a.m. and I had a 9 to 5 working day. And I remember I was reading this and I couldn't stop reading it. But then after I finished reading it, I just went to the toilet and I just started to cry. And I was crying like something else. I was bawling. I was literally like, I have to go home. I can't do anything else today. I was crying. I left. I came home and I just cried and cried and cried. And I was like, wow, this is literally the kind of things that we might have to expose ourselves to. And that is okay. At the end of the day, you are human. I know people that, you know, they had to change the kind of clientele that they worked with, especially women. They had to change the kind of clientele that they worked with. For example, once they found out that they were pregnant and they were going to be mothers, they said to themselves, I can't work with this particular people that have committed this particular crime because of, I just can't. Right now, I can't. I was able to before, but at this point in stage in my life, I can't. And again, that is okay. We are humans, not robots. And like Emily has said, Channel 4 makes it look so glamorous and so interesting. And I can't lie, it is. And one of my drives is to, you know, make sure that we are then rehabilitating people if they're going to go back into the community. But at the end of the day, we have to take care of ourselves whilst taking care of others too.
One of the things that I always found was when I first started working in the prison, when I finished my day, my mum would always ask me to text her when I got in the car. No, I take your phone in. So yeah, so for a really solid amount of time, actually, I would keep up with this. And then one day I forgot. And obviously she then thought I'd been kidnapped or kept hostage. And I was, oh goodness gracious, we can't live this life, Mum. This isn't ideal. And even like with my partner, like if I come home, he'll say, oh, how's your day? Oh, I say it to him. He tells me about his day. I sometimes don't want to tell him about my day because I feel like I don't want, and this makes me sound slightly, it's a coping mechanism, but I realise it might sound slightly strange. If I don't want to talk about the men that I work with in my house, because then I feel like I'm in the house. So we then have, I guess what I'm trying to say is, your relationships, I have found my relationships, you have to work harder at them to make it work for you, because I don't want to come home and talk about my day sometimes, but I also don't want to dismiss a relationship, dismiss a conversation with my partner about my day, because it's just odd. So you kind of have to find ways to make it work. And when you go out and people say, what do you do? And you tell them you work in the prison or you're a forensic psychologist. Oh no, I've been so many different jobs. I've been a chef, I've been a hairdresser. It's really awful that then they ask questions about it and I need to go more prepared. I think I need to have a solid script of things to say.
Yes. Yeah, but I guess that just reminds me, when we were preparing for this presentation, we were saying that we were so glad to have found each other, because we have been supporting each other through the highs and the lows of our training. And I cannot say enough, I'm so glad to have found Emily and other people that have been supportive of me, that have been cheering me on, even when I don't know how to cheer myself on. And that's exactly what you need. Even though forensic psychology in the UK, everybody says it's such a small field, a small division. Like everybody says, oh, everybody knows everybody within that field. It can be such a lonely place. And so, you know, finding your network, finding your community, finding people that you can vent to, you know, like Emily has said, when you don't want to say how your day has gone to your partner or anybody else, you can go to those people that are actually going to understand what it feels like to work in that sort of environment, or to work with, you know, the kind of people that we work with. It is so important. So by any means, we definitely recommend people to, you know, reach out to other people who are either, you know, trying to pursue this field as a career, or people that you already know are qualified, such as the Division of Forensic Psychology, you know, the minorities group that we're going to be starting very soon. What's the group that you've got, Emily? The ones that for students, right?
Yeah, we have a trainee. I've put the tag at the end of the show, at the end of the slideshow. We have a trainee forensic psychology Instagram page, and then we also trainee reflective spaces every other month where we get together and via Zoom, and we just talk about all the things that we're struggling with. We offer advice, we celebrate each other's achievements. People have had them, and it's really good. I felt like Anna said, you kind of feel a little bit alone. I have felt alone before, and it's important that you find people like Anna who you can totally just gel with, and you feel safe enough to talk these things through with them.
Yeah.
Shall we end with something positive?
Definitely, because it seems like so like we're going down on a downer.
Right, so what do you love? Tell me what you love about your job.
I love meeting people. I love seeing not necessarily the end result, but I love seeing the positive change that we can encourage the people that we work with. I love learning. I was saying to you yesterday that the different kinds of training that gets offered to us is just amazing by people who are so, well known about it. Like, for example, I had a training with Professor Chad Maruna. When I first met him, I was like, oh my gosh, I've read papers about him, and now I'm seeing him in the flesh. He's like a celebrity in the forensic psychology field. I'm like, oh my gosh, this is amazing. And I get to brag about it in my support, my personal statements. So I'm like, yeah, it's a plus, most definitely. But yeah, I love our little community. I love that, the end goal that we have got, it's supposed to be benefiting for everybody in our society. I love meeting people like you, Emily. I know I keep on saying that, but it's just so important, especially to me, because of the journey that I've had so far. But yeah, what about you, Emily? What do you love about your job?
I think I didn't anticipate learning so much about myself. I knew that I would learn about forensic psychology and how to be one, but I didn't anticipate the personal development that I would go on.
Oh yeah.
What I like about the diaries is you can look back. Like, I've literally looked back recently doing submission from like 2 years ago, and I'm like, what on earth was I writing? Slightly embarrassed, but also it shouldn't be embarrassed about my previous self. What I like to look back on and think about how far I've come, like how I experience the same thing, and I handle it differently, and the things that I've learned and I put into practice, and how like you reflect so much in your professional life that it kind of filters into your personal life, and not in a bad way, in a nice way.
And just one last point as well, just going off of the previous presentation, when we think of like the jobs that we applied and we didn't get, what did you learn from it? It has definitely built into the person that you are becoming, and it's all about the journey of becoming. You're not going to be the same person that you were 2 years ago. So who you are today is somebody to be definitely celebrated and to show it off. There's not going to be anybody else in this journey like you. You've got your own individual journey. Don't look at others. And when I say this to you guys, I say to myself as well, because in this journey it's very, very hard, but don't compare your journey to that of others. You've got your own journey, and that's what's going to make you the kind of clinician that you are going to be. So definitely focus on that and celebrate it. Failures are not, forever. You are going to become somebody else that you're not going to recognize, but you're going to be so proud of, and that's what you need to hold on to. So yeah, that's what I wanted to say.
Anna, you ended us there brilliantly. There's nothing else there.
Thank you very much, Anna and Emily, for that talk there. There's been, you can probably, once you've finished, have a look at some of the comments, but just to reiterate, really, my thanks for your presentation and the talk you've given. It was really inspiring and really interesting to hear about your journeys in the challenges and how you've overcome them, but also the fantastic work that you are doing and contributing to the area and the profession. So thank you both very much for your time and for that information today. Thank you very much.
Thank you, James. Thank you for having us.
I'm really pleased now to welcome on our next panel, our next chair, who's going to introduce our next speaker. So I'd like to welcome Ellie, who's going to introduce our next speaker. Thank you, Ellie.
Hi everyone, so I'm Ellie, as James introduced me. I am the mental health lead for the student committee. of the BPS, and I'm going to be chairing the next section. So without further ado, I'd like to introduce Ben, who is an extremely accomplished individual with experience in as a psychotherapist, trainer, lecturer, consultant and coach, the list goes on. So Ben's going to be talking about counselling psychology, which he has numerous qualifications in. So I'll hand you over to Ben.
Thank you very much indeed, Ali. Yes, all the things that I'm doing, I think, are just a reflection of my age, to be honest. But there you go. I'm older than I look. Welcome, everyone. I'm going to, it's nice to see you here today. I'm going to be running you through my journey so far, because I'm still on my journey, really, to become a qualified counselling psychologist. But it's been a bit of a sort of windy journey. So hopefully it'll be quite, it'll be quite of interest to you, because these things are not always, don't always go in a straight line, etc. I hope everyone can hear me okay. And if that's the case, I will make a start. Okay. So yeah, I'm sure there'll be questions. It'll be about half an hour, and then there'll be plenty of time for questions at the end, and we can hopefully pick up some questions in the chat as well when we do come to the end. So there you go. My psychology journey so far. I'm a psychology honours graduate from Bristol University, and then I've picked up some other qualifications subsequently, which I shall talk you through, and hopefully it'll be of interest. So first of all, let's go way back to my school days. So I was at St Paul's School. It's an independent school in London, quite a relatively famous one. That's when I first became interested in psychology. I will say there was no option actually to study psychology at St Paul's then. I think it's become much more popular now at A level, but wasn't really an A level subject, unfortunately, when I was school. But when I was 17, I thought, this is what I want to do. I was going through some stuff myself, which is often the case as an adolescent, and I thought, I want a better feel for what makes people tick, and psychology is probably the thing to do. So as I said, I was going through some difficult circumstances. My mum, who was our primary caregiver for myself and my twin brother, had spent actually the better part of our childhood in prison, but she had kind of come out at various sort of key points, but she was back in prison when we were doing our A levels. It was a very difficult time for the family generally, and my predictions of AAB turned into CCD, but undeterred, I still applied to study psychology at Bristol University, which is one of the, at the time certainly, was one of the best psychology courses in the country for undergraduates. I also applied to Keele, I think, but it's a long time now. I'm pretty certain I applied to Brighton as well, but anyway, I'm not quite sure about that. So it was a bit of a long shot with Bristol. They required, if I remember correctly, ABB, and obviously I was nowhere near that, but I went along and kind of said, take a punt on me, special circumstances and all that, and I managed to get in, which was great, because obviously Bristol University is a great university. So there I was in 1988, new undergraduate, 1988 to 91. That was my introduction to psychology as a discipline. And whilst I didn't much like the stats, I have to say, I'm still a bit like that. I kind of tend to veer towards qualitative research methodology these days. But I love the rest. It was definitely the right thing to do. It was endlessly fascinating, a huge subject for me to get my teeth into. And I specialized in my final year in these subjects: social, cognitive, neurodevelopmental, and parapsychology. It was just great. I was doing something that felt very me, felt very natural, and I had a great old time of it. My third year project was on the influences of sexuality in adolescent males. So already I was kind of thinking about this subject, because as you'll see, you know, it's kind of my interest in this area has kind of carried on. I graduated with a 2-1, which was also great, especially as, once again, unfortunately, when I was in my final year, my mum was out of prison and then she was back into prison. So there was a lot of personal disruption to try to deal with them. And luckily it wasn't a repeat of my A-levels, and I did manage to get a 2-1, which I was actually very pleased with, I have to say. So that was my university days. From there, so this isn't quite as left field as it might seem. I joined the British Army as an army officer. I had actually determined at quite an early age, probably when I was about 16, it might even have been slightly younger, 15, 16, that I really wanted to be a British Army officer. I wasn't sort of put off by the sort of lack of representation of coloured people in the officer class at all. And I thought, look, you know, if this is something you want to do, why not go for it? There was something also about, because of the very uncertain family life and structure, that I needed an organization around me that could maybe provide me that I wasn't getting. And just to, you know, again, in short, my brother and I were fostered, we were adopted, we were in children's homes also at one point, you know, whilst also being at a major public school. So it was a pretty strange and kind of difficult childhood. So the army for me was going to give me the some stability. It was a bit of a career interlude, always. And there you go. Yeah, being an army officer at 21 was more pressing really than being a psychologist. Although I have to say, you know, on completing my degree, I was very, very tempted by going down the forensic side. I know we've had a couple of forensic psychologists on earlier, of going down the forensic psychology route, probably because I was really into this series called Cracker, with Robbie Coltrane at the time. So, but it never happened in the end. It never happened. So I served in the 2nd Royal Tank Regiment for 6 years, and I got my UN and Northern Ireland medals, and then people often ask me, you know, you are a psychology graduate, what's the applicability? You know, people in the army, I guess. And my response was, actually, being a junior officer does very much involve being an agony uncle, being a parent really to your troops, often most of whom are very young. So I considered actually that my background in psychology was a great help. Actually, it really did help me to try to work my soldiers out and to help them. I'm a gay man. It was not legalized in the British Army until 2001. I left in 1998, just to give you an idea. So all the time that I was in the military, there was that hanging over my head that potentially I could get caught, I could get found out, and then I would get chucked out. And actually, a bit of a shocking thing was even when I was at Sandhurst doing my officer training and before actually joining up with my regiment, and that was when they decriminalized it. So at that point, if I'd been found out, I would have actually been packed off to the military prison in Colchester. So I left in the end. I couldn't really wait. It was 1998. I thought, look, you know, I need to get out and come out and be the person that I need to be, you know, and not conceal my sexuality anymore. So I left, and then I started to swing back. You know, I'd always thought to myself, I want to do something that is related to psychology somehow, and I started to swing back in that direction by getting a job at the corporate end, actually, initially, of an employee assistance program provider. It was the start of my counselling journey, obviously getting into the counselling piece. And I actually got that job, strangely enough, because one of my friends in the army, his dad knew very well someone who was the managing director of this organization that I ended up as an account manager for. So it was a sort of the old boys network, I hate to say, you know, that managed to help me to get in. So I went in at the corporate end, but obviously there's a huge clinical element to that. I'd been a recruitment consultant, absolutely hated it. It was awful. So I went into this. It was a real step change, and I remember. So as I said, Army and Psychology Connections got me the job. I started the business end, but was very interested in the clinical side. As you can imagine, I was keeping a weather eye out for what our counsellors were doing and all the rest of it. Our clinical director, I'll never forget her, a lady called Dr. Angela Hetherington, was a clinical psychologist. And it was she actually who said to me, you know, you're a psychologist. Did you know that there was a counselling psychologist at that time, actually, because we would have been talking 2001. I'm pretty certain it wasn't quite yet a division. But anyway, she was the one who said, look, you know, there's this counselling psychology thing you might be interested in. Yeah, it wasn't made a division until 2000. So, you know, this was my start of journey back to this sort of counselling psychology. So after 2 years as an account manager, I got permission to do a level 5 counselling course at Manchester, which is where I was living at that time. Again, my psychology qualification helped me into that, which was great. So I'd, you know, skipped the sort of levels 1 to 3, which you often have to do, and went straight in there, which was great. My company, the PPC, was very generous and said, you know, as long as you make your time up, you can do this. You can do this course, which was fantastic. So I left that course at the postgraduate diploma level, got myself a postgraduate diploma. I did start the master's actually, but then too many things were going on with work, and I kind of had to sort of take myself off that, and took on a role as a clinical director of the employee assistance program provider, because now, of course, I had that clinical knowledge and the corporate knowledge, and it would, you know, it was seen by the organization as a sort of win-win, really. So that was that. So yeah, the course that I did was, as I said, a master's course, postgraduate diploma to master's course at Manchester University. Great university, I will say. So this is my second university establishment. I love the learning. So the course was an integrative counselling course, and our course director was a counselling psychologist. So this was quite handy, really, because there was a number of us on that counselling course who were also psychology graduates, and she really, really encouraged us to go down, you know, a route to becoming qualified. And actually, she was trying to get the course accredited by the BPS. It didn't happen in the end, unfortunately. The models that we studied, the counselling models, were person-centered, obviously, you know, one of the most popular ones. CBT, also one of the most popular ones. Transactional analysis, which is a fantastic counselling model and form of communication in its own right. Gestalt, which I'd never really quite understood, I have to say, and psychodynamic, which is, you know, at this time, which is in the early noughties now, had quite a strong influence within the counselling psychology field. Psychodynamic. My first supervisor, a guy called Ray Wolf, who was very influential within the counselling psychology field, wrote the journals of counselling psychology. He is psychodynamic, and so this was a big part of the field. So my student placement was at the LGBT Foundation in Manchester, which was also fantastic. You know, really gave me some good clinical experience and knowledge, and I found that to be extremely useful indeed. And then my dissertation, so it was a sort of project idea initially, and then turned into a dissertation. Obviously, for me, I was going to write on the influences on therapeutic identity of being both Black and gay. Now, this was before I'd ever heard of the word intersectionality, but that's effectively what I was wanting to write about. And obviously, from, you know, I was taking it from my own knowledge and experience as a Black gay practitioner. So that was Manchester Uni. Now, counselling psychology. Now, so a return to psychology, really. Because of the influence of our course director on the counselling course, I got myself back, got my graduate recognition from the BPS, and also started to get involved with the division for counselling psychology. So I registered to do the qualification. So at this point, I was thinking I'm going to do the qualification for counselling psychology. It was called the independent route at the time, because it was BPS, its own qualification, effectively, that allows you to become a qualified counselling psychologist, although without the doctorate title, I have to say. So I was going to pick up the same research. I was going to basically deepen that master's research I was going to do. One of my tutors at the University of Manchester, a lovely guy, became my coordinator of research. I met up with a coordinator of training who was at Chester University at the time, and actually has subsequently been the program director or one of the program tutors at Manchester University on their doctorate course. He's still my clinical supervisor to this day, which is great. And I was in and out of the independent route. I did find it quite tough. I'm quite a gregarious sort of person. I like to be around people, a bit of an extrovert. And I just I was a bit in and out of this independent route. It felt to me a bit isolating, to be honest. You didn't really know who else was doing it. And I find it quite pricey as well, and a bit admin heavy. I know they've made a lot of improvements to the independent route subsequently, because obviously as the trainee rep, I do speak to people who are on the route at the moment. So I kind of ducked out in the end until in 2012, when I formally exited from the independent route. I had, as I said, though, become involved with the division from around 2008, when I also started attending the annual conference, which is fantastic. It's a real good chance to network, meet, other counselling psychologists, other trainees, and just really kind of get connected to the division. So I decided to bide my time as regards the doctorate itself, mainly because of work and monetary reasons. It was going to be very difficult to fund it, especially when I went into private practice. So I've been on the division's executive committee since July 2019. After a couple of years as a member of the conference committee. So I remember I was getting involved. And then by this time, as you will see I'd started on my doctorate. So I've been on the executive committee as the trainee representative. There are 90 members, including the chair. It's a full and sort of involved organization. We meet 6 times a year for the executive committee and strategy. My role as the trainee representative is to liaise with training bodies such as SIPAG, which is Psychology Postgraduate Affairs Group. Jade Hardy is my good friend on there, and we speak often. And also the TCCP, which is the Training Committee for Counselling Psychology, a very influential body that that puts on counselling psychology. Well, they basically look after the training and all things training. So it's actually a really, really important body to be involved with. My job is also to provide ongoing support to the trainees. So if, for example, we do these online Zoom sessions every couple of months, where the trainees from different courses can network and meet each other and just talk about their experiences at the different organizations, because there are quite a few bodies that provide doctorate courses, and then there's also the independent route of qualification. I also organize and provide some free training events to the trainees. We just did one on ASD and ADHD for young people, which was great, presented by qualified counselling psychologists who are working in NHS and other places. So that's been really useful as well. We had a panel last year and a couple of other things as well. And also I provide a communications hub via things like social media and the division e-letter, okay, which people have to kind of opt in on. And also, obviously, you know, my job is to represent the trainee voice on the executive committee. And I really do enjoy it. It's been, you know, although obviously we're all very busy, it's been really good to you know, to get to be in that sort of position. So meanwhile, to cycle back, counselling psychology was a home. So this is me post my counselling course now. Counselling psychotherapy was a home. You can see that the BACP has been my governing body, main governing body since I qualified as a counsellor and psychotherapist. And I set up a successful private practice in 2013, I can't even remember now, which is basically my main source of income. It's busy, you know, I get a lot of referrals and word of mouth, which is great. I also in 2010 qualified as a life coach, and I do some coaching as well. I do 1 day's coaching. I also in 2016 qualified as an EMDR therapist. That was training that was provided free by Freedom from Torture, which is an organization I worked at for 11 years and really enjoyed working there. But being EMDR qualified has just allowed me to provide some support to a whole bunch of people around trauma and complex trauma where maybe other therapies have just not worked. I've been an accredited BACP practitioner since 2014. My main work in my private practice is employee assistance, plus EAP consultancy and audit and clinical training. I should actually also say, by the way, my main work is also private. So I probably have about a third private, a third private health, and a third employee assistance in terms of my client, in terms of the client groups. A lot of people, as I say, do come back to me through word of mouth, which is also great. I get a lot of referrals like that as well. So, and in 2014 as well, so 2014, quite a lot was going on. I'd just gone into private practice, etc., etc. But I was also married to my lovely husband, Adam, who I've now been with for 9 years, which is great, 9 and a bit years. And we got married in 2014, September 2014 in Liverpool. So he's a Scouser. I won't hold it against him. So yeah, lots going on. And as I said, really throughout this period, BACP was like my main governing body, even if I was still sort of kind of interested in the sort of counselling psychology piece. So I'm also a published author in terms of chapter contributions to a couple of books. I've contributed to a psychology book, Leadership and Diversity in Psychology, looking at it from the perspective through the perspective of my life, really, and I found that to be a useful process. I'm certainly interested in doing more in terms of writing. That's the book, and that's my chapter in it, Leadership and Diversity. It's Routledge, published by, quick plug, and also I've also contributed to a coaching book as well called Humane Justice. The type of coach, well, the organization that I've been coaching at really since qualifying as a coach is mainly concerned with the criminal justice system and helping people through that, either prisoners or people who are about to become part of that. And so I helped to write a book chapter for that as well. And that was also extremely enriching as an experience. So where am I now? What am I doing at the moment? As you will have heard, I am also now a trainee. So I finally got myself onto this doctorate course. I also got a place at the Metanoia Institute in London, and I was seriously considering going, but then in the end, I decided to opt for Glasgow Caledonian University, as you can see there. Me attending a doctorate course did become much more practical when the government opened up student loans to doctorate students. So I started, I think it was 2017, 2016, 2017. So I started part-time at Glasgow Caledonian in September 2018. So it's 6 years part-time. That's the minimum time it would take. It's going to take me longer than that because I did take a year's interruption at the beginning of this year, because of everything that was going on with COVID and stress, my mum was very ill. Black Lives Matters was weighing very heavily on my shoulders as well, and so I just and obviously we'd all moved online, which was a bit of a thing to which I was finding quite uncomfortable. So I'm going to be restarting in January 2022. I mean, the reality is I've kind of restarted already because it's stuff that I need to hand in, like my first year research, etc. I'm in it for the long haul, so it'll take me another 3 years to complete my studies there. Main models at Glasgow Caledonian are CBT and person-centered, which is great because they're on completely different ends of the scale in terms of therapeutic sort of, how they work in a therapeutic way. So bringing almost 20 years by the time I started, it was kind of 18 years of counselling experience into the course has actually been quite tough, because I've had to kind of unlearn some things, relearn some other stuff. It's been great in some ways because, of course, I had a lot of clinical knowledge, but it has been quite tough in some other ways in terms of doing things like people want them to be done, et cetera, et cetera. My research is on Black gay intersectionality and the influence of work and training course tonight. So you will see a bit of a theme here. I've basically effectively deepened what I started doing when I was doing my my counselling masters, and it's been great to I've had some really good enthusiasm and support from my research supervisors. I've got 2 research supervisors, one who's gay and one who's Black, and it's been fantastic, I've got to say. So hopefully that will be out soon. And then my placement, my first stage placement was a bit unconventional because I basically used a private practice. It was quite important not to try to find a paid placement because of the situation with my work, and obviously I was already losing a day a week to uni anyway, and then another day to placement was going to put a lot of pressure on my financial position. So the university was very flexible actually and allowed me to hook onto a private practice, which is great. Stage 2, I'm still looking. I did have a placement set up, but they've stopped taking students, which is a shame. That was in Ashton at an NHS organisation there, but I will find something. I've got a lot of contacts, and I'm going to be I'm still searching around to find somewhere that I can start in February 2022. So that's me at Glasgow Caledonian. It's a great university. It's campus university. It's small, compact, but it really is great. I've got to say, I do love it there, and I miss it as well because I haven't been up there now for since for the better part of 15, 18 months. So that's something I do, and I'm looking forward to getting back. Okay, so we said we'd leave a good 10, 15 minutes for questions. So that's it for me. And
great.
Yeah.
Thank you, Ben. That was such an inspirational story. So yeah, we have a few questions. So let's kick off with, what experience would you say would be relevant to get into counselling psychologists?
Okay, that's a good question. So a lot of people, I've actually been talking to a few people in my position as trainee rep, actually, because I do get people on social media asking and such like, and it's always a good thing to get yourself some counselling experience. I say to people, if you want to get in and a good sort of not a buy, but if you want to get a good leg up, shall we say, into a counselling psychology course, then I would really advise you get on at least an introduction to counselling course, preferably actually more like level 3, which is above the introduction level, and then you will have some clinical experience to take into that sort of interview process, which is great. But there's other ways you can do it. Becoming an assistant psychologist is another route in potentially through the NHS. But obviously, I'm a bit biased because I'm a therapist first and foremost, and I would certainly well advise. They're not very expensive. If you get on, certainly get on an intro course and then see how you like it. Thing. But I would suggest a level 3 would be a really good way in. Okay.
Great, thank you. So are there challenges faced in setting up as an independent practitioner?
Oh yes, yeah. I mean, there are a lot of challenges, but here's the thing. It's an interesting one. So I obviously set up as an independent psychotherapist, but at the point I set myself up there, I'd actually been practicing as a psychotherapist for a good 12 years. So I had a lot of experience. I had some background to fall back on. If you go down to the counselling psychologist route and you decide that you want to become an independent practitioner, it's actually quite easy to. A lot of counselling psychologists are in private practice. It's quite easy to do that, and you will find that your qualifications and experience as a counselling psychologist will be of great benefit to you in terms. Because the thing is, I advertise on BACP website, Counselling Director, and places like that. Bupa, etc., and they're always you can filter through experience and such like that. So the fact of you getting yourself a doctorate, etc., would be a bit of an advantage anyway. So a lot of counselling psychologists have been moving away from the NHS into private practice. There's definitely there's all number of reasons. So I would say it's relatively. And I know some friends actually who have qualified in the last few years who have also done similar. But actually what I do also tend to find is a lot of counselling psychologists are what we call portfolio practitioners. In other words, they do some private practice. They might do maybe a day or two in the NHS or so at a charity. Do you see what I mean? They've got a mix. And that certainly for me, in my private practice, has been the best thing to do, because you're not then putting all your eggs in one basket. So I have some of my EAP clients, I've got private health, I do some charity work, and then I'm doing clinical consultancy for organizations elsewhere. Do you see what I mean? And that's probably your best bet in terms of not sort of putting all your eggs in one basket.
Yeah, that's really interesting. Thank you for that. Another question is, you've completed so much training and professional development. How do you stay motivated through all of that?
That is a very, very good question. How do I answer that question? So look, the thing is, okay, and this is funny. I was talking to my therapist about it, because obviously, as you probably know, in order to become a counsellor, you have to have personal therapy. In order to become a counselling psychologist, you have to have more personal therapy, okay, whether you think you need it or not. And I was talking to my therapist about this not so long ago, and I just said, the reality of it is that ever since I started that counselling course, it's kind of like been this imperative in my mind. I need to bring it all together in that way. When I was a starry-eyed 19-year-old at Bristol University and recognized my love of psychology, it was like, ultimately I joined the army and things like that. But there was always this thing, people were saying to me, maybe you could go on and become the first Black commanding officer or Black general this. I was always doing very well. I was getting superlative confidential, but I always had this thing that actually I probably won't stay, because I want to get back somehow to doing something which is to do with psychology. And so it's just always been in the back of my mind, and that is the thing that keeps me motivated, because it is, it's a tough course. The counselling psychology doctorate is a tough course, I've got to tell you, but it's I'm kind of laser focused. I've got to finish it. I've got to do it.
Definitely important to do something you love, I think.
Yes.
Yeah. So, do you have any advice for those looking to get published or publish their own research?
So with the research bit, I'll talk about the research bit first. So certainly at Glasgow Caledonian, I think most of the doctorate courses as well, when you do your research, you are encouraged to publish it in a journal. So the journal I'll be publishing my research in is going to be the Journal of Black Psychology, so it's generally speaking, your doctoral research at whatever level will usually be published in somewhere or another, as it were. In terms of the kind of books and things like that, I think it's just a case of or quite often it's a case of what networks you're involved with, I guess. People, and this is why I would really encourage, if you do, whatever you go on and do, guys, whatever bit of psychology you want to go and do, get involved in the division, get networking, things like that, because that's where you often find the academics and people like that. And people will, you know, if you're doing something interesting, whatever, then people will notice you. And that's often how you then get kind of into the sort of book publishing stuff. If you just want a book published off your own back, there again, there'll be people within your discipline who will be able to help you with that if you kind of get involved. And I know of some people in the Division for Counselling Psychology. Mick Cooper would be one. He's a prolific author, someone I know, who's written loads of stuff that encourages people to publish, you know. So that's the advice I'd give, is get involved in your division, whichever one it is, and that's usually how you find the people who can kind of encourage you into that sort of thing.
Yeah, I can definitely vouch for sort of getting involved with the divisions, obviously being on the student committee.
It's the way forward. Yes,
yeah,
absolutely.
it opens a lot of doors. So
It does, yeah. Yeah, it does.
So let's go with, how do counselling psychologists differ from counsellors in regards to the work they do? So
okay, that is a very good question as well. So, and one which, you know, I've had to sort of distill in my own mind really since starting my doctorate, because obviously my training and qualifications prior to starting the doctorate course are clearly as a psychotherapist, as a counsellor. So even if psychology was my first degree. So what I've found generally, and this is a very subjective perspective, I have to say, is that the focus in counselling psychology, there's a laser focus on research, which tends to be the thing that I find tends to differentiate the type of work that we do as counselling psychologists from the work that maybe I might have been doing just as a counsellor or as a psychotherapist. There's this real, and you know, you can use that focus therefore in your client work, you know, in terms of psychological information sharing, to you know, and to aim your practice really, you know, in terms of where it's at, you know, think about what the research is saying and all the rest of it. So I would say that's one of the sort of key differences for me, is this sort of real focus on the research and the research evidence and psychological information.
great, thank you. Probably have time for one last question. So how did you become qualified as a life coach?
Yeah, so good question. I mean, I just thought to myself, you know, I'll tell you how that happened, because when I was working in the employee assistance program industry, so as well as providing counselling services, the EAP, some EAPs also provided coaching, and so that's kind of how I became aware of coaching. And then when I was kind of between jobs, and in 2010. When I, you know, and I thought to myself, you know, it'd be good, it would be another string in my bow really to get myself qualified as a life coach. And then I just looked up some life coaching courses and went and did a course in London. I'm actually part of the divisions, because there was a special group in coaching psychology, which has now become the division of coaching psychology, and I'm actually a member of that division as well. But I do think once I've got my doctorate, I keep saying to my husband and everyone else, that will be it for me for studying, you know, because someone has said, you know, I know some people in the division for coaching psychology say, come on, Ben, you know, what about getting yourself qualified in this discipline as well? And I just said, no, I will have had enough, I think, by the time I qualify as a counselling psychologist. So there you go. That's how I got into life coaching. But you know, I found it useful because there were certain psychological principles in coaching which actually, you know, there's a big overlap. And so you know, some of the psychological principles in coaching, in strategizing, goal setting and stuff like that, can be very, very useful in my clinical work as a therapist as well.
Yeah, that's really interesting to see the transferable skills there between professions.
Very much so, very much so.
I reckon we do have time got a couple minutes for the final question.
Yeah, you do.
How do you get experience when it can sometimes be hard due to confidentiality?
Yes, this is a bit of a problem, isn't it? That is so what because I do get some people asking, you know, can they kind of tack themselves onto my private practice in terms of trying to get experience, and it's just like, that's not really going to work. But the thing is, okay, what you can do though, you can get experience that doesn't necessarily need to involve you sitting in on actual sessions with clients. You see what I mean? You can get experience by just, if someone has the time, it's really about, does an organization or someone have the time to provide you with, if you're interested with a thing. And I think that's really where the difficulties can lie. My private practice is very busy, and I have had to knock back a few prospective students and say, look, I just wouldn't have the time to do that, unfortunately. But I do know, some psychologists who have got a bit more time, maybe they're coming towards the end of their careers, who probably are up for that sort of thing. And again, this is another reason why it's useful to get involved with the division, even before you join, even before you say go and do your thing, is try and get involved with the division. You can join as a prospective member, I believe, and then you can get the e-letter and communications and stuff, and then you might be able to just ask around or get on social media, get on one of the Facebook groups, of which there are plenty for the Counselling Psychologists. Counselling Psychologists UK is the main one, by the way, in Facebook. And just get on there and just ask a question. And people are often very willing to help.
Great, perfect. Thank you so much, Ben. That's been really interesting. Ben will hopefully answer some of the questions in the Q&A function.
In the Q&A, yes.
That we haven't been able to answer. Yeah. So big thank you, and hopefully everyone's enjoyed that. So now I'm going to be handing over to our next chair and presenter.
Thank you.
I'm handing over to Ian.
Thank you very much, Ellie. I'm very regretful to have missed most of that session. It sounded fascinating. My name is Ian Danton. I am a master's student studying online in Derby at Derby University. I have a particular interest in social psychology, so I'm actually feeling really privileged to be able to introduce this particular session. So we're going to hear from Dr. Daniel Jolly. Dr. Daniel is a social psychologist. He studied in various universities, which I'm sure he'll share some of which, and he's currently at Northumbria University. His research focus is on conspiracy theories, so particularly interesting at this particular moment in the history of the world, so a very relevant area to look into. He has a particular passion as well for science communication and has appeared variously on TV and radio. So I'm sure we're really going to get a great deal from this session. I'm very much looking forward to it. Over to you, Daniel.
Just unmute myself. So hi, welcome. Thank you so much for that introduction, and well done to everyone staying engaged and watching. It's been, of course, several different topics, different presentations, so I imagine fatigue may be slightly to set in, but I hope we try and make it as engaging as possible. So indeed, I'm going to cover the basis of social psychology, but I am academic, so very different to what you've heard so far. As in, I haven't followed the doctoral centre route, shall we say. I am a research academic. So what I want to talk about will be relevant for those of you who are interested in following more research-based PhDs that then move on to more academia. So academia being a lecturer working in university, something akin to that. So whilst of course the focus, as I say, will be on social psych, that is my area, it is transferable. So the aim of my little section, half an hour, thereabout, depends how much I waffle, is to talk about, first the background, what is a social psychologist? And then think about my own career journey, how I got here. So including applying and think about the funding for funding my journey. And then thinking towards the end, hints and tips for yourselves if you're interested in following more that research route. So of course, what is a social psychologist? So as you know, psychology is kind of a sweetie bag. There's so many different things inside it. As you've heard so far today, there are what we call the accredited routes. So to be a forensic a forensic psychologist, or a sports psychologist, or even an occupational psychologist, you have to follow a set route. Typically it's doing a master's and then a PhD or a doctorate, like in forensic. When it comes to being a social psychologist, using quotation social psychology, there isn't that accredited route. Rather, you need to follow often the route of a master's and PhD, but not always. You can always go straight to a PhD, where you develop the skill sets that can then be applied in research. So it's not that you have to do a certain course like you would do in forensic, for example. It is much more wide than that. Indeed, it can just be a PhD research, which could be on social psychology. So it's quite different to what we've had so far, which I think is good because it offers diversity and also offers something novel that I can talk about. So social psychology is, the investigation of how thoughts, feelings and behaviours of individuals are influenced by the actual or imagined presence of others. So he's trying to explain how we live in the social world of how others and ourselves interact with it, where it's interested in behaviours, thoughts, beliefs, attitudes, intentions. It's a whole host of different things, but it's very much about how we navigate that social world. And just as a bit of history, the BPS Social Psych section was formed in 1940. So as you may know about the BPS, obviously there's a student side, but then of course there is sections and divisions, which is where students can also embed themselves into different parts of psychology. And as I say, the social section has been going for quite some time. But there are different applications of social psychology. So you may indeed identify as a social psychologist, and you may be inspired by research and very much want to keep your hand in that, but it hasn't always got to be academia. Academia is what I want to focus on for the most of this talk, but it hasn't got to be involved in just academia. So academia, of course, is, for example, a lecturer working in a research and teaching environment. But it could also be working in industry. So behaviour change, understanding people's behaviours is relevant in so many sectors. I would suggest most companies probably have something akin to a social psychologist in their team, maybe without them even realising. So for example, I have a colleague who works in the fire service. And whilst initially you may think, why would there be a social psych in the fire service? Well, of course, it's based on behaviour change. I'm trying to, inform behaviours around fire safety. So in a way, you're trying to nudge people to, make sure they check their fire alarms, make sure they close doors, things like that. That is, social psych really. And of course, you then also got working in the government. So, for example, the Home Office, MI5, MI6, they have the behaviour change element. And so it's not just applying your research as a lecturer. Maybe you don't fancy doing some teaching, which is fair enough, but there's so many other ways you could apply what we know here. So with that in mind, that is a social psychologist, I just thought I'd give a bit of an overview of my education and career, which kind of has been straightforward, but it is slightly unusual at some parts. And then I'll take you through each stage kind of one by one with a little bit more context added to it. But as kind of the overarching picture, I did my BSc in Forensic Science and Psychology, before then moving to a Master's in MSc in Social and Applied Psychology. I then completed a PhD in Social Psychology, but whilst I say it's Social Psychology, it is just a research PhD where there's no accreditation as such associated with it. So it could have been called anything really. It could have just been a PhD in psychology. It just happens, obviously, my topic and passion was in social, so that is what I kind of wanted my thing to be called. And then I moved on to a postdoctoral position, which was a research associate. As I say, I will explain all this a bit later, but a research associate before moving on to being a lecturer at Staffs Uni, then moving on to be a senior lecturer at Northumbria Uni. So that's kind of my career journey, going from education to doing a research job, moving into academia as in the lecturing position. But to kind of take you through each step and to talk about how I kind of manoeuvred myself through those different steps. As I say, I started actually with a BSc in Forensic Science and Psychology. So I've always had a bit of an interest in forensic science and psychology. So when I'm emphasising the word and as in literally it's forensic science degree and a psychology degree. It's not a forensic psychology degree, which of course do exist. It's those two separate disciplines. So for me, I had an interest in forensic science. I love CSI. If you remember CSI, love CSI. So it's very much, you know, at the crime scene. It's the investigation of the crime scene. It is the investigation, as in collecting evidence, fingerprints, etc. It's then analysing the fingerprints and working out who that person was. It's that side. But then also I had interest, at least at the start, in this more general psych, just people and the world around us. I suppose naturally I was interested in the forensic psych together, which is obviously about criminals themselves. But at least when it came to this degree, it was those two different things. Importantly, the degree gave the graduate basis for chartership, because of course at this stage I wasn't sure what I was going to do next. So this degree gave that BPS accreditation. So my journey through my degree, psychology, I enjoyed both. I mean, they're both not. I enjoyed them both, but I always enjoyed psychology a little bit more. So as I say, the forensic science was truly being a crime scene investigator. So I remember a particular moment where I was in a full suit, like a white suit, and I was investigating a crime in this house. We had to pick up evidence. I think I was doing fingerprints. I had to wear a mask as well, which, you know, is normal nowadays, but I had to wear a mask. And I was like, this is horrible. How do people work like this? How is this normal life? I just thought, I don't like this. Like, I enjoyed it. I enjoyed working out the science behind it. But when I was learning about the psychology, in particular the social psych in my lectures, I found that much a bit more interesting and more me rather than wearing this suit. So second year, actually, that's when I started thinking about the next steps. So not as in exactly what I was going to do, just that I quite liked being in university. I quite liked the learning, other than obviously the practical side when I'm wearing a white suit, but and I obviously quite like psychology. In my final year, my final year project was based on the psychology of conspiracy theories, which as mentioned is something I still dabble in. So what's that? 2010 is when I first started, so it makes me feel nauseous of how long I've been in this topic area, but that is what kind of interested me. So although at the end of my joint honours I am technically an accredited forensic scientist, it's not something I certainly wanted to do. So as I enjoyed the thesis so much, I looked for opportunities to develop on this. So I searched for courses in the area of social psych. I think it was, I can't remember, Google must have been a thing back then. Like, I know MySpace was a thing, but searching to see what courses offered that. I also sought out academic staff who were also exploring the psychology of conspiracies, because I found that really interesting. I thought this could be something that I'd kind of look into more. So putting keywords into Google to see were there any academics in this area. And actually, of course, like in 2010, actually there were hardly any. But I also explored other passions. So I remember being in second year and again, absolutely loving crime scene investigation. Something about, I don't know, things going badly. I was loving that. And I thought, you know, understanding the human factors involved in plane crashes of both the airline but also passengers is quite interesting. So I was looking seriously at MSc in human factors in aviation. But as subtly, I decided not to progress that and to go on to social psych. But nonetheless, the MSc in social psych developed a range of important skills, including advanced statistical analysis. Because of course you can go straight from BSc straight onto your PhD, if that's possible. But for me, I quite like developing advanced statistics, because of course in the BSc you get given the foundation, but not necessarily the advanced side, which are things that I learned during the MSc, things that I still apply now in my career to date. So for me, doing the masters were kind of spot on. And of course, I found that postgraduate study was quite different to undergraduate, at least for me. In my experience of undergraduate was large lectures, interaction seminars, but it was very much kind of wide scale. Whereas for my postgraduate, I found it was much more small group. It was, you need to read these papers and come and discuss them, which is something we try and instill in our undergraduates. I'm sure some of you here have that happening, but it was very much, no, this is what you do. Like, it wasn't like you had no choice. And because it was such a small group, there was no reason to social loaf. So it was very, very different experience. It was very much kind of hands-on and hot and heavy, but I quite, enjoyed that kind of style of academia. But I think a good question, I think, to think about is, well, okay, how did I afford at least the BSc and MSc? So I come from a working class family. I'm the first person to go to university. No one else, my sister actually behind me has been. So as in for my whole family really. So it was quite a different path to go along, which meant that circa 2007, when the Labour government, there was government support. Actually quite a lot of government support. So you're going to have to hold your breath while I tell you about this. At the time, there was grants and loans for undergraduate study. There was nothing at all for postgraduate. It was all based on undergraduate. They had what they called a maintenance grant, which was based on your parents' income. And depending on where you sat on the threshold, you got, you know, quite a healthy grant from the government. And being working class, we got the full amount. There's also, which still exists today, of course, is a tuition fee loan, a student maintenance loan, then also in the university there was grants and support, which again still exists, just hardship funds. So I was able to pull on all these different sources of funding. Now, in my first year, I worked out with my student halls and whatnot that I didn't actually need the full loan. I could actually rely on a lot of things on the grant and also the university support. But in my second year, which as I mentioned is when I started thinking towards, okay, well, the next step could be quite good to think about. I'm not sure what that is yet, but it could be good to think about. That I actually requested the full amount, because of course with a student loan, you pay back once you earn over a certain amount, and obviously it doesn't impact you financially, as in it's not on my mortgage, for example. So it was speaking to my parents as well, who obviously had no idea really either, to be honest, but thinking about it, well actually, if this money's available, well, why don't I request the whole amount? If I don't use it, I'll just save it. And I'm a saver. If you give me £1, I'll probably save 80 pence of it. Like, it's just the kind of person I am. So I was able to save actually quite a lot of the money that I received. Of course, it was a loan that I would pay back ultimately, but nonetheless, I saved. So the BSc was mostly funded on the maintenance stuff, and then, which unfortunately was abolished in 2016. I checked because I'm sure I had money when I was anyway. So it's abolished in 2016, unfortunately. And then, of course, part of the loan. But the loan was, as I say, I saved it. So my MSc was funded with the savings that I was able to save and also some family support. But I think, okay, well, that's useful, Daniel, but like, that doesn't exist nowadays. What does exist? What could exist for me? So as I kind of mentioned earlier in the earlier talk, there's obviously a postgraduate master's loan, which exists. And I did double check, and as long as you've not had current funding from the student loan company, as in you're not doing your BSc and MSc at the same time, or you haven't got an MSc already, it's there for you to take. Then of course there are grants and support schemes that could also offer. So for example, the university still has scholarships and hardship funds that you can kind of tap into. For example, at Northumbria, just as an example, if you stay on to do your masters after your undergraduate, you get a 20% discount on your course fees. So it's things like that that could, you know, help reduce that fee you need to pay. And there's also grants from charities and trusts. So I've linked a website there, and you can just Google it really. And there's loads of things out there that you can apply for to support your journey in psychology. So it's not as fancy or as kind as what I had, as in with the maintenance grants, but these things here exist to try and help you through the process of postgraduate study. So anyway, back to the journey itself, I did my masters. I then moved on to do a PhD in social psych, graduating in 2014 or submitting. So the PhD is a research PhD where it's 3 years to conduct an original piece of research. So think about it as your thesis, your third year thesis, but on a massive, humongous scale, where it's, I think my thesis altogether was, it's thinking of thousands and thousands of words, where the title of my thesis was a social psychological consequences of conspiracy theories. So it's doing a number of studies and trying to use quantitative methods, trying to explore a novel research question. But obviously, importantly, the applicant stages. So it was during my MSc that, when I joined the MSc, I had no real plan what was next. As you may have gathered from my experience so far, it's kind of do something and then think, okay, well, this is quite fun. What can I do next? That's what happened. So during the MSc, there's obviously discussion around PhDs. It was very academic. It was like, you know, you could apply for a PhD place. So I applied for the place with funding. So it was a proposal, covering letter and CV. My actual experience was because obviously it was such a new topic, would you believe, conspiracy theories at the time. I was going to develop on my master's thesis. So working with the same supervisor to develop on that. I found it ultimately that I was successful with a place on the PhD, but I was unsuccessful with funding. Now, it doesn't always work like that. Sometimes you can apply for a project and you are then shortlisted for that particular project and you're then given funding for that particular project. Or you can do what I did, where you apply just to a general call. So for example, I saw University of Kent offering a call at the moment for PhD applications, where you then submit a proposal and which is then considered for PhD place and funding. So it's happened that I got the place, but not the funding, because again, really competitive, blah, blah, blah. So options to me were to take a year out and to apply again the following year and elsewhere. At that particular point, I only applied to one place, but I could have applied to several places. I could obviously not have followed the route of a PhD, at least in the short term, and done something else, whatever it was, to self-fund with no loans, no grants or scholarships, so to self-fund it. Or if it was in 2021, there's obviously the postgraduate doctoral loan, which you could also go to. Which again, I had a look before this talk, and as long as you've got a PhD already, or you have funding already, you are able to apply for it. When I say funding, as in you can't get a master's loan and a PhD loan at the same time. It has to be after each other. But as I say, at the time, that wasn't available. So unfortunately for me, as I say, it was developing on my master's thesis, so I was very much, you know, in the middle of that project. I was just thinking, I'm not sure, like, what do I do? I remember speaking to my family, who again are like clueless, really, just being like, what do I do? And they're like, well, you could just try it. Like, you could just try and get jobs. I'm sure it'd be all right. Like, just try it. What's the worst that could happen? You have to leave the course. It's like, well, yeah, if that's true, well, that'd be horrendous. So anyway, for some reason, I made the decision to self-fund my PhD. Again, how did I fund a self-funded PhD? Well, so the jobs on a list now are things that were 0 hour that I did alongside the PhD. Now, as a supervisor now, and also the university regulations, this is not allowed. Not allowed. I shouldn't do this, what I've done. My supervisor at the time, I just didn't tell her. I was always meeting my deadlines and keeping on top of things that we were doing in the project. I just didn't fully let on what I was doing because I knew it wasn't allowed. But years later, they can't tell me off now. So I was an associate lecturer based in the university. So this means that I ran seminars, I taught. Now, if you got a studentship, you typically have hours that you have to teach as a condition of your studentship, and often there's hours available that you can use for people who aren't on studentships. So I took up some hours as an associate lecturer. I also took up some hours at a university nearby, again teaching seminars. I then took up also, so to flag, those two jobs were useful in my CV. So obviously it's kind of been a mini academic in a way. You're teaching, you're involved in the discipline, so it's things that are useful for my CV. So, you know, those are things that help me get a job in the future. But I also was a receptionist and I worked many varying hours, from 7 hours all the way up sometimes full time, you know, in a full 20 hours in a week. I also was a librarian for my sins, which again worked varying hours. I like these jobs for the flexibility, but also it was a lot of time on the computer. So when I wasn't doing all the stuff, I was working on my thesis. So I remember, like, people are coming, the students are coming to ask me questions. I'm like, oh, don't know, I'm busy here, I'm doing something else. So that's what some things I did. I also took on a lot of marking because, again, wanting money, I was always up for saying yes to do marking, so I did a lot of marking. I did lots of work with outreach, which I think actually was really good. So outreach being, I did lots of work with younger people, working with sixth formers, trying to bring them, showcase what university is like, which, I may not have done if I was, funded, because, I had the money, whereas I didn't. So it really kind of opened my eyes to working with other people, which I think was really beneficial. And lots of stuff for exam invigilation. So at one point, I was doing 7 different jobs at the same time. As I say, shouldn't do it. And now obviously there's more support now with the loans, but nonetheless, this is my life. I was even a mystery shopper once upon a time. Question is how? How did I manage to complete my PhD on time whilst juggling different jobs? I don't know really. I think I was just busy and I just managed to keep on deadlines, and I was interested in the topic, and I just managed just to kind of get through. Of course, this journey would not always work for everyone because, of course, it's stressful, challenging. Obviously, I knew where some money was coming from, but there was sometimes I just didn't know what money I was going to have in a certain month, which obviously is not an ideal place to be in. So anyway, I managed to, as I say, finish the PhD, or at least be close to finishing, and then it was thinking, okay, well, what next? Well, as I mentioned, there are different, ways to apply social psych in government work, in industry, and in academia. So I certainly was thinking, well, what kind of job do I like? I've enjoyed the teaching, I've enjoyed being a part, a mini academic, but let's be open-minded. So I applied and also interviewed for jobs in both in and outside of academia. So, for example, I was interviewed at the Behavioural Insights team as the assistant advisor. So kind of mixture between the government and kind of outside. So looking into behaviour change, nudging. It gets quite a bit of press nowadays. I was terrible. It was I think it was my first interview, post PhD-ish, and it was just horrendous. I was just terrible. Just embarrassing. I was also shortlisted as an editor for the BPS Research Digest, which would have been a whole different world, really. Still based in kind of psychology, but very different. Also, I was applied and interviewed for lecturer posts, teaching fellow posts, postdoctoral research associate posts. So the teaching fellow, that is where your contract is just fully teaching, so teaching students and supervision, whereas the postdoctoral research associate is a research role. And then ultimately, after all these applications, and there was plenty, again, a bit of a time where I was like, I'm not sure how what am I do next? I need to think about where I'm going to live. But anyway, I managed to get a position as a research associate based at Lancaster University. So it's a temporary position that will allows a PhD to continue their training as a researcher to develop skills and experience. So for me, it was a 1-year fixed term post, working on a variety of different projects to do with data collection and writing, with also analysis. So again, think about doing your final year project, but that as your full-time job. So it's very much, obviously, much bigger, several projects, but it's doing that kind of element of your degree to date, should we say. So there was no teaching and no supervision, it was purely a research position. And actually, the way it worked is I handed my PhD in just before the job, really. So I had my exam, my viva, where I defend my PhD at the start of actually this post. So it was quite a nice ease in to academia, shall we say. Had a really great time, but I decided towards the end of 2014-ish to apply for some more lectureships. Since I have now had some postdoctoral experience, I had some more papers published, I was a bit more competitive on the market, so I applied for some lectureships. So I got my first lectureship at Staffordshire University, where, as I say, it's a teaching, research and admin role, which I will explain. But I was joined as a lecturer in 2015, promoted in 2018, and I moved to Northumbria in 2019, and then spent 2 years in a COVID loophole of actually joining the university, but then not really kind of doing much in it because of COVID. But as I say, being a lecturer can have multiple parts to its role. Now, this is a real, deep breath, but this is a look at the different tasks that are associated with being a lecturer. It's based in New Zealand, but nonetheless, it applies to the UK. They've called it service, but it's what I've called admin. So teaching is as you would imagine, standing in front of a class or a Zoom and teaching a particular topic or syllabus. But of course, that's not just the story. You've got to then obviously plan that teaching. You've then got to actually plan not just that teaching, but also how it fits into the module. You've then got to then obviously think about the marking and also just the administration that goes with running a module. So as you can see here in the green, it's thinking about, you know, the designing of the materials, the communication with staff and students, to then thinking about, well, okay, how do you evaluate the course? All these things are part of teaching. So it's when you see me to give a lecture, that's just part of that kind of a whole journey with getting that together. We've then got service or admin, and that's where you may assist with the department or your university in running that particular provision. So, you know, it could be supervising students, could be doing reviews, it could be working on different initiatives, changing things, could be course leadership, leading students, a whole range of different things. We've then got research, which is where you then need to be thinking about new novel research questions, where you are, you know, writing grants to get money to do more research. You are writing up papers that you have. You are going to conferences. You are disseminating. These are all things that can happen in the same day. Like being an academic is certainly varied in your day-to-day going. Like even just me coming here to give a talk to you is varied. And that's something that, you know, is not normally in my kind of peripheral. But this kind of gives an idea of what it is to be an academic, at least today anyway. So some questions that I wanted to elaborate on. Well, when did I know what I wanted to do? Well, as you probably guessed, it was kind of as I got to that point, like in my undergraduate, it was like, okay, nearing the end, what do I want to do? Okay, well, masters, I like this, masters. I actually want to do a PhD. And then suddenly, you know, I have thought about other things. For example, you know, I went and I interviewed for other posts. I have also always thought about dabbling in other posts, such, you know, I've been tempted by some jobs in security service, but I quite like academia. So I imagine this is where I'll stay for, you know, the most part of my life. So when did I know? As I got through, as I kind of experienced things that people talked about before, about the process, and the end goal wasn't always there, but I was aiming towards something that developed as I went through, as I developed as a person. What made me successful in my MSc, PhD applications? I say likely because obviously I'm not necessarily sure, but of course it's showcasing my passion for the topic and the skills that are based around being a researcher. So, you know, think towards, you know, doing some assistantship work. So for example, I'm sure there's opportunities for you to work on projects in your university, you know, if you're currently a student, where you can highlight in your application that you have a passion for, you know, for asking real world questions, where you've developed this passion by working on these projects, or by doing this voluntary work, or indeed working on a particular topic, such as the psychology of conspiracy theories. It's also really important to think about, you know, support for MSc and PhDs, which has already been mentioned by, I think, most of the talks actually, is SciPag. I'm also, you know, a SciPag lover. During my PhD, whilst I was working all those 7 jobs, I actually was part of SciPag. So SciPag exists as a place for maybe you to get support, go to events, conferences, develop your skills, but we can also get involved in the committee and help run SciPag. So I got involved in SciPag quite early on in my PhD. I was involved in the social psych section, and also I took up some executive positions in SciPag itself. So for me, it brought a network and friends who were going through a similar thing. I was a PhD when I joined, but MSCs are also welcome as well. So for me, it was that community, but also it offered the opportunities to network with others in and outside of academia, which is nice. A lot of people from my SciPag days have moved on to different departments. So when I visit departments or I get invited to things, often there's someone from SciPag in the faculty, which is always quite fun to meet and mingle with. For me also, as being self-funded, it didn't plan it this way, but it meant that I also got funding to go to conferences. So being on, for example, the social section committee, the committee members got some funding to go to the annual conference, because they help run it in essence. So as a PhD who was self-funded, I actually got some funding to go and be at these conferences. Similarly, being a part of SciPag, you get a little bit, well, it depends on your day, but you got a little bit of support as well. So for me, it was beneficial, like so much so. But as I say, a lot of what I've said actually just applies to doing an MSc or PhD in general, I think. Of course, the doctorates are slightly different, which is obviously what my other colleagues have taught to much more than I can. But for me, it's this kind of genuineness that I think can apply. Some of the final things before I open up to questions. What do I love about being a social psych? Well, or rather being an academic, really. It's engaging with different audiences, what I've called key stakeholders. Now, a stakeholder can be anyone, really. It depends on what that particular thing is. So I engage with the general public often. So the public being, I do lots of talks, public talks, where people come along and learn about psychology. I engage with young people, which obviously was inbuilt when I worked as an ambassador, which I've kept on throughout my career to date. I've been able to work with the police, health authorities on different funding calls and ideas, which I think is really great to work with people outside of academia. As mentioned at the start, I'm also really lucky to engage with the media on a regular basis. I've done lots of TV stuff, radio stuff, stuff in print. So it's very diverse. If you look at that kind of that diagram again, it's very diverse what you can do in academia. I also get to ask and seek answers to weird and wacky questions. I can think of a question and then have the resource to go and try and answer what that question is. But of course, for me, they're always really important questions that impact our society. If you want to find out more about my journey, I have my full CV on my website, which if you want to scroll through, it is quite long. It's an academic CV, which means I include everything that I've ever done on the CV. I'm also quite active on Twitter, which again is something I picked up during my postgraduate days, mostly because that's when Twitter became a thing. Just as a final thing, my research is on the psychology of conspiracy theories. I am passionate about science communication, so on the slide here is just a bit of an overview of why some may believe in conspiracy narratives, which you can also find more on my website. So I believe that's probably 35 minutes-ish, which should leave some time for some questions, if you have any questions on being an academic. And I'll leave the slide on for a little bit so you can have a nosy at my infographic, and then I'll turn it to my face.
Thank you so much, Daniel. That was fascinating. You were wonderfully honest throughout, and I can definitely tell your enthusiasm both for the subject and indeed for the career that you've absolutely forged. So yeah, we do have some questions for you, and I'm going to start with, how do you disseminate your research so broadly? Is there any advice you would give to those who are looking to spread the word about research that they've been involved in?
Yes, this is something that I like to think about. So zooming into a novel base here, when you do a piece of research and you have that published in an academic journal, more often than not, it's behind a paywall. So which means that it's typically read by researchers who are also based at a university or have links to it. But also, often your stakeholders, people who are interested in your work, may also not have the skills or the interest to read a slightly sometimes boring academic article. So I like to think about different ways to disseminate that same article. So it's really important, of course, to have the journal article, have it there, peer-reviewed, sorted. But I then try and think of things that can then help kind of navigate that further on. So take an example of that is when we have the piece of work, I try and do a blog or some kind of a layperson friendly, something that someone with no interest in psychology could read. Typically, that is influenced by what we call a press release, which is something that I work with the university on. That is a summary of the research in a very kind of boiled down way that is sent out to media outlets. So like, for example, journalists to see, okay, can it be picked up and talked about in the media? And that I've actually got quite a some good opportunities from that. So that's one thing, so a press release, which again is something you work with the university on. But then there's also other things, such as a project that I finished at the start of this year. We had some money to commission some artists to draw some cartoons based on the piece of work. So it's a 1 minute animation that summarizes what we've done basically. So it's another way to kind of access an audience that may not have read the paper. So it's a way to kind of, you know, bring them in and then maybe link to the press release or link to the blog or something like that. But then it's also important to think about other stakeholders. So for example, some of the work I've done is relevant to government. So I wrote a short primer that I then submitted to an inquiry. So as a way to kind of push that research out further. So those are just some examples. I want to stop there because I don't take too much time with that, but there's some examples of how you could do your research, but then think of, okay, what other outputs are there? It takes time, it takes energy, but I think it's often worth it to get to not just other psychologists.
Yeah, definitely. And I think your energy is obvious, and I think that is key, plus your passion, as I said, comes through. And I think the other thing, as you were talking before, I've always thought if you need something done, then find somebody who's busy, and that's definitely you. The next question sort of speaks to that a little bit. So how do you balance your work and private life in regards to what you hear from clients and then workload and studying? So basically, how do you balance it all?
So, of course, being a social psychologist, there's no clients. The clients, I suppose, of course, are the research participants potentially, or, you know, students. But I think work-life balance is really important. During my PhD, when I was self-funding, it was really difficult. Obviously, money was tight, as I'm sure people are, but it was tight. So holidays were a struggle. Doing other things that were not based around PhD employment was a struggle. Academia in general can be hard to try and navigate that line, because as you saw from the graph, there's just so much happening, and often in the same day, so it can be difficult to try and keep on top of things. But I think trying to carve out your time where you do not check your work, you check your emails, you set your expectations of when you will respond to things, I think is really important to keep you going and you don't end up burnt out. I think it's really key.
Yeah, no, I definitely, that's a great point to make, and you know, very good to try and keep in mind, although it's not always easy, as I know that you will also reflect. Another question then, what advice would you have for those who are looking to get their research papers published? So what would you sort of give as a golden rule or a golden, you know, nugget for us to listen to?
I think working with others on it. So typically, a paper is published or has come from a project, a student project, MSc, PhD, it will always be collaborative, really. So I think very much working with your mentors and they can show you the journey of publishing a paper. Because of course it's never just writing it. Writing it is like just one part of getting that published. When you submit to a journal, it then goes out to peer review, and the reviewers will then have comments, and they will have comments that sometimes you don't agree with and sometimes are very long. So you need the expertise of your mentor to navigate that journey and to help you go through it with the rejections. Because, like, you know, most papers are rejected because, you know, you need to build on that feedback, for example, and you need to kind of make it better or think about it in a different way. So also having that community of people to help you is really important. So recently this week, one of my PhDs had a paper published. Of course, I've instilled my passion for science communication. So the poor lass, she's done a video, actual talking video. She's done a press release. She's done what we call a short article, a layout article on it, plus stuff on Twitter. I was like, you can tell you're my student. But anyway, but that has a team element whereby if she was doing it alone, it would be in the dark. It would be in the dark for me as well. I relied heavily on my mentor when I was getting into this journey. Whereas now I publish several papers, so I kind of know what the crack is. I kind of know what to do. So for me, it's working with others and really reaching out to your mentors.
Yeah, definitely great advice, and something I've already could reflect on from my own experience. So thank you very much for that. A sort of similar question, really, which is what advice would you give for when you're actually making those applications for further study? So looking back on what you did then, was there something that you felt made it particularly successful and that you'd recommend to us?
So it's always hard to say exactly because you never truly know. As in, like, I got the places and I got what I wanted. But so I'll try and say as from what I did, but also being on the other side. So I have 3 PhD students now. I also have several RAs. So I've been the other side of the table where I've evaluated applications. And it really is that passion coming through. So like even if it's a sentence of, you know, I'm really passionate about science communication. If someone says that, I'm like, great, let's have a look, let's see. If that there's no actual tangible evidence, I'm like, well, you've got such a passion for this. Where are you doing it? Like, I would expect you to at least have a blog, or at least to, you know, get yourself out there. Maybe you've attended events that you go to. Then you've tried to think outside the box of communication. You tried to, you know, reached out to your old secondary school to try and go back and talk about psychology with them. You're trying to think about things that you can highlight that you've done. So again, if you're telling me that you've got a passion for science, a passion for research and research questions, well, then I would expect you to talk about your project and how that was something that really developed your skills, how you maybe have enjoyed certain modules in your career to date, and what you've done in those modules. Maybe you've been a research assistant, so you took the opportunity to work with a member of staff in your department. It's showing evidence for your statement. Because we can all say we love science and we love science communication, but it's actually providing some evidence that is all accessible to all of us. I'm not expecting you to have been paid employment or to have commissioned artists. I'm expecting you just to have started to think about these things. That's pretty what I would advise from what I've done, and at least things that pop out to me as someone who evaluates his stuff.
Yeah, so bring the passion, but also bring a bit of evidence behind it. That always makes good sense. And I apologize to those whose questions I've had and I haven't been able to ask, but that is our time up. Just thank you so much, Daniel. That was really interesting. And I just want to now hand over to James, who's going to sort of go into the final session.
Thank you very much, Ian, and thank you very much, Daniel, as well, for that last talk. I'm just going to ask that our panelists just pop their microphones and cameras back on, because I'm really pleased to welcome back our panelists, some of our speakers from today. So I'm really pleased to be welcoming back Daniel. I know he's only just finished, so I'll give you a couple of minutes to get a quick break, and also welcoming back Dr. Jemima Fitzgerald, who spoke first thing this morning. Also Anna De Silva, who spoke with Emily Jones around forensic psychology, and finally Ben Amponsa, who did our talk around counselling psychology and his experience. I just wanted to start, while we're just pinning everyone to the screen, to say thank you all very much to our speakers, our panelists, and everyone involved today. It's been really great to hear from our speakers, and I'm really pleased to welcome the 4 of you back to this final Q&A discussion panel that we're going to have. For those that are listening and with us, you can still pose questions to our panel. I'll be working with Natalie to pose those questions then, and what we will do is I will, if anyone wants to answer it from the panel, please feel free to answer, and we can go around as we did on the panel earlier. So I'm going to start off with a question we asked at our previous panel, but I think it's really relevant for this to start with. This is, if you had to give one piece of advice from someone who isn't sure of the field they'd like to go into now, from your experience, what advice would you give in terms of how you made that choice?
I can start.
Brilliant, yes, thanks.
One of the things that I did was just start with bank shifts. So, for example, I joined the NHS Professionals Agency, and that enabled me to work shifts in adolescent units, mother and baby units, forensic services, community as well. And that way I can then, actually be in those particular settings and even ask questions in terms of how do people qualify, how can people progress in their careers in that particular setting. So that is something that I would advise people to do, to just apply for bank shifts and just start from there. or you can just, you know, reach out to people via, for example, LinkedIn. If you've seen something that, you know, is just like a post, for example, that's interesting to you, that just reach out to the person. They might not answer, but they might as well. So you never know. I would advise people to do that, but yeah.
Thank you, Anna. Would any of our other panelists like to add anything to that or share their own advice?
Yeah, I mean, I'd second what Anna said. I get quite a few prospective students reaching out to me on social media because they've seen things I put on and such like, or a post. And so I can give them I can give them my perspective on how I came to come into the counselling psychology route, really. Yeah, it's really about, you know, getting to know people who are on the journey, or who, you know, who are qualified, and you know, just immersing yourself as much as you can to get a feel. A lot of my colleagues, a lot of my cohort classmates and such like have looked at other types of route in like clinical and such like, and they've opted for counselling for reasons of, you know, familiarity or personal thing. But there's something about, you know, just really understanding and getting to know some of the people and the environment before you you make that choice. So I would definitely second what Anna said there.
Thank you, Ben. Jemima or Daniel, would either of you like to add anything?
I would agree with both Anna and Ben. And you know, for me, I knew I wanted to work with people as opposed to going into academia. That was something I knew, but then there's so many different avenues. So I decided on clinical for two reasons really. One was the funding, because I knew that, you know, that was a funded place. It was a paid employed position. So for me as a single parent, it was just a lot more straightforward if I could get in. But also I did some work experience. I spoke to people, like Ben was saying, I reached out to people. I spoke to people at university, lecturers. I spoke to, you know, one of my supervisors, my supervisor with my BSc for my dissertation. Her husband was a clinical psychologist. So I kind of picked her brains a bit and asked her loads of questions about what he did, and just kind of hungry for information really. And I think that's the best approach.
Definitely.
Yeah,
I agree with what everyone said. I mean, it's very much reaching out also to your careers advisors at your university. They have a whole host of information. Like I know, at least at my university, they can advise you on all different parts, both inside academia but also outside as well, which I think is really important to think about. And also, it's thinking about what really interests you, and I bet there's something psychology based in that. Like even when I was, say, during my second year, I was really interested with you know, airplane crashes. Like you can still even apply psychology in that field, for example. And I swear, I don't know how close it was to me following that journey. And I bet you would have had a bit of social psych in there as well. So it's really thinking through, okay, what do I enjoy? And then how can I bring those passions together? And I bet there's probably a career out there that would do those things. Make Google your friend, I suspect.
Yes.
Thank you. Thank you for that. I think some really good points from everyone there in terms of kind of reaching out to your network, listening to other people, but reflecting on yourself as well. I think really important in terms of your likes and motivations, your values and your passions as well. Another question that was posed, I think it was slightly earlier, but actually is a question probably that applies to everyone's field, and in terms of the changing political natures. So how do you manage the changing political climates and the impacts that it might have on your workplace or the role that you do? So, you know, when there's for example, if there was a change in government and there was a policy that impacted your particular work or the role that you do, how do you find you manage that, the impact of that?
It's an interesting.
What a question, and obviously it's recorded as well. Like, say, like.
I mean, I can say something briefly, and then hopefully other people have time to think of something much cleverer. I know that it's a constant tension in terms of, you know, lack of funding, you know, lots of things. And I certainly know in roles that I've had that we are affected by policy, we are affected by who's in government. So it can be difficult. It doesn't affect me personally in my role in terms of how I am with clients. So I know that at the heart, I work with my values. I work, you know, I have a very strong reason for why I do my job, and that feels okay. I think for my own mental well-being, it's nice that I'm not totally reliant on one employer, but I also have my own private work outside of that, which makes me feel I've got a little bit more autonomy. That's just a personal choice.
Thank you, Jemima. I think really good answer. Is there anything anyone else would like to add to that one?
I mean, look, you know, there are certain things that kind of can affect us. Like, so in my talk, for instance, I mentioned that the government opened up funding for doctorates to the student loan system. So political sort of decisions like that can have a big impact to your sort of choices as a student and such like. But also then, you know, within what's happening at the moment, I mean, at the moment, for instance, our division of counselling psychology, and I'm sure a number of the others, I know the BPS is, you know, we're really looking at the impact of climate change and climate justice, and taking a position which might be considered to be quite, well, certainly progressive, you know, but it is kind of maybe more political than you might have thought might be the case. But I can say from my perspective as a trainee counselling psychologist and as a psychotherapist that, you know, we have to be thinking about these sorts of things, because it has a massive, you know, the people that come into my practice room often are bearing the brunt of a lot of this. And so to a large extent, you know, I kind of think that actually in many ways, you know, the division and the BPS kind of came a bit late to it, because, you know, we were seeing it at the front end already before all the stuff came in. So, you know, stuff like that, I think is important. And I think it's important that our governing bodies and our, you know, learning bodies reflect really, you know, the progressiveness of what it is that we're trying to do as psychologists. So that would be my perspective on that.
Ben, I think, yeah, both yourself and Jemima raised some really good points about what kind of governing bodies, professional bodies can do. And then Jemima, your point about just remembering the role you're doing in terms of the service user that you're working with as well, I think was really good. Thank you very much for that. My next question is one we've touched on again a bit with some of our speakers. One of the things that has come across from me from listening to everyone today is just the wealth of experience that we've had or represented from our different speakers. And how do you have any time management tips when it comes to juggling a lot of different activities or a lot of different things?
I found that question a bit confronting, because I was not good at it at all. You know, balancing my social life with work. As I said when I was giving my talk with Emily in the beginning, I was very desperate about progressing with my career. I had a set timeline. You know, this was going to happen in 2 years, in 5 years, in 10 years, and nothing happened in that in how I had originally planned. But I guess that I guess for me personally, in the last 2 years, I've just been trying to make the most out of my journey. It has been one of those things that, you know, you're not promised tomorrow. And I think it's been one of those things that has been forced upon people in the last 2 years. So, for example, I got very sick during my first year of my doctorate. And it got to the point that I was like, I can't do this anymore. I need to choose my health over my progression of my you know, completing my doctorate at that period in time. So I felt like I was forced to like rest. I was forced to take a step back to, you know, think about your mental health, focus on your loved ones, and just, it kind of like put things into perspective for me anyway. But I think that as we tried to portray with our talk, I think it's something that is very important. We don't talk about it often enough. we need to spend time, to just rest, spend time having fun, laughing, spending time to, being actually organized, knowing when it's working time and when it's time to just for yourself, knowing when it's time to spend with your family, knowing when it's, when to separate the two, when you've got Anna that's studying, you've got Anna that's working, and you've got Anna, the sociable Anna. That's how I've been trying to do it in the last couple of months, if not years. But it's very difficult. Something that I found very difficult, but I've been trying to become better at it. But yeah.
I suppose I would add, it's difficult when you do something you like. So to try and draw the line when, at least being academic, you're never finished. There's always something else. It's always, your to-do list always has something on it. And when things that you like doing, sometimes it doesn't always feel like work sometimes. So it's hard to try and think, okay, no, you don't need to do that. You need time away from the screen, even if you are doing things that you enjoy doing. And often some of the things that you want to do, you can't always get to either, because typically things come in your inbox that are more urgent, and that can then, things that you want to do could be left. So I guess it's all around time management in how you work in the workday, and then to say, you can love that, but you can also love other things. You can do other things rather than just that one thing. I guess it's that balancing act.
Yeah, absolutely. I mean, again, certainly from the perspective of myself as a counselling psychology trainee, it's so important to make sure that you look after yourselves, because these courses are pretty relentless, it has to be said. There's no two ways about it, whether you're doing a doctorate forensic or clinical or counselling or whatever it is. They are pretty relentless courses, with all the demands that are placed. And so it's really just so important to look after yourself. So, my decision to take a year's interruption, which was fully supported by the university staff and the management, was because I knew that I was going to break if I carried on at the pace that I was going at with everything that was going on. And it was I had misgivings about it, but the reality of it is what was suggested. I thought, yeah, that's what I need to do. And as soon as the suggestion came out, I thought, I do need to take a break because I'm pretty knackered. And so, it just gives you that chance to sort of reset and such like. But as Anna was saying, I think even within, when you're in the middle of it, it's so important to keep time aside for your partner, for your friends, for family, just to reset and to restock, and just, because as Daniel was saying, it can become all encompassing, before you know it, that's your whole life is work and studying, so look after yourselves.
I agree with everything Ben just said. I know for me personally, it is relentless. Doing my psychology degree straight after leaving my first marriage, it was hard work, and you're trying to gain all this work experience alongside it, and obviously look after yourselves, you don't burn out, but it's a balance. And then I got onto clinical training, and it was a push. And then I got my first job, and it was a push. And then I set up my own company, and it's push. And then I got to a point where I was finding it very hard to turn work down, because when you're self-employed, it's like, well, I might not get asked to do something again. I've got to keep pushing. But when do you stop? And so I did get to a point where I had to reevaluate things, because I was on the brink of burnout. I didn't actually get there, but I know I was getting there. So I did. And, for me personally, it might sound a bit strange, but I diarise my own personal time. I block time out in my diary where I am not allowed to look at my emails. I'm not allowed to do any work. And I need that sort of discipline of doing that. Just works for me. And having a rule about what time I will stop checking my emails, for me, helps. I have a little bit of a ritual when I leave work, with it just getting changed out of my work clothes. That helps me. Just finding ways to boundary my day really, really does help me.
Yeah.
So finding ways that work for you, I guess.
Brilliant. Thank you very much. I think, again, some really good advice in there, and I think it's really positive that I think all of our speakers have mentioned about that, taking the time out that you need for yourself, because sometimes I think historically when we think about careers and career planning, it's almost you have to do so much, but actually taking that time to giving yourself the time and giving yourself the permission to look after yourself as well, and self-care is just really important, I think, as part of that. So thank you very much. So on to our next question, which is, if you had to, and this might be a difficult one, but if you had to pick one thing that you said was your favorite thing about your current role and what you're currently doing, what would you pick?
So for me, I'd say it would be the client work, the client facing work, you know, the fulfillment when people are just in a much better place, and you've helped them to find out what it is they need to do to get to that point. For me, is probably still gives me the biggest inward smile. And you know, and that of course applies to my counselling psychology doctorate as well, of course, because of the clinical placement element of it. And actually, I will also say the research. I've been really, really enthused. I don't know whether that's a bit big-headed, by my own research, but by getting into this sort of area of research, you know, and it's just been nice. You know, people have been saying, "I hear you're researching this. You know, can I look at it?" And I said, "Yeah, when it's published." And you know, it's just nice. So that sort of research and the sort of client-facing stuff for me.
For me, in one of my roles working in the prison as the principal psychologist there in the mental health team, I love the client-facing work. There's loads of it. I probably love everything, to be honest. I just like it all. But my favourite thing at the moment is running training for the prison staff on trauma-informed work. So to help them, so that feels like it's having more of an impact than just working. You know, I can spend an hour with a client one-to-one, but actually being able to work with, you know, a multitude of prison officers, helping them to think from a psychological perspective, not just seeing the behaviour, but actually understanding the trauma behind it and developing a more compassionate approach has been really fulfilling. So I love that.
I mean, for me, I'm currently training, so it's a little bit different, but from my previous experiences, I can definitely echo what Ben and Jemima have said. But one of the things that I have been doing alongside my training is obviously my work with the BPS with the Division of Forensic Psychology. And I've surprised myself that I've actually been enjoying doing my speaking engagements, you know, speaking for the next generation of forensic psychologists. I would definitely say that 2 or 3 years ago, I would have never I found my face in a space like this. But I just feel that, you know, because of how difficult my journey was to get onto the training, one of the things I've always said to myself is that when I one day qualify, I literally don't want anybody to go through what I have been through. I want to try and make, you know, everybody else's journey that little bit easier, whether it's, you know, finding more information or finding people that they can, you know, just network, speak with, asking questions. Like, that's really what I want to do, push on, you know, motivate others to actually, you know, pursue their dreams of becoming a forensic psychologist. So that's really what I've been enjoying so far. But definitely the training itself, you know, just meeting different people, getting to know the lecturers, you know, actually being involved in things that I never thought I would. You know, and looking back and thinking, wow, I've actually really changed. I'm actually becoming somebody that, you know, possibly 5 years ago, I really admire the person that I am becoming nowadays. So yeah, that's definitely it for me.
I think it's worth saying, to say one thing is a difficult question. So that person is really mean to make us all say one thing, because it's almost impossible to choose one thing, because everyone else has had a challenge as well. For me, I suppose, thinking it's hard, as I say, but I can change. So whether it's change in a research finding that you can then communicate and have change with that. So change a policy, change the way someone works, even just knowledge and being able to talk to someone and for them to understand something a little bit better, I think is really, really inspiring for me, all of us potentially. So in a way, it's back to that communication, whether it's communication of stakeholders or indeed back to the students, and showcasing the learning journey, which I suppose is a real challenging thing to do, but I think it's really motivating as well to watch and be a part of.
Brilliant, thank you. And yes, thank you for those responses. It was a very difficult question to choose from listening to you, all four of you speak today. It's something that's come across as you could probably list reams of reasons as to the fulfillment you get from your roles and the enjoyment you get from it. So thank you very much. What work experience have you had that's most impacted on your career?
I think for me, it was definitely my first job after doing my undergrad. So I started working in a psychiatric intensive care unit. So for those that don't know, it's for people who are very mentally unwell that go there. And the unit that I worked with was just for men. So I literally just come out of my degree. I thought that psychology, you just need to talk to people, a lot of therapy, the person will automatically change. No, it was a shock to the system, but it was it was where I learned the most in terms of what mental health is actually like. You go to uni, you read case studies, you probably watch videos and things like that. But when you actually interact with somebody that's struggling with their mental health, for me personally, it was completely different. It was such an eye opener. It actually made me be like, I really want to help you. I really want to see you become the best version of yourself again. I really want to help you gain the skills and the knowledge that you need to understand your illness, to keep yourself well, and to go on and achieve whatever it is that you want to achieve. So for me, it was most definitely my very first post. And it was a healthcare assistant. I was working alongside nurses, psychologists, we had training, we laughed. It was like a little family that I had outside of my own biological family. So for me, I'll never forget that, that type of experience that I had. I'll never forget the people that I worked with. To this day, even though it was 6 years ago that I last worked with them, to this day, I still keep in touch with them. So for me personally, it was such a very special type of experience that I gained. And like I said, I'll never forget it.
Thank you, Anna. There, that was a great answer. Would anyone else like to add to that, or say what work experience they've had that most impacted their career?
For me, I could say quite a few things, but I think every single work experience I've ever had, even working in a pub, every single job I've had has helped. I've learned so much, and it's really helped me to be able to relate to different types of people. But post-qualifying, working in a hospice was absolutely life-changing. That was my first qualified post. And although, I was working as a clinical psychologist by that point, but actually you can work in hospices at any point in your life. You don't need to be qualified. And working with people at the most vulnerable, people who are facing death, families who are facing loss of a loved one, it was being able to sit with that level of distress and be containing and do your best, of whatever that is, to be able to sit with it, for me was life-changing. So yeah, I was a clinical psychologist, but actually you didn't need to be to do that part of the role, and that was the most valuable part. So I think that changed me. And speaking on a human level, less than a year ago, my second husband died, and having had that time working in a hospice, it was so valuable. And I'm now as a clinician able to sit with any level of distress. And I can't say I'm unaffected, because we're all affected by who we work with, but actually I think being able to face fear, being able to face death, the fear of death, all of that stuff, which underlies so much of human distress, actually. It really changed me for the better, I think.
So obviously my journey has always been academic in the sense. So thinking back early when I first started the journey, when I was a mini academic, as in, you're assisting, I was still doing some teaching, I worked at the university teaching. These are all things that developed my experience and in essence made my CV, so that when it came to applying for academic posts later on, so even, well, postdoc and then of course my actual lectureship, you need that experience. So back to the point of, if I'm saying I've got a passion for teaching, well, how have you got a passion for teaching if you've never taught? So it's taking the opportunities up when you possibly can. So, if you do get onto a PhD, you haven't got to teach, depending on your journey, and your funding. You haven't always got to teach, but I think it offers so much benefit, and also it's good for your CV as well, and never mind your skill development. So for me, it was very much dabbling in all elements of being an academic that made that CV academic CV, if that makes sense.
Yeah, so I'd also just like to add, so the work experience I think that's kind of really stayed with me is the work that I did at the LGBT Foundation when I was doing my counselling qualification, and it's obviously volunteer therapist work, and I really immersed myself in that, in issues around sexuality and gay affirmative therapy and things like that, or queer affirmative therapy, I should say. And that's kind of stayed with me, and even into my work as a trainee counselling psychologist, because that's my research is focusing on intersectionality specifically. So what I would just say to you is, whatever you choose something that you're really interested in, where you decide to go and do your work placement. Try and find something that really touches you, that you're really interested in, because it may well be something that that stays with you for a long time, that you can take into your doctorates in terms of research and such like. And if that is the case, it just makes it that much easier to get stuck into it, because you're just really enthused by that work.
Thanks very much, Ben. I think, again, some really good bits of advice there, and reflections on your own experiences from you all there, in terms of either particular events that have been quite transformative in terms of your career, but then also the reflection on that as well, and how that's then informed your future career path and the decisions that you've made. So yeah, thank you for those insights. We've had a couple of questions around postgraduate study and training as well. And a few people are asking, what advice would you have about how people can improve their chances when they're applying for postgraduate training, and what can they do to make themselves stand out from your experience? I don't know if anyone has any advice that they would like to share on that.
I always tell people to just be yourselves. Don't try to be somebody else. Or if you've read other personal statements, which you can do, you can ask people whether or not it would be okay for them to share their personal statement with you, but don't copy it. Reflect on your own journey. You'd be surprised of how much experience, how many different skills you've already got. It's just that you are trying so hard to get onto the training that sometimes you just forget. But another tip that I always give to people is that even if you're not yet working, what you could do, just get like a little reflective journal, even if you just reflect on your day-to-day, even if you're doing, charitable work experience or anything of the sort, you can write down what you've done, and then you can always go back to it, and then you can read what it is that you've actually done, and then you can just remind of yourself, what you've previously been, what you faced previously, what kind of clients you faced previously, what was it like working in a team, because not everybody's good at working in a team, so it is a skill that you're obviously going to have to work on. But like I said, just be yourself. Don't try to be somebody else. And I think that you also have to be proud of where you've come from. That is part of who you are, and that's going to be part of the clinician that you're going to or aiming to be in the future as well. And so you'd be surprised how easy clients can tell when you're not being yourself. So it's a skill that you master from early on. But yeah, that's the advice that I would give.
I was just thinking, know your skill sets. So think through your experience to date and the skills you have developed, and often it's skills that you don't even realise you developed or what they are. So that could be highlighted by talking to others, your peers, the academics who are on teaching you, for example, to talk through the skills that you do actually have. And I suspect you have plenty, but you're not necessarily utilising them or realising. And then maybe the skills that you want to develop further, or the software, or there's things that you know will be useful in a career that you want to go into. So kind of thinking to the future and trying to develop those skills. But for me, a skills audit sort of thing, just so you know what you've got.
Yeah, and certainly the counselling psychology courses will be very interested in what you want to do on research. So kind of adding to the point that I was making about the placement you find, but that can maybe inform your research. You know, if you kind of go with something that's interesting and such, that can often be a sort of something that can really give you a boost. And the other thing I would just say also, if you're applying for counselling psychology courses, if at first you don't succeed with one, try all of the different, there's a lot of them. I think there's 20 odd establishments, and then there's the independent route. You know, they all have different criteria, and you know, and I would just say be prepared to travel. Look, I'm doing my doctorate in Glasgow. I was potentially going to be doing it in London. I eschewed the Manchester University course because it doesn't do part-time. So you can just be prepared to be flexible yourself, but also if you don't succeed with one place, try another, and you may well find that you succeed.
And just to add a final thing, I think I said it in my talk, but if you're applying for clinical training, I know that on the application forms, it's really important that not so much what you've done, but what you've learned from what you've done. I can't stress that enough. So being able to talk about why that post or that job that you had or that research project you did, why that was beneficial, why will that make you a better clinical psychology trainee? So really developing your reflection skills and then putting that down concisely on paper is really important.
Brilliant. Thank you very much for that, Jemima. I think, yeah, again, some really good points from you all there in terms of reflecting on your experience and articulating that, and just thinking about your own unique journey into or how you've got to that stage you're at in your career is really important. I'm going to finish with our final question. We've had a few questions come in, and so I'm just going to try and pull the last one together. And it's something that I think within lots of different career areas, and psychology isn't an exception, we often, when we talk about the career journey, we talk about the educational pathway into it, so the qualifications that you need to do. But actually, there's lots around that in terms of your personal journey into that. At what point was it you found that psychology wasn't just a job, but it was more than a job? It was almost, for want of a better word, your life as such.
If I could go first, I mean, I kind of think I was kind of in that frame of mind when I went to university to do my first degree, actually. And I think that's why, as in my presentation, that's why I just kept cycling back to, I mean, I could have stayed in the army, you know, I could have stayed in the corporate part of employee assistance, but ultimately I just kept cycling back to psychology because I ever since I was an undergraduate have seen it as something that was very much a part of me. You know, I didn't just do psychology because it was trendy, and which it was at the time I went to think. I did it because I genuinely believe in it as a subject, and it really is a part of me. And so that's kind of how it is. And that, I think, is why a lot of people have said to me, you know, you're a very well established psychotherapist. You have no reason to be doing a doctorate in counselling psychology. And I said, yeah, you're right. But the reality of it is that's what I want to be. You know, it was never about becoming a counsellor or a psychotherapist or an EMDR qualified therapist. It was about becoming a counselling psychologist. It was about becoming a psychologist. And that's really the journey for me.
And yeah, so that end goal, having that in mind as well. So yeah, thank you for that. Any of our other panelists like to answer that or add anything to what's been said?
I'm happy to go next.
Yeah, sure, Joanna.
Similar to Ben, it was never for me, because I came into psychology, my BSc I started when I was 36. So I didn't do this because I fancied doing a degree. It was never that. It was because I was passionate about the subject. I didn't know I wanted to become a clinical psychologist, but I knew that I was really interested in the subject of psychology. I wanted to understand, the world better. I wanted to understand people better. I certainly wanted to understand myself better. And, during the course of my studies, and, I've had periods of having short amounts of therapy or long amounts of therapy. So for me personally, it's been a part of my interest. It's been a part of who I am, and I passionately believe in it. So it's not, for me, no, of course it's not just a job. It's where my values are, and I guess that's why it's also fulfilling. I don't think I'd want to be a psychologist if I didn't feel that way. So yeah.
Thank you very much, Jemima. That was really insightful. I think, yeah, that again, starting at that end goal and then moving backwards. So actually focusing on what is it that really resonates with you, what aligns to your values, your motivations, and what gets you out of bed in the morning as such, really. And then look at using that as a starting point and then working backwards and right, how do I get there as well? So thank you for that. Daniel and Anna, is there anything else you'd like to add at this stage, or are you happy to move on?
So for me, it was kind of similar. So I did struggle to my mental health in kind of like my late teens. So when I reached out for help with my mental health, or when I opened up to my family, I was struggling with my mental health, they were like, what is that? Coming from an African background, there's like a massive stigma when it comes to mental health. And there's also a lack of knowledge when it comes to mental health. So then when I chose psychology as my GCSE A-level, and then when I decided to do that as my undergrad, I was really going with the intentions of thinking, how can I understand myself and my community better as well? And then when I decided to do forensic psychology, it was when I was starting to see what I would personally call, all of these injustices in the world that were against the Black community. So I was like, do you know what? I actually want to try and help, even if it's like my 2 cents, even if I just get my 5 minutes where I just say something that is going to reflect the struggle that the African, the Black community has in this country. Let me try and help and support somebody in one way or another. But obviously, during my journey to get there, the struggle was that I obviously wanted to do that. That was my ultimate goal. But then during my journey, I did not see anybody that looked like me. So I was like, how am I going to do this? I'm fighting to try and get there, but who's going to help me to get there? Because I do not have anybody that I could reach out and ask for help or direction or anything of some sort. So then when I did get onto the doctorate, it was a massive surprise for me. It was like, okay, I'm kind of here now. So what do I do? And I guess it was from there that I just tried to increase my network. There was an event that was going on, and I said, do you know what, let me just try and help at this event, even if it's just sitting people down. Let me just try and help. I'll get to know people, and maybe I'll get to increase my network as well. And the event was for Black and ethnic minorities in psychology and psychiatry. So that was my first speaking engagement just before I got onto the doctorate. And from there, it was like a whole new world opened up. I met so many amazing people that looked like me, that had so much knowledge, that were as passionate as I was about forensic psychology and all different types of psychology as well. And I was like, wow, like we can actually do this if we support one another, if we listen to each other, if we learn from each other as well. And if only we can put all of this together, like we can actually try and make the world a little bit of a better place. So that has been sort of like my reflective journey so far. And that's literally what I want to try and attain. So the reason, first of all, I'm doing forensic psychology is literally, I want to try and help people who do not feel like they can speak for themselves, people who do not feel as though they are understood. And so as a Black forensic psychologist, and one of very few currently in the country that is training, that is, I literally feel like, do you know what, let me try. And whilst I am trying, let me bring everybody else alongside me. So yeah, that has been definitely my journey and my encouragement to persist in this very difficult but very fulfilling journey. Yeah.
I know time's gone, so I was going to say, follow your interests, follow what interests you, and I'm sure you'll smash it.
Thank you very much, everyone, for that. And just finally, to finish, I think there were some excellent points made in that last question, but just to offer my thanks to Daniel, Ben, Jemima and Anna